Yeah, good morning, all.
Good morning, sir. Good morning.
Yeah,
Good morning, sir.
yeah, good morning, all.
Yes, ma'am.
Good morning, sir. Shall we start the program, sir?
We have to wait for our Dr. Karthik and the speakers like Professor Sunita Madam, Vaidya sir.
Okay,
Okay.
sir. Yes.
Sirisha Madam, just search. Once they enter, we will start.
Okay, sir. Okay, sir.
I am also seeing.
Yes. Sir, one name is this, sir, Karthik. He is our guest, sir. Shall I make
Yeah,
him?
yeah, Dr. Karthik.
No, only
Dr. Karthik, are you there?
Yes. Only Karthik name is there, sir.
Yeah, yeah.
Yeah, I'll make him unmute, sir. Actually, we taken this control, no, sir. They can't unmute themselves. So,
Yeah, yeah.
shall I unmute
I
him?
think you can unmute all for the time being.
Okay, sir. Then, okay. Yeah.
After the program begins, then you can mute all and keep only me or Jyoti Madam. When they are speaking, them only that individual will be unmuted.
Okay. Okay, sir. Sir, Yogendra Kanchapu. I will make him co-host, sir.
Yeah, yeah. Yeah, you make Dr. Yogendra as co-host.
Yes, sir. Yes, sir. He's there, sir.
You can unmute all. Once the program starts, we can mute everyone.
Yeah, yeah. Everyone is, they can unmute and talk. Sir.
Yeah. Hello, Dr. Yogendra. How are you?
Hi, sir. I'm doing good. Hope you are well.
Yeah, fine. This is our third one-day conference,
Nice.
which is totally online.
Okay, good. So, previously you worked on similar lines of like infectious or else, what are the sort of
Not
other
infectious.
topics?
One on World TB Day, we had a conference.
Nice. Okay.
World TB Day, we had a conference, and then the other ones are related to clinical trial and novel drug delivery system.
Nice.
And
Good to know.
frankly speaking, out of my 25 years of experience, hardly, not even a single time we have done a conference on community pharmacy or hospital pharmacy.
Okay.
I don't know why, but we keep doing in clinical trial related IT enabled sector or advances in pharmacy sector, NDDS or something. But this is for the first time we have done. We are doing. I'm very happy about it.
Right. Sir, Manjari ma'am have joined.
Good morning, good morning, Professor Manjari Madam.
Good morning, everyone. Thanks for all the arrangements. And I think we may start if the participants are there. The other speakers will be joining in.
Yeah. Uh, Sirisha Madam.
Yes, sir. Yes, sir.
Yeah, we can start.
Okay, sir.
Meanwhile, the students keep joining.
Okay, sir.
We can start the event.
Yes, sir. Yeah. Good morning, everyone. Richa, are you
Yes,
there?
ma'am, I'm here, ma'am. Shall we start the event, ma'am?
Yeah. We'll start the program.
Okay, ma'am. Namaste, a very warm welcome to all the attendees attending this event. With due respects to our chairman, sir, Mr. Prabhashankar, principal Dr. V. Jyoti, ma'am, and director Dr. N. Srinivasra, and respected lecturers, we would like to start this program. We would also like to welcome and thank our distinguished guests to take out their precious time to educate us.
This is Gauri, Akanksha, Richa, and Rachna, respectively. We will be your hosts for today, and please deal with it.
We have assembled here for the day of one-day virtual conference on Jan Andolan, Mission for Tuberculosis-Free India. India has the world's highest incidence of TB with 2.8 million cases annually and accounts for more than a quarter of the global TB burden. India also has the largest burden of multi-drug resistant TB among all the countries, with among 150,000 cases every year. With this brief introduction, I would like to hand over the session to Richa.
Thank you, Akanksha. Let us start today's program with a prayer song by Apurva from B Farm third year. Apurva, over to you.
Richa, am I audible?
Yes, you're audible. You can go ahead.
Mam pahi sharade vandanam kamalalochani vandanam Mam pahi sharade vandanam kamalalochani vandanam Mam pahi sharade vandanam Veda Vedantalu palikino ni nota Akshayamalalu virisenu pudota Veda Vedantalu palikino ni nota Akshayamalalu virisenu pudota నీ స్మరణ చరణములే మాకు గతియని కొలిచితినమ్మా శారది మాం పాహి శారది వందనం కమలలోచని వందనం మాం పాహి Thank you.
Thank you for enlightening the morning, Apurva. We would now like to request our Honorable Director, Dr. N. Srinivas Sir, to speak for a few minutes and deliver the welcome address.
Thank you, Richa. Good morning, all, and respected Chairman Sir, Dr. B. Prabhashankar Sir, President IPA Telangana State Branch, Managing Director of Leeds Pharma, our Secretary Sir, Dr. Sri Sainath Dayakar Shastri Garu, our Honorary Treasurer Sir, Sri B. Lakshman Sinha Garu, our Joint Secretary, Mrs. Deepali Sanjay Garu, and our respected Vice Chairman, Dr. A.V. Srikant Garu. Hearty welcome to all of you, sir. I take the privilege of welcoming today's distinguished guests from Indian Pharmaceutical Association Community Pharmacy Division, Professor Sunita Chandrasekhar Srinivas Garu, Visiting Professor, Rhodes University, South Africa, Special Interest Group Member of IPA Community Pharmacy Division, respected Sri Raj Vaidya Garu, Co-Lead Antimicrobial Stewardship Initiative, IPA Community Pharmacy Division, respected Mrs. Manjari Gharat Ma'am, Vice President, Indian Pharmaceutical Association, and Chairperson of IPA Community Pharmacy Division, and our Dr. Karthik Rakam, President, Pharmacon Society for Pharmacy Practice. And I also welcome Dr. Gautam Kalyatanda Garu, Infectious Diseases Specialist, Assistant Professor, University of Florida, USA. And our Dr. Yogendra. A hearty welcome to all of you to this one-day virtual national conference on Jan Andolan mission for tuberculosis-free India. I also welcome Dr. Jyoti Madam, Principal, and I also welcome all our faculty members and my dear budding pharmacists, invited students and delegates from outside the college, and non-teaching staff of various colleges of Exhibition Society. A warm welcome to all. It's a matter of serious concern to all of us that India, despite a lot of policy initiatives to eradicate tuberculosis, despite providing free medicines at all primary health centers, despite all this, in 2019, we stood on top in tuberculosis related deaths. To look into why. So instead of that, what our modified vision of our government initiative is to eradicate by 2025. Now that rightly our IPA Community Pharmacy Division is actively holding lot of awareness camps, awareness conferences on the spreading of this tuberculosis, spreading of the information related to tuberculosis. I am confident that the mission of our government that to eradicate tuberculosis and to declare India as TB-free country by 2025 will be successful. Dear students, we have been teaching about hospital pharmacy, community pharmacy throughout our lectures and all that. But this particular conference will enlighten you on the practical significance that a community pharmacist plays role in India. If you look at any hospital or a group of doctors, you know how many patients can they treat? It's some number, maybe 100 or 200 or 1000, but a community pharmacist, by spreading information about the tuberculosis, the facts about it, and about major problem with treatment is majority patients stop using the medicines after 3-4 weeks, because in 3-4 weeks, with the kind of medicines that we have, all the symptoms will go and the patients will stop it, despite our medical professionals repeatedly tell them that you have to continue for 6 months and all. It doesn't happen. So here comes the role of community pharmacies, the kind of availability of professional pharmacists that India has. If properly they are utilized, you know, we can do the difference. It is not hundreds or thousands of patients that can be treated, but lakhs of people. The awareness on the use for the prescribed period and awareness on multi-drug resistant strains which develop because of wrong use of medications. And I think our speakers will enlighten me more about this, that multi-drug resistant strains are the reason for majority deaths. So dear students, as I was telling, this is for the first time that out of my 26 years of experience, we are doing a conference on community pharmacy. Thanks for the speakers and Dr. Karthik who motivated us. We will continuously do more conferences on community pharmacy, and even we conduct more medical camps also once the pandemic is over. So this community pharmacy is a very, very important service that we can do to the society, as I call it, as a professional. So with this, I welcome you all to this event. And this event, dear distinguished guests from Community Pharmacy Division, after the lectures, we are having elocution, we are having poster presentation, and also innovative ideas to eradicate TB. And the students are showing lot of zeal, enthusiasm. And one student today morning, she texted that, you know, door-to-door information spread is possible if it can be clubbed with election campaigning. I didn't know what to respond to that message, but it's not possible. But door-to-door campaigning is happening for election campaigning, but not for the tuberculosis or other infectious diseases. I think our community pharmacy division and we all put together will make it happen. With this introduction, I welcome you all once again to this virtual conference. Thank you all.
Thank you, sir, for your kind words. Now, I would like to request our beloved principal, Dr. V. Jyoti ma'am, to address the attendees.
Yeah, thank you, Richa. Good morning to our Honorable Chairman, Dr. B. Prabhashankar Garu, our Honorable Secretary, Dr. Sainath Dayaka Shastri, Director, Dr. N. Srinivas, Vice Principal, Dr. Sarita Madam, the teaching staff of our college, and our students. Well, students, you all know that every year, 24th March is being observed as the World's Tuberculosis Day. This day presents an opportunity to mobilize public awareness for fight against tuberculosis, one of the world's top infectious disease killer. Just to recollect, why 24th March? It was on 24th March in the year 1882, Dr. Robert Koch had astounded the scientific community by announcing the discovery of the microorganism which causes tuberculosis. He was awarded a Nobel Prize in Physiology and Medicine in 1905. Well, according to WHO, TB is a worldwide pandemic. Among the 15 countries with the highest estimated TB incidence rates, 13 are in Africa, while half of all the new cases are in the 6 Asian countries, namely Bangladesh, China, India, Indonesia, Pakistan, and Philippines. There were many programs initiated to eradicate tuberculosis, but today India's DOTS, that is Directly Observed Treatment Short Course Program, is the fastest expanding and the largest program in the world in terms of patients on treatment, and the second largest in terms of population coverage. Well, the slogan is the fight against TB through Jan Andolan. Jan means people, Andolan means movement. Jan Andolan is it gives an effective communication. It helps to reach maximum population, and it can be complemented with preventive, diagnostic, and curative aspects of TB management. More than that, it has got a mass media coverage. Well, every challenge possesses an opportunity. It wasn't easy to eradicate polio in a populous country like India, but with the firm determination of all the stakeholders, India managed to eradicate this disease, and the polio eradication program became a model for other countries to follow. To quote, "We have come a long way in our fight against the deadly disease, but as a famous English poet, Robert Frost said, 'Miles to go before I sleep.' We still have miles to go before we will make this planet TB free." WHO, with its Stop TB strategy, has given a vision to eliminate tuberculosis as a public health program from the planet Earth by 2030. But our Indian government has kept focus to eradicate TB from the country 5 years before, that is by 2025, through its National TB Elimination Program, DOTS. Indian Pharmaceutical Association, with its Community Pharmacy Division, CPD, has a flagship project, which is Public-Private Partnership Project, engaging pharmacists in the revised National Tuberculosis Control Program. Dear students, we have many eminent speakers, like what the director sir has said, who are going to give us the information, what are the programs and the steps taken to eradicate tuberculosis and make it free from India. With these few words, I wish success for this conference and welcome all the distinguished dignitaries to the program. Thank you.
Thank you, ma'am, for addressing us. We now are honored to also have our chairman, sir, Dr. B. Prabhashankar, sir, among us. Sir, if you would please speak a few words.
Sir, Prabhashankar, sir, are you there? Looks like sir has a few.
Sir has not joined.
Issues. Yes, sir.
Sir has not joined. Let us request the Honorary Secretary of IPA Division, Sri Ram Prasad Garu, to address the gathering. Ram Prasad, sir.
Yep. I think. Good morning,
Our governing body member.
You're able to hear me?
Yes, sir.
Good morning to everybody. I thank all the guest speakers to join in this very important program, and we know very well that tuberculosis is one disease which is making the poor people to become further poor, and we are losing a lot of lives in the rural area. So the topic what we have selected is very wonderful topic, which is useful for the healthcare workers as well as the common man. So I also thank for making me to speak on behalf of IPA, Telangana State Branch. Thank you. Please continue.
Thank you, sir, for your kind words. I would now like to take the pleasure to call upon our Honorable Treasury, sir, Mr. B. Lakshman Sena, and speak a few words.
Richa, invite our secretary, sir.
Okay, so it is my honor to welcome our Honorable Secretary, sir, Mr. Sainath Dayakar Shastri. Sir, if you would please like to address the audience.
Hello. Hello.
Yes, sir. You are audible, sir.
Okay. Thanks for welcoming me to this occasion. And I welcome Dr. B. Prabhashankar Garu, Chairman, office bearers, members of the Managing Committee of Sarojini Naidu, Vanitha Pharmacy Maha Vidyalaya, Tarnaka. Convener Dr. N. Srinivas, Director, Dr. V. Jyoti, Principal, and co-convener Dr. Sarita Josna, Vice Principal, Pharmacy College, and other staff. Today is one-day virtual national conference on Jan Andolan, Mission for Tuberculosis Free India. Also, I welcome the guest speakers, Community Pharmacy Division of Community Pharmacy Division, who have given their valuable time in spite of their busy schedule. I request the future pharmacists on Zoom to kindly hear to the speakers and contribute to the society in eradicating the TB by 2025. Thank you.
Thank you very much, sir, for your gentle words. Let us go ahead with the program. We are privileged to have. So,
was it audible?
Yes, sir, you were audible, sir.
Right.
We are privileged to have honorable guests and speakers among us today. I would like to welcome and thank our distinguished guests to take out their precious time to educate us. Before we go ahead with the guest speakers, I would also like to call upon and welcome Mr. Dr. Yogendra Kanchapu, who is a clinical service specialist at Staffingly INC. Sir would be the co-host for the day. Dr. Yogendra is not only the designer for FIP YPG of the International Pharmaceutical Federation, but is also an executive member of the IPA Community Pharmacy Division and a co-editor of the E-Times, and also a pharmacy education officer at IPASF. I would like to wholeheartedly thank you for being here, sir. We first have Miss Sunita Chandrasekhar Srinivas, ma'am, who will be giving a lecture on the topic tuberculosis, a primer. Srinivas sir, if you could please share the PPT.
Yeah. It says I cannot share while the other participant is sharing. So you will have to please stop.
Yes, ma'am. Yes, ma'am.
Yeah, is that good?
Yes, ma'am. Yes, ma'am. It is visible, ma'am. Ma'am, before you start your lecture, I would just like to introduce and welcome you with a few words. Professor Sunita Chandrasekhar Srinivas is a visiting professor at Rhodes University, South Africa, and also a special interest group member at IPA Community Pharmacy Division. Ma'am will be giving a lecture on the topic tuberculosis, a primer today. Thank you very much for being here, ma'am.
Thanks a lot, Richa. Much appreciated. And where I would like to really start is gratefully acknowledging all the work that has been put forward by the organizing committee. It's a lot of work and it happened at a very short span of time and extremely well executed. So thank you so much for all the hard work. And going from there, we are looking at today, why are we talking about tuberculosis, especially when we are in a pandemic, when we are in the midst of a pandemic, why are we talking about tuberculosis? So what would be really good here is to understand in the next 20 minutes, where am I heading with this? So as pharmacy students, you have all learned a lot about symptoms, causes, treatment, etc. of TB. So this will not be a session that goes back and tells you the same thing, because one, you learn it in your syllabus. More important, you are also looking at it from a very different perspective as healthcare professionals. So there is no point in touching more upon the symptoms, causes, and treatment. Where I would like to get started is use the symptoms, causes, and treatment as a primary foundation, but build on addressing why We are looking at prevention of a preventable and curable disease, even after decades of having had all of these programs. And then it is also important to step back only from pandemic, only from TB, to look at what is the NCDs, what are the NCDs that are driving this country in this country, and what are the driving factors which drives the NCDs. So for me, the big picture is always about, from a public health perspective, how do we understand social determinants of health? How do we understand the connections between communicable and non-communicable diseases? And as healthcare professionals, how do we address them? So basically, this is a response from our side as a wake-up call during a pandemic, because the bottom line is we all have to take responsibility, whether we are taking responsibility as an individual, as a civic individual, whether we are taking responsibility as a collective, as professionals, or as community members. Ultimately, it is all about taking responsibility. So that is the bigger picture of where this is heading. Now, if we start looking at why are we looking at TB at all today, what comes first? We are dealing with a pandemic, and then we are talking about TB. Is TB important to worry about? Definitely yes. Why is it important to worry about? Because as pharmacists, as leaders during a crisis, we are looking at how do we break the chain. And as we go along with the presentation, you will start seeing a lot of similarities between tuberculosis and the COVID. So when you start, a request, please, so that the recording remains good. It is extremely important everybody is muted here. I see a lot of participants who have not muted. It is extremely important to please remain muted. Please, would you check so that the recording remains?
Ma'am, you're on
Thank
mute.
you. Thank you. No, you thank you for muting all of us and then asking me to unmute. I think that's the best way to go about with this. So thanks a lot. Now what we are doing is, what is that one thing that as a leader we must do in a crisis? When everything is falling apart, leaders don't fall apart. That is the time that they stand up and look at, all right, how do we deal with this? So this is a wake-up call, not just for dealing with the pandemic, but for dealing with tuberculosis as well. Now, where are we heading with this? Give me 1 second. The mouse, for some reason, doesn't want to change to the next one. Yeah, right. So now we are looking at what are the fact sheets. Tuberculosis is the world's top infectious killer. It has been around for so long. It has remained a killer for so long. But what is really frustrating is it remains the world's top infectious killer. And then, therefore, what is it that we should be doing is what we need to think of. Every year, 10 million people are falling ill with TB. And despite being a preventable and a curable disease, 1.4 million people are dying from TB. Now, what we need to bear in mind is when we are talking about infectious diseases like TB, it is not just about the 10 million who fall ill. It is not just about the 1.4 million people who are all equally valuable and precious on this planet. It's not about their death. TB is a communicable disease. It's a matter of when 10 million people are sick, how many more millions are they making sick? So that is what we need to bear in mind. The next thing to bear in mind is TB is the leading cause of death of people with HIV. So if that is the case, then we need to pay more attention to it. And TB is also a major contributor to antimicrobial resistance. And that is the reason in today's set of lectures, you also have Dr. Karthik talking about the double trouble of TB and AMR. Where does this happen? It happens globally, but the majority of the burden is always in the low and middle income countries. And among the low and middle income countries, there are 8 countries where half of all people with TB are found. And of that 8 countries, which ranges from South Africa to Pakistan to Indonesia and Nigeria, India is definitely one of them. So we are one of 8 countries that contributes to 50% of the population with tuberculosis. Also to bear in mind is about latent TB. We can't just talk about active TB. As pharmacists, as healthcare professionals, we should be very aware of latent TB. 1/4 of the world's population is estimated to be infected by TB bacteria. only 5 to 15% of these people will fall ill with active TB disease. So latent TB is a major problem, and we can't lose sight of that problem. So these are all the things, and we are now going to be looking at the Global TB Report 2020. So if you look at the Global TB Report 2020, 198 countries' data is all presented there. So right, so we know everything, right? But what we need to pay attention to is the no-do gap. We may know everything, but what are we doing about it is a question. And also, what are we doing about it without blaming others is the next question, because somewhere the buck has to stop. And I think the best time to make that buck stop for TB is during a pandemic. There is no better time to stop this than during this pandemic, where it shares a lot of respiratory health factors, prevention factors, etc., that we will start seeing. So it's time to take responsibility both as individuals and as a community. And I think we'll have to go ahead with muting everyone all over again. Yeah, right. Now in India, what is happening? So let's take a look. All these numbers after some point stop making a difference because we develop some kind of a defense mechanism to say, okay, so many people are dying. Yes, they are. But we have to pay attention because this is a communicable disease. So how many people every year are falling ill with TB? How many people are dying with TB? How many of those dying are also people who had HIV/AIDS? All of those numbers are extremely important. Also, we have to bear in mind that the catastrophic cost that comes from TB, we don't even have the data in this country. But take a look at this. The national TB budget is about 497 million US dollars. Just imagine if that money was freed up for everything else that this country needs, right from vaccination to education, right from housing and water to become better. Because if we start addressing social determinants of health, a lot of these infectious diseases will go down. Also bear in mind the reason why this is highlighted and in bigger font. 5 key risk factors for tuberculosis are alcohol use disorder, smoking. So I want you to bear these two in mind because later on I'll be talking about the connection between these two and non-communicable diseases. While I talk about non-communicable diseases, diabetes comes right there. And then HIV comes right there as another condition, which is also an infectious disease. And undernourishment, because that is the social determinant of health. So these are 5 key risk factors we need to bear in mind when we talk about TB because they're all interlinked in the bigger picture. So here is again, the reason I'm not going to read up more about this here is because I want you to be aware of where to go and look up for this kind of latest information. So these are present on the WHO web links where you can look at how many people are affected, how many people are with drug-resistant TB, which is something we need to pay specific attention to because that will then talk to what Dr. Karthik will talk about, TB and antimicrobial stewardship. So very quickly, we want to say, okay, here is a communicable disease. There is this thing about the infectious agent, and there is the direct and indirect transmission. Why do we also need to know about non-communicable? Because when people have diabetes and when people, in case of communicable, have HIV or they have COVID-19, all of these are trigger factors for tuberculosis. So let's start looking at this big picture and not get limited with a myopic view of what is happening with the disease. Is it a disease that has existed from a long time? Definitely from a historic time. So this has always been ongoing. It was in 1882 that the discovery was first spoken about on the 24th of March. And that is the reason on the 24th of March every year, we observe the World TB Day. Now, what we need to bear in mind is TB is not a disease that just affects the lungs, which is pulmonary TB. It's also a disease that affects other sites in the body, which ranges from the CNS all the way to the genitourinary system. So it has extra pulmonary sites, and that is also something we need to bear in mind. So latent TB is something I've been talking about right from the start. These are people with the bacilli in them, but they do not show symptoms. And also, they are not spreading the disease. But the active TB are the ones who show the symptoms and they are spreading the disease. And I've consistently spoken about HIV and TB, diabetes and TB. So just keep remembering that. So it is reinforcing the same message. What are the contributing factors? Social determinants of health. When our housing is bad, when our sanitation is bad, when the reason for any kind of infectious diseases is very high, obviously this is affected. So living conditions are very important, because with that living conditions comes poverty and malnutrition. When there is malnutrition and the immune system is weakened, obviously tuberculosis becomes one of the major problems. And when we are pushing all of these problems with alcoholism, with smoking, and with silicosis that comes from the mining industry, etc., then obviously we are definitely asking for trouble. So we have spoken about TB. Now, very quickly, how is it transmitted? One cough releases about 3,000 droplet in, nuclei. One sneeze releases about tens of thousands of droplet nuclei. So when all of this is present in the air, this is what is causing this airborne disease. So when we inhale it, it is getting into the lungs. I spoke about this earlier. This is a nice pictorial representation which says that one positive person will affect 15 healthy individuals. These are all estimates, right? So imagine one person affecting 15. So when we talk about 10 million people getting affected, you're talking about each one of those affecting 15 other people. So that is what we need to bear in mind. Where does this happen? In a country with 1.3 billion population, it is happening everywhere because of the crowding. You can't help crowding. Now, where does the crowding happen even more? It happens in the cities. Now, all these are important lessons, because what are we seeing with COVID-19? Exactly the same things. Exactly the same things. The more we are in crowded places, the more vulnerable that we become for this disease to be spreading. What are the symptoms that we need to bear in mind? Cough, 2 weeks, 3 weeks or longer, pain in the chest, fever, constant fatigue, weight loss, loss of appetite, night sweats, and coughing up blood or sputum, which is mucus from the deep inside of the lungs. Now, fever, especially increasing in the evening, and shortness of breath are also parts of things we need to notice. There are several diagnostic modalities that are happening, which are getting better with time, but we need much more because there's just no end to the way it is going. Something else to bear in mind is also about the sensitivity to the medicines that are available. So if it is the first and the second line of treatment and the drug sensitive TB, then in 6 to 9 months, the person is out of it. But if the person ends up with a drug resistant TB and has MDR and XDR TB, then more trouble, because these people, first of all, it is going to take 2 years to treat them. And just imagine all the side effects that they have to go through. And then while they are getting treated, it is also how many people they will be infecting now with the drug-resistant TB, which becomes a public health problem. So this is just to tell you which are those medicines. All of these are taught to you in your syllabus. Please start paying attention to what you need to know about these medications. And now comes the challenges. Diagnostic delays are one of the challenges, because the last speaker today, Dr. Gautam, will be talking to you more about what are all these leaky factors in the cascade of care. The diagnostics is getting delayed. There's a delay in the treatment initiation. That is when the people are spreading the infection. It's a long-term treatment. So within that 6 months, for a drug non-resistant tuberculosis, and for 2 years in case of drug-resistant TB, there's a long time. During that time, when people are not adherent to their treatment, that is when they start becoming a public health problem. And the high pill burden, taking all those medications consistently and having the side effects from those medications and expecting people to remain adherent, we're asking for trouble again, because the side effects are really high. Because that is why people within the first few weeks of treatment, once they fall feeling better, there's a false sense of cure, and then they stop taking the treatment. They leave the treatment. And in the public sector, at least there are certain ways of checks and balances. In the private sector, we lose those checks and balances, and it becomes more of an issue. So I would really urge the next generation healthcare professionals to visit these websites of the India's program, the revised National TB program, which has now become the National TB Elimination Program, which Mr. Raj Vaidya will be talking about next. So please visit these websites. Discipline and prevention are two things that are non-negotiably important. Maintaining immunity. How do we maintain immunity? It is what we eat and how much we eat. As long as we have fruits, vegetables, and a very healthy diet, that is when our immune system stays strong. The minute we move into the junk food, it's a big industry that pushes us to keep eating it, and which is quite addictive in nature as well. Whether we're talking about smoking, alcohol, junk food, they are all pleasure giving items. The minute we don't know where to have our discipline and don't know how to enjoy responsibly, that is when we are asking for trouble with all of this. Infection control, health and hygiene are very important. Well ventilated areas are extremely important, and NCDs are definitely connected, so we need to be aware of that. So these are things that we are seeing now. Thanks to COVID, these lessons now are getting very strong. When TB program was just being pushed as TB program, getting people to understand hand hygiene was very difficult. Thanks to COVID, we now understand all of this. So as much as we want to talk about the pandemic, let us start thanking the pandemic for being our wake-up call. But let us ask ourselves a very important question. Do we need a pandemic to wake up? If we know all of this, then what is wrong with us is a question we need to ask ourselves. We invited this trouble. Now we have nowhere to run. So if we have nowhere to run, let us now get back into a disciplined lifestyle to say, whatever can be prevented, let's prevent it. Whether we're talking about COVID, we're talking about TB, the question remains, how disciplined are we going to be? Same things that we talk about COVID and TB. Cover your cough. Do not spit. Clean your hands. Same messages. Let us use COVID messages to push for TB. We take pride in spitting where it says do not spit. What is wrong with us? When we go to other countries, we don't do this. When we live in other countries, we don't do this. Why do we treat our own country so badly? So we have to consistently ask ourselves, what is wrong with us? When we know TB is spreading, it's an airborne disease. When we spit out and we are just letting it spread in closed spaces for others, we can't become a problem to others. We need to be responsible. Well-ventilated, sunny areas is what we need. This is the one I was talking about. And the last speaker today will also talk to you about the same thing. These are the gaps that exist in the cascade of care. We are not getting the diagnosis done, do not have access to the TB diagnostic test. We do not get diagnosed. We do not get registered. We do not receive the treatment, and the success becomes a problem. And the post-treatment TB recurrence or the death. So these are all the different steps in which we end up losing patients. They fall through the cracks. So as healthcare professionals, we have to identify these 6 steps and say, what do we need to do to ensure that these 6 steps are reduced to its minimal? And Mr. Raj Vaidya will talk to you more about the elimination program and doing this. Connect the dots. NCDs, infectious diseases, may seem distant apart. They are not. What drives each one drives each other. So the more we are getting into eating junk food, the more we are getting into smoking, the more we are doing alcohol abuse, the less physical activity that we do, and the more we stress because of all of this. We are talking about the illness tree. Shift it. Shift the game. The game now is wellness tree. How do we get into the wellness? Obviously, eating healthy is where it starts. Obviously, breathing oxygen. If you want to breathe oxygen, plant more trees. You can't breathe oxygen in cities where you want to build concrete jungles. Drink water, not alcohol or other things. So sugary drinks, avoid all of that. Drink water. Move for health. We can't be sitting more. Right now, I should be possibly standing and giving this talk and not sitting. And that's something I have to also remember. Positive attitude. There is nothing better than a positive attitude. It is about the mind over matter. Remain positive. Even in a pandemic, there is no other way out other than being positive and finding the way out. So all of that gives us the wellness tree and the way to move forward. Remember about Empower from the WHO. Monitor tobacco use, protect people from tobacco, offer help to quit tobacco, warn about its warnings, enforce bans on its advertising, raise taxes on tobacco. So on the 31st of May, we should all be observing World No Tobacco Day, because it links to everything. It links to TB, it links to NCDs, it links to everything you can think of. So if that is the case, let's look at no tobacco in a much better manner. This is my last slide, and I'm going to spend more time here. When we start where there's a challenge, there are ideas, we see problems, we see a crisis. This is a crisis, accepted. Can we change this? No. Not until we see the problem changing into problem solving. That is where you and I need to understand that what distinguishes us is not being followers, but becoming leaders. How do you become leaders? Think with your heart, not just with your brain. Take your heart to work, not just your brain. What do? Power of one. Start as one person, but build your team. Because what is a team all about? Coming together is a beginning. Keeping together is a progress. Working together is success. That is what we want. We can't be working in silos. We need to work together. Time. One thing that COVID for me has taught me is it is time to shut up and get to work. Because when we wear a mask, we talk less. When we talk less, we blame less. When we blame less, the index finger is working less because the 3 fingers pointing at us is the reminder. So let us come together. Let us work together for TB. I really hope this is a wake-up call, and we use a wake-up call to move forward. We need a healthy country, and we need the next generation taking the leadership to move us forward. So this is an absolute call to say, let us use the wake-up call. Thank you, everyone. And I really thank all the organizers and everybody that has put in a lot of energy into getting this day going. So wish you all the very best with the program. Thank you.
Thank you very much, ma'am, for such an informative webinar and taking out your precious time. Now, I would like to welcome and introduce our next guest lecturer, Mr. Raj Vaidya, sir, M.Pharm, and worked as a community pharmacist from Hindu Pharmacy, Panaji, Goa. Sir is immediate vice president and chairman from the year 2006 to 2012, Indian Pharmaceutical Association and Community Pharmacy Division. Sir has also served as the editor in E-Times IPA CPD. With this brief introduction, I would like to welcome Sir Mr. Raj Vaidya to give a webinar on the topic National Tuberculosis Elimination Program.
Thank you very much for the kind introduction. Thank you for this opportunity for IPA CPD to be working together with the Pharmacy Institute so that we can spread out the information, knowledge about TB, and also motivate the young generation to come forward to be partners. Now, most of the work which has been done in TB has been focused around the government programs. So these have been running for decades. It's the Central TB Division which is spearheading this program under the National Ministry of Health and Family Welfare. The website which all of you should access and familiarize yourself so that you are also one step ahead in getting part of this program to do your little bit for elimination of TB in our country and worldwide. So the website gives you different things, but I will not focus on that. This is just for your information where you can get information. And this is the huge team of the public health sector which works in TB, right, for so many years, right from the Central TB Division, which has its own huge team and network, to the state TB cells, and under these the district TB centers, and under these the tuberculosis units and TB detection centers. So you see all over the country, as it is, our country is so huge and so many states and union territories, and all across we have this huge network of government staff, all healthcare workers working together for TB. So India's fight for TB is not new. It is more than 50 years now that concerted efforts have been made by the national our health services for controlling TB. Yet, as we see, we have just seen that TB continues to be India's severe health crisis. So, over the decades, we have had a national tuberculosis program, which then got revised into RNTCP, that is revised National Tuberculosis Program 1, and then later 2006 to 12, RNTCP 2. And next, in the next phase. So what we have been doing, as the government has been doing in its programs, is trying to continuously learn from what learnings there are and try and improve the programs, making good of what are the shortfalls and trying to improve and bring down TB in our country. So under the National Strategic Plan 2012 to 17, as you know, every 5 years we have our planning commission giving out its strategies for 5 years. We plan for 5 years in advance. So under this RNTCP in 2012-17 got even more attention. And then 2017 to 25, the government looked at TB elimination more seriously, trying to be in line with the worldwide strategies of WHO and other international agencies. So the 2017 to 2025, that's a 8-year plan. This is a different one, but the aim was to eliminate TB by 2025. And in early 2020, was thought to revise this further because the goals which were, so this program was further refined and also renamed as National TB Elimination Program. So the wording for this program may be new, but it's finally the nation's TB program, which has been running for decades and decades. And with new learnings, we are trying to improve upon different strategies so that we can work towards elimination. So in the RNTCP phases, we have made several achievements. It's not that those phases were not good enough. We introduced free diagnosis and treatment of TB in the public health sector, national recommended DOT strategy. We have been doing this for more than 2 decades now. That's a directly observed treatment short course, which is under supervision of health workers. The patients who are on TB are given their medicines on alternate days. Of course, now in the last 3-4 years, this has changed to a daily treatment regimen. Then during RNTCP, the whole country was being, finally we achieved to cover the whole country in March 2006. And we also have been setting up designated microscopy centers and peripheral labs across the country for early detection of TB. In these phases, we also have, over the decades, have better preparedness of our public health sector staff. At the same time, it was realized that it is very important that NGOs who are working in the health sector, social sector, they also play a very important role. So the NGOs have been involved, the private doctors have been involved, medical colleges have been involved over the years. So doctors in the private sector, unfortunately, they were not being well pulled into this, but it was realized and the RNTCP phase did that very well. Then because of all these things, we have had now increased awareness and detection rates of TB, increased treatment success rates because of all these strategic plannings, and a reduction in the death rates, which is very important. It is slowly taking us towards the goal to end TB. So during the 2012-17 National Strategic Plan, a lot of gains were made in strengthening the support structures for the TB program, improving the linkages and involvement, the implementation of the environment for a better control over TB in the country. Now, one significant thing which was introduced was a mandatory notification. That means the government made it compulsory that everybody, of course, it was being done in the public sector, everybody in the private sector, the doctors, they had to report any new case of TB that they came across to the public health authorities. And so soon even the pharmacists, so even we have to report to the public health sector, whichever prescriptions of anti-TB medicines we receive and dispense. So by this, there is improvement in the notification of TB cases. Another significant step was in 2014 when the new Schedule H1 was introduced. And by this, to control the indiscriminate use of antibiotics as well as anti-TB drugs, it was made more stringent to dispense this medicine. So 11 anti-TB drugs are included in Schedule H1, and we as pharmacists have to strictly dispense them on prescription and also keep a register of all the medicines that we receive and dispense, name of the doctor, name of the patient. And for TB medicines, we have to keep a record of the name, address, and telephone number of the patient. So so also in this strategic plan, there was a further expansion of the diagnostic services, and also the introduction of Nikshay. Nikshay, Ni means to end, and Kshay means TB. So this was a web-based TB notification system using information and communication technology. So this software was introduced and it was online. It was introduced in 2012, and then later in 2018 it was upgraded. Then in this 5-year phase, there was also a development of strategy for pragmatic management of drug-resistant TB, which Professor Sunita has spoken earlier about the problem of resistance, and Dr. Karthik will speak later on the resistance problem. So also TB HIV cases, how to manage them through a single window system. Earlier, both of them were being handled separately. So this integration has also helped considerably. This is the home page of the Nikshay website, which the healthcare workers and peripheral health institutes use to log into and keep a track of all the various aspects of TB, right from detection to treatment to follow-up. So by doing this, both the Nikshay as well as the TB notification order, which I mentioned earlier, there has been a more than 25% increase in TB notification for cases. That is a considerable and significant important thing which has happened. So also there is Nikshay Aushadhi, because the medicines used for TB are being supplied free of cost by the government to every patient for all their public patients in the public health sector. And so also those in the private sector, also governments have made efforts to supply to them. So this is a website which tool which manages all these things. So in 2016, there was revised technical and operational guidelines for TB control in India. And some of the significant important things were part of this was that it provided updated recommendations for standards of TB care compared to the previous ones. And here in this, it gave more clarity, more importance that the private sector is very much important. Around 70% of our patients go to the private sector. And if we do not focus on the private sector, gel them, merge them with the public sector working, then we are not going to do well in TB. So this was also highlighted in that. So the private sector has been roped in a much better way. And it also said that earlier private sector, it was compulsory that private sector once diagnosed, the doctors should. Then there were some difficulties in that. So now it has been made open so that the private sector is open to use any of the services for their patients. Another important thing, as I mentioned earlier, is from shifting from the DOTS regimen to the daily TB treatment regimen. So medicines are given free of cost to the patient, and the patient has to take them every day. I will not go into the details of that. And another important thing is the introduction of the new drug, bedaquiline, and this has been made available for the treatment of drug-resistant TB. Drug-resistant TB is a serious problem, as discussed in the previous session. Another important thing which was made was for quick detection of TB and also to check for sensitivity and resistance of rifampicin of the patient, the bacteria in the patient. So for that, CBNet laboratories have been established under the TB control program across the country. It's giving better diagnostic tools to the public health team. Now the vision and goals for this National Strategic Plan 2017 to 2025 has been, it's the vision to have a TB-free India with zero deaths, disease, and poverty due to TB. It's quite a significant goal seems very tough to achieve, but I think if we all of us work collectively towards it, it will show a decline in the burden of TB, mortality and morbidity. At the same time, working towards elimination of TB by 2025. So this involves 4 strategic areas which have been discussed and why they are important. One is to detect TB early, treat it well, prevent new cases, and build up on all these areas so that we strengthen up and so that we eradicate TB completely. So here the stress has again been on the private sector involvement as well as of involvement of key and susceptible populations who often get left out, especially those, say, in the tribal areas, in the hilly areas, in the urban slums, or in populations which are underserved or in poverty regions. So the thrust areas for the TB elimination strategies have been, just to summarize what I have been talking in the last few slides, involvement of the private sector, active case finding, which is very important, then handling TB comorbidities, as discussed by Professor Sunitha, TB and HIV, TB and diabetes, all these are very important, and involvement of the community for multi-sectoral responses, working together with the NGOs, doctors, and the private sector, and handling drug-resistant TB and use of the information and communication tools for adherence and monitoring. That is the NICSHE, which I mentioned to you. So the annual rate of decline of tuberculosis currently is 2%, and the required rate for us so that we achieve TB-free India by 2025, the required rate has to be 10%. So it's a 5-fold jump, and we need to work hard collectively towards it. Unfortunately, because of COVID in 2020, there was a 15 to 20% drop in notification of TB cases. And with this second wave, I hope that we do not drop further. But anyway, even if we do, we have to push back the fight against tuberculosis. Now, another important step taken by the tuberculosis program has been providing budget for nutritional support for TB patients. So every TB patient who is detected and on medication, whether it's on private sector or it's in the public sector, he needs to be having proper nutrition because that gives obviously better health outcomes. It improves the nutritional status as well as it provides better adherence for taking the medication. Otherwise, because there is no proper nutrition, the patients tend to drop out on medications. So that also reduces the out-of-pocket expenditure of the patient. So this system is such that across the country, the various health units of tuberculosis, moment a patient is detected positive, they try and contact them and try and see that 500 rupees every month is to be transferred for the duration of the treatment, whatever the duration of treatment is, to the bank account directly, so that there is no third party involvement, so that the patients can benefit. Of course, this also has certain difficulties. For example, many patients do not have bank accounts. Many patients are not able to come forward. And many patients stigma. So everybody, and I think in the next lecture we will see how pharmacists and pharmacy students can involve in all of these aspects of TB. So how we as pharmacists can support the National Tuberculosis Eradication Program. So the patient support involves various aspects. You can go through these: counseling, contact investigation and treatment, important for adherence and follow-up, and HIV and diabetes testing, susceptibility, resistance testing of the TB drugs, and following up with the treatment outcomes, as well as giving financial support and social welfare support to the patient. Now, in order to motivate the different states and the different TB units across the country, this TB program has introduced different targets and certifications so that they are motivated. So the states and districts are motivated. So those states and districts which achieve their TB-free, make the TB-free efforts and achieve those status, they are proposed to give them rewards to based on how much targets that they have achieved. So the target of reducing the incidence of new TB cases has been 80%, so that we end up with 0 cases by 2025. This is just a brief overview of what a reduction in TB incidences each state or district has to do. Based on that, based on 20% reduction, 40% reduction, based on that, they will be awarded with medals, bronze, silver, gold, and more than 80%. So along with it is also providing monetary benefits to these TB units. So this is to motivate and taking. Here you have seen, must have seen plenty of advertisements. That is our ultimate goal. TB harega to desh jeetega. So it's very important, and this is one of the ambassadors of the government in doing this. So these are quite ambitious goals, but finally we have to be there, because it's the vision for a world which is free from TB. 0 TB deaths, 0 TB disease, and 0 TB suffering. So there are different milestones. India has set itself the milestone for 2025 in reduction in TB deaths by 75%, reduction in TB incidence by 50% as compared to 2015. And those in 2030 and 2035, these are the goals of the SDG is the Sustainable Development Goals of the United Nations, and NTB is a 2035 goal set forward by the WHO. So we have set ourselves a much faster goal. So we need to work doubly for that. And this is the challenge and the launch which was made last year for ensuring that India is TB free by 2025. Of course, everything is not smooth because we have a lot of challenges, and I'll end my session with the last 2 slides of challenges, and that is the reason why we are coming and reaching across to pharmacy professionals also and trying to catch them young, because the pharmacists and pharmacy students because these challenges are there. There is a lot of underreporting and uncertain care of TB patients in the private sector. How we can coordinate with them better, reaching to the unreached in the remote areas or right in the towns, but in urban slums and migrants, and drug-resistant TB, comorbidities, HIV, diabetes, and tobacco users, undernutrition and poverty. Then we also need to address the huge reservoir of latent TB infection, as Professor Sunita has said. Also, she has said about social determinants outside of the health sector. It's not only health, but also other social aspects which are important. And then strengthening of the quality of care of private sector, and also addressing stigma and discrimination, which is also very important. With this, I end, and I thank you all once again for giving me this opportunity. For sharing. Thank you.
Thank you, sir, for such an engaging and informative session. Now, it is my honor to welcome our next guest speaker, Mrs. Manjari Gharat. Mrs. Manjari Gharat is the Vice President of Indian Pharmaceutical Association and a Chairperson of IPA CPD 2012 to 2022. Ma'am is newly elected as Vice President of International Pharmaceutical Federation. Ma'am is also an immediate past Vice President of Community Pharmacy Section of FIP. Mrs. Manjari Gharat is also an Executive Committee member of SEER Farm Forum of FIP and WHO. Currently, Ma'am is in charge principal of KM Kuntnani Pharmaceutical Polytechnic, Ulhasnagar, Maharashtra. With this brief introduction, I would like to welcome Mrs. Manjari Gharat to give us a webinar on the topic IPA's taught TB Pharmacist Project and how pharmacy institutes can contribute to TB-free India. Over to you, ma'am.
Thank you, Akanksha, for this kind introduction. I hope I am audible to everyone. And thank you, SNVPMB Institute, the principal, the management for organizing this. thanks to IPA Telangana branch, and thanks to my wonderful colleagues from IPA Community Pharmacy Division for putting together this program. After Dr. Sunita has spoken and she has given a wake-up call, and after Raj Vaidya has told you about the National TB Elimination Program, my job becomes much, much easier to build on that. We are going to talk about how we can contribute as the pharmacy students, as a pharmacy institute in the TB control efforts to make India TB free. Can we have next slide? Yogi? Yes. So before I actually go to see what we can do, what is our responsibility, I'm going to quickly tell you the story what Indian Pharmaceutical Association has done in the area of TB control and TB elimination in last few years. And then we will briefly talk about how Stop TB is our responsibility, how can we contribute. And I'm really delighted that you have organized the competition and the poster presentation on this topic later on. So the next slide, please. So the story of IPA's journey in tuberculosis started way back in year 2004 when we began our flagship project, that is the TB Fact Card pilot project in Indian community pharmacies. This was basically in Mumbai and Navi Mumbai. The Commonwealth Pharmacist Association that time approached us, and thanks to our IPA then president, Mr. Praful Sheth, who was also FIP's vice president, he brought this project to India. The Commonwealth Pharmacist Association asked Praful Sheth and our other IPA team members, can we have a malaria fact card project in India? Because they had a very successful malaria fact card project in Africa. Then we said TB is a major problem for us. It's not that malaria is not a major problem, but TB is a major public health problem for India. And we would like to work in the area of tuberculosis. And that's how we started working in area of TB. And in Mumbai and Navi Mumbai, we started this TB Fact Card project where we involved 60 community pharmacists along with the students. See, students and my colleagues from Hyderabad, I would just like to tell you that this was year 2004 when the pharmacists were never considered as public health specialists. Pharmacists were not looked upon as healthcare providers. It is not so even today, but that time, this is like 15, 16 years back we're talking about. Pharmacists were just the drug dispensers, the medicine sellers, and more of traders. And they were never involved in any public health activity as such. They were not looked upon as counselors. But we took this bold step, kind of courageous step that time. And we decided to venture into this, and we decided to try out a pilot project. So in Mumbai and Navi Mumbai, we trained the pharmacist from Mumbai and from the community pharmacy. We had some inclusion criteria. We selected some pharmacists. We had training along with the Municipal Corporation of Mumbai, Municipal Corporation of Navi Mumbai also. And in this project, what we did was we were focusing mainly on the patients from the private sector, because now Raj Vaidya has told you that TB actually is dealt very seriously by the government, and government on war footing is trying to tackle TB. But 50 to 60% of the TB patients go to private doctors, and then they come to our shops, that is the chemist shops, to buy the medicines. Actually, government is providing TB treatment, counseling, diagnosis, everything free of charge. But still, for various reasons, which I don't want to go into right now, people, more than 60% of TB patients come to the private sector. And so in this TB Fact Card pilot project, we decided that we would like to concentrate on these patients who are in private sector, because in private sector, there is no monitoring of the treatment. Dr. Sunita spoke about DOTS, directly observed treatment short course. Where is it? It is only in the public health sector. That is from the government hospital, primary healthcare centers. But in private sector, there is no treatment supervision, monitoring, and the adherence to TB treatment is very low. And you know, when the patient takes medicines for say first 4 weeks or so, starts feeling better, cough is gone, fever is gone, that's the time patient stops the treatment, because he thinks that he's cured. but feeling better is not actually, he's not got cured, because the TB treatment is minimum 6 months to 8 months of treatment. And so those treatment defaulters, they are the right candidates, unfortunately, for the multi-drug resistant TB or extensively drug resistant TB. And so that TB is not curable. The primary TB, yes, preventable and curable. So therefore, we concentrated on the private sector patients to improve their understanding of TB. Through the pharmacist, we decided to counsel them. We produced certain leaflets in various languages. It is very important to produce the information leaflets in the regional languages. Otherwise, our community, our patients are not going to understand. And in this project, can we have the next slide? We also involved the students from pharmacy colleges in Mumbai. Yogi, can we have a next slide? Yes. So you can see this enthusiastic young minds here, young students here from various pharmacy colleges from Mumbai and Navi Mumbai. These are just few of them, but more than 100 students were involved, and they were our soldiers on foot. Like, they were connected to one pharmacist, two students were connected to one pharmacist, and they were supporting in the project. So at the end of this project, can we have a next slide? So at the end of this project, that we realized that the pharmacists are doing a good job of counseling, and they are also monitoring the treatment adherence of the patients. And even though we were not 100% successful, we realized that out of 60 pharmacists, many of them did a good job, and patients were supported, patients were kept on the treatment, adherence was improved. This gave us some confidence. And during this project, we also realized that the government is doing efforts on war footing, and government has a revised National Tuberculosis Control Program, from where the TB treatment, the DOTS treatment, is given free of charge. You can see these DOTS boxes. Now it is all changed, but that time it was these are the boxes per patient having a treatment packed for 6 months or 8 months. So these medicines were dispensed only from the government health facilities under the direct supervision, direct observation of a healthcare worker. But this was not through the chemist shops anytime. So after the success of the TB Fact Card project, and after the understanding of the National TB Control Program, we thought that this free treatment can be made available through the chemist shops, and the pharmacists can become DOTS providers. So a small beginning was made with this concept, with this assumption that our pharmacists can do a work as a DOTS provider, and they can be extended hands of the government. So this is like a public-private partnership, which we had thought, and we started. We made a small beginning. We called like 25 pharmacists for the training. Actually, only 6 pharmacists turned up. We can understand pharmacists are so busy in their shops. There are so many commercial issues. They don't have adequate staff. So we can understand why there will not be 100% attendance. When you're calling 25, maybe 6 turned up. But that was a small beginning. We did not lose the hope. And we continued this. We started training the pharmacists for DOTS, along with the municipal corporation, the local TB health officials. And as we went along, yes, can we have next slide? So these are the district TB officers with us who are training the pharmacists. As we went ahead, we saw the success that the pharmacists are working as DOT provider. So the patient is coming to the pharmacy to get the medicines free of charge from the pharmacist. Pharmacist is counseling the patient, and he's administering the medicine to the patient. And definitely that helped the National TB Control Program. So with this realization that our hypothesis, our assumption is correct, that the pharmacists can be involved in the National TB Control Program, we took a big step, and we started a more formal, more structured 2-year project in year 2010, with the support of Eli Lilly, with the support of FIP, with the support of chemist associations, and of course IPA coming together with the government TB offices. And so we had a 2 years project from 2010 to 12, next one. And we devised a training program for this. The half-day training program was conducted by the RNTCP along with IPA. And what was the role of the pharmacist decided? The community awareness about TB, community awareness about DOTS. So like what Dr. Sunita told you about the symptoms, about how TB is curable, what are the trigger factors, we produced different leaflets and we trained our pharmacists how to counsel the patients. And also to create awareness about DOTS was very, very important because see, I told you in the beginning that more than 60% of the patients were going for where? For the private sector treatment, even though the government is providing total free of charge treatment. So to increase the awareness and to increase the confidence in the public health system, pharmacists were trained for the same. And this is another important role, that is referral of the chest symptomatic patients. This is very, at a pharmacy, you can, am I audible?
Yes, ma'am, you're audible.
Yes, ma'am.
No, yeah. So at a pharmacy, there are so many patients who come with the cough, who come with the fever. Even today in the pandemic, this is happening. And these could be probable cases. Now, today we think of only COVID when the patient comes with a fever, asking for the fever medicine or the sore throat. But it is a major, major problem. I mean, these are the major symptoms indicative of tuberculosis. So we trained our pharmacists to identify the patients who are coming with these symptoms. Pharmacist knows exactly how their patients are. And if the patients are having recurrent symptoms, then the pharmacists were trained to refer these cases to convince the patient. This is very important, to convince the patient to go to a nearby diagnostic center from the public health or to a nearby private pathology lab and to get tested for TB. So this was one important role because we convinced our pharmacists, if you identify one chest symptomatic case, Dr. Sunita told you about the pulmonary TB. So we are talking of pulmonary TB, which is a major public health problem. If you identify one pulmonary TB case untreated and put that patient on the right treatment, you are going to safeguard the lives of 10 to 15 people who would have got otherwise infected because of the close contact with this untreated TB case. And that really convinced the pharmacists. They realized they can do so much of social service right by sitting in their pharmacy. They don't have time to go and work in the slum areas or to do something, some other social service. So we told them that this is you have an opportunity to work for the society, to work for the community. And they did that good job. So this was the role of pharmacists decided: community awareness, referral of chest symptomatic cases, provision of DOTS treatment. Once the patient is identified, patient can get the treatment either at the public health facility or he can come to the chemist shop. It was left to the choice of the patient. And the pharmacies are so close to the patient's home. They're right in the community. And so many patients had chosen pharmacy to get their treatment. And information to all about the DOTS, as I said, it was very important. And also the rational use of antibiotics. One of the important component of the training was to train and sensitize the pharmacists not to sell antibiotics without prescription, as well as when the patient has an antibiotic, whether anti-TB or any other antibiotic, to counsel the patient to complete the course of antibiotic. So this was also a very important component of this half-day training program, which we conducted in different parts of Maharashtra. Next one. You can see some of the photos of the, yes, so pharmacist basically was a health educator or is a health educator, counselor, and referral. So this was the algorithm decided. I will not go into details of that. Can we have a next slide? I can show you some of the photographs of the pharmacists who worked as DOT provider. Can we go to the next slide, Yogi? Yes. So these are some of the pharmacies who worked as DOTS provider then, that is 2010 starting. And even today, they are working as DOT provider or they are helping the patients, they're referring the cases. So this has been a very sustainable model. And so you can also see that these blue boards, they come from the local TB department, designating this pharmacy as a RNTCP approved DOT centers. And this makes something, very special. So that makes that particular pharmacy very special and unique from the other pharmacies. So this was also kind of, an incentive to the pharmacists that they will be recognized as a partner to the government. They're doing something for their patients apart from their normal routine of selling the medicines. And this work, like every pharmacist used to have, say, 5-6 patients. Now this particular pharmacist in Maharashtra, near Mumbai, had at a time 9 or 10 patients, but they all used to come at different timings. And then so pharmacists had enough time to talk to them. And therefore, this was fitted as a very, this got very well integrated in the routine work of the pharmacists. Next one. Next slide. So we continued this work and we spread this work in the 9 different districts of Maharashtra. We had more than 100 dot provider patients that time, and to provider pharmacists. More than 400 patients were treated. This was like after the observations, after the follow-up of 1 year, but we had many more patients treated, many more involvement of the dot pharmacists. Also 17% cases of referred cases were coming positive. That means pharmacist, when refers the TB cases, suspected TB cases to the diagnostic facility, 17% of those cases were coming positive. That means our community pharmacists had developed correct understanding of whom to refer. And we were able to find out those 17% patients who otherwise wouldn't have gone to the treatment right away. You know, at least the patient takes like 62 days to come on a right TB treatment. That has been the surveys which are done by WHO tells us. Next one. So this was very, very important work. Next slide, please. And so there has to be an advocacy, you know, of the role of pharmacists with the government. We have to clearly make them understand how pharmacists can contribute in much bigger way than just as a drug seller. So advocacy backed with an evidence, that is very important. So in year 2012 in IPA Mumbai headquarters, we had a very high level meeting with the top TB officials of the country. And we presented them what work pharmacists have done, what is their role, how they're contributing, how they're supporting the TB control program. And also we gave them some field visits. As a result, the top TB officials of the Central TB Division Ministry of Health realized what pharmacists can do. And they said not only in TB, but going forward, pharmacists can have a big role in NCD control or in vector-borne diseases. And they said, we will tie up with you forever. And so they signed an MOU after our follow-up in April 2012. This is an MOU signed by Central TB Division, Ministry of Health with IPA, Chemist Associations, and Pharmacy Council of India. So with this MOU, we spread this TB model in all other states, not all other states, but we reached 7 other states across India. Next one. And then we wanted this, this was also a historic development because first time pharmacists got involved in any national health program. As a student, you know, you have learned about various health programs. So this was the first time pharmacists were officially part of the national health program. So whatever training program we had developed, the training module was accepted by the government, and as a joint effort of IPA and Ministry of Health, this was released as a training module for the community pharmacists. It is still there on the website. It is by Raj Vaidya. Can we go to the next slide and can we mute all of you? So this was a small story beginning with the 6 pharmacists not getting more demotivated with the less response that time from the pharmacists. We moved on and then we spread this DOTS TB model project to more than 7 states, and more than 3,000 pharmacists became DOT provider. But actually this information, what role can pharmacists have, reached more than 20,000 pharmacists through such webinars, actually the seminars that time. And I'm very, very glad about it that we could sensitize the pharmacists about their role in this major public health problem, which is not just a health problem, but it is a social problem. It is an economic problem for our country. Next one. Next one, please. So all this story has been encapsulated, captured in this handbook, which we released in year 2018, Pharmacist at the Front Lines, a novel approach at combating TB, the DOTS TB Pharmacist project of IPA. So this was released in year 2018 in Mumbai at the hands of the Central TB Division's top official, the Deputy Director. And if you want to have a look at it, it is available on ipapharma.org under publications. Next one. So even though like the major project, funded projects stop, we have not stopped working in the area of TB, and we continue with the Jana Andolan participation, and we are partner to the government of India for this Jana Andolan. Now coming to, after listening to this story, I'm sure you have many ideas in your mind, but I can just put forth few ideas how we all can contribute to control the TB and to eliminate the TB. See, Raju Vaidya showed you a very ambitious plan of Government of India to eliminate TB by 2025. Lot of huge challenge. But if we all come together, as Sunita told you, the teamwork. So if we all come together, we can definitely do it. And we can bridge the gaps. We have to reach the unreached. So what we can do from our college as a faculty, as a student, and then maybe some of you will become the community pharmacists. Very, very important is community awareness. I'm not saying go to the community and talk to them. You can also have an online sessions with the community. The community can be anyone, that is the public, or it could be like, it is very easy for us, like your management may have 16 colleges, which are not pharmacy colleges. So your pharmacy colleges, you can be the leader, and you can take awareness sessions in your non-pharmacy colleges, like the commerce college, the arts college, the science college, the BA college, management college. So some of you students, with the help of your faculty, you can be the trainers, and you can create awareness in the other schools and colleges and catch them young. It is very, very important to catch them young. So the young mind should understand how TB is a big, major public health problem. And then they can also teach their parents, their relatives, their neighbors what we should do to prevent this. We can also support as a students, you are very good at many of the technological things. So you can support the patients. You can, like, one student can choose two TB patients and maybe support the patients for social welfare schemes. Because Rajvaidya told you just now that there are many schemes from the government. 500 rupees are deposited in patient's account every month for nutrition support. And believe me, nutrition is extremely important for TB. Nutrition is the best vaccine also, as Sunita told you, for prevention. But when treatment is taken, nutrition is of utmost importance. So what we can do, many of the patients don't even know how to do the Aadhaar linking of their bank accounts. So their patient needs our support. And we can do that even without much stepping out of the house. Why I'm saying this? Because we are in the midst of the pandemic. But afterwards, we will not have any problems. So support the patients for social welfare schemes, support the TB counselors. Every local TB office has the TB counselors. You can go to them, discuss with them, find out their needs and support them. And door-to-door survey. I was very glad when your principal said one of the student wrote a message to him in the morning about, she mentioned about door-to-door survey. I'm extremely pleased and motivated, with enthusiasm of the students. We can really take this as a challenge and take this as a task. Why not try to do the active case finding and do the door-to-door survey to find out the people, get them tested, and then put them on the treatment if they are positive. Support to the affected students and families comes without saying. If we have some students who are affected by TB, faculty members, non-teaching staff, teaching staff, anyone who is affected with the TB, not only we need to help them financially, because they might be getting free treatment from the government, but then we need to support them, social support, psychological support is very, very important, because TB is a long-term treatment. It is a disease of minimum 6 to 8 months. And if it is a drug-resistant TB, believe me, it is minimum 2 years of treatment with a lot of drugs which produce variety of side effects, including the mental health issues. So support is needed in various forms. And we as a pharmacy student, we as a pharmacy faculty, and a future pharmacist, we can give this support to the affected students and their families from our college, from our, the maid servants who are coming to our home, our neighbors. We can do all this for all of them. Going next one, Yogi. So I just want to remind you, when we started this TB campaign through IPA, IPA Students Forum. Yogi is coming from IPA Students Forum, and now he's with CPD. But IPA Students Forum and many colleges did an excellent job of TB awareness campaigns through the students. These are some of the pictures. These are my students who are going to the schools and talking about TB. They're going to the old people's home. They're going to the societies and talking about TB, making them aware, showing them the way. Where is the dot center? Where is the public health facility nearby? Giving them the phone numbers and giving them the direction for what to do for getting the TB treatment as well as prevention. Next one. So these are some of the pictures of the students' involvement. Next one. Yes, so you can see people, students reaching the public, maybe at the platform, maybe on the streets, and talking to them, giving them the leaflet. So there are different, a number of ways by which we can create the effective community awareness. Next one. So I truly believe, because I have experienced this over a period of time, that students can be TB champions. And I have seen not only the pharmacy students, but some other students also who had got TB. They became later the TB champions. So students, our students, why not? The pharmacy people, we are all for the health of the nation. So students can be TB champions, and we can focus if we have NSS units in the college. If not NSS, definitely we have some community service wings. We can take TB as a major focus area, thrust area, and channelize the young energy. If we all can do that, then definitely we can create an impact. And you all students can be a part of Jana Andolan, which is the national movement against the TB control. Next one. So the colleges can, there are multitude of possible outcomes, and there can be you can create awareness, as I said. And if we can have these students who can be later on maybe the community or hospital pharmacist also, we can have a pool of human resources available to support the TB program. Fighting with TB is not just the government's responsibility. It is for everyone. As Dr. Sunita rightly said, it is everyone's responsibility to stop TB, not also for that patient, but also for us, because safeguarding our lives is very much important. And that's because this is a major public health problem. During the pandemic, we can all start this work, but maybe not a field work immediately, but we can do this through telephone, through the online mode, and lots of ideas, thoughts, suggestions, questions, most welcome in this regard. And you may have many out of the box ideas. The young minds, I believe in young minds because they have a lot of fresh ideas, which we people may not have. So you can, discuss with your faculty members, your teachers, and you can decide a roadmap for yourself. Next one. But going forward, when you take up this as a challenge, because that's the actual objective and deliverable of today's session, that all colleges should work in the area of tuberculosis on a consistent basis. And this could be their part of their Unnat Bharat Yojana program. AICT, PCI, they all talk about this, and it is very important. And they can be part of Jana Andolan, as I said. To begin with, according to me, we should form a link with the National TB Control Program people in our town. That is to say, the district TB office or the city TB office. Discuss with them what are the challenges, where are the gaps, what is the scope for us, how can we contribute? And because we may have many ideas, but their needs might be different. So we have to decide the scope of work. Then we can, our faculty members, my colleagues from different colleges who are attending today, they can act as a facilitator. They can help the students to get trained, and then we can do the implementation. And this could be a consistent activity for every pharmacy college and not just one-time activity. And we need to document all this, because when we are doing something so good, something for the society, something for our satisfaction, we need to have good documentation, publish papers on it, publish articles on it, make this very visible so that others also get energy and inspiration to work like you, to replicate your efforts, because that way, that is the success, because then we have more hands working for the TB control, for this noble cause. Next one. Yes. So when we are talking today, we are talking of actually COVID. We are looking at the numbers, the number of deaths due to COVID, how many are infected, what is the infectivity rate. But believe me, even today, from last so many years, we have more than 1,000 people dying due to TB. And more than 4 lakh, 4.5 lakh each year die due to TB. And these numbers are really huge, and it's a big shame for our country that we have so many deaths due to TB, which can be definitely prevented. And the spread of TB can be prevented. Patients can be cured because it is very much curable if there is an early diagnosis and early treatment, and the battle against TB can be won. So we need to put our hands together to work for this noble cause. We have to fight against TB with full focus, with full hearts, and let's be on a mission. It's time for action and the clock is ticking. Next one. So this is another wake-up call after Dr. Sunita has given you a wake-up call. And I'm sure we all have to, we are all in the sector, in the field of pharmacy. We are all finally for the patients, and we are not for the medicines. We cannot be product-centric. Even if tomorrow you go in the industry or you go in clinical trials, you go in any field of pharmacy, you're going to be the pharmacist in your heart. And we need to have the dream that I will try to do the best for the society, for the health of the country, for the health of the citizens, that's how, that is wahi Desh Seva hai. See, it's not like we have to go on the border. Everybody of us cannot go on the border and fight with the enemies or something. We don't want that also. But then everyone can contribute to the TB control efforts, and that is our big contribution to the nation's health. So we have to see the dreams which will fuel and ignite our minds. Next one. So let's work together for the TB-free India. And I'm very sure after today's webinar, which IPSCPD has delivered for all of you, some of you will take up this as your major task, and we will all work together. Any support you need, we are there to offer you. And you can, I would like to listen, to the results, outcomes after maybe 6 months down the timeline, that how many webinars you conducted or what kind of awareness activities you did and how the students were involved. And I really hope for it, and I wish you all the best. And thank you very much for this opportunity to talk to you. I can see, I hope all of you can see this is the end of my presentation, but all of you can see a new road ahead, which takes us to the TB-free India. Thank you.
Thank you very much, ma'am, for such an informative and helpful session. Oh, we shall move on to the next program, to the next guest lecture. Now we have our very own Dr. Karthik Rakam sir. Dr. Karthik Rakam sir is the president of the Pharmacon Society for Pharmacy Practice, India. Dr. Karthik Rakam sir is also working as a medical advisor for Health Cloud AI, the winner of Ayushman Bharat PMJ Startup Grand Challenge, which was organized by the Government of India. Dr. Karthik Rakam sir is trained to work as a clinical pharmacist in Tertiary Care Center, where he had designed optimal therapeutic regimens in complicated cases of tuberculosis and HIV. Thank you very much for sparing your time and being here, sir.
Yeah, thank you. Can everybody hear me? Is my voice audible?
Yes, sir.
Yeah, so thanks, ma'am. Actually, you ignited certain emotions in me. So I thought of delivering completely different points than what I was prepared. So 20 years back, in 2001, I was diagnosed with TB. And maybe on this day, 20 years back, I was taking some TB medications and going through a hell. I thought of not sharing this, but because of some reason, I felt I could talk about it. And that time, the reason I'm talking is you will understand it later. So I was seeing my family going through a lot of suffering because of my health condition. And I did not feel like sharing my problems with them. So I'm sure many patients will be in such a situation where they don't want to add more problems to their patients, their parents, or members in family. They might be looking for some professional like a doctor or a community pharmacist or a clinical pharmacist or anybody who approaches them. So they might be waiting for such opportunity to share their problems and get some relief. So that is how patients go through. That is what patients experience with the deadly disease. And with me, unfortunately, I did not have a great experience from professionals, doctors. Whenever I went and whenever I wanted to talk, all they gave me was 2 minutes time, where I could not even tell what I was going through. And they used to simply say, everything is fine, please go. And after 2 years of all that suffering, when I went there and I did not find any relief, then they simply told me this might not be TB, it might be some other disease. get admitted again, we will evaluate you and we will take the next step. So I was so upset. Every 15 days, I was visiting a doctor, getting all the tests done, showing the reports, showing the medications, but I did not get any counseling or emotional support. Forget about emotional support, but even the basic support on how to take medications, etc. And now again, I remember one more point. The first 6 months of therapy, and I did not show improvement in weight or appetite. All I was having was a glass of fruit juice with difficulty, and I don't know how I survived those days. I'm happy that I'm alive today to talk to all of you. So after 6 months when I went and there was no response, it was shocking for me to hear the doctor said you might be using medications of substandard quality. That is why it might not be working for you. And I thought this guy told me about this point after 6 months. Okay. So that time I was, I think, 8 or 9-year-old. I was not knowing what was happening. All I was going through and suffering. So yeah, I wanted to share this before I my talk. Yogi, actually, you can share. Actually, I was not looking to share that. Yogi, you can share my journey. I wrote a small blog on the days I went with TB and how I overcame, etc. I will put in that box. You can read later. So can I continue, or I think Chairman sir has joined?
Yes, sir. I have posted the message in the chat box.
And you can start sharing my presentation. So I was asking, actually, Chairman sir has joined. So can I continue, or will sir give a talk? Okay, so now the actual topic, TB and AMR. Next slide. So I will start with definitions. So don't ignore definitions. There is a lot of thought process, discussions happen before they come up with a definition. Don't ignore. So actually, when I got an invitation to do this talk, I was looking for the most recent definitions and terminology. In the process, I landed up reading few documents, and I realized how much thought process goes into coming up with a definition. Okay, and most of the times we simply ignore what is there in definition and we use all our own language to define it. So I will directly talk with definitions of some resistance. So there is something called isoniazid resistant TB, in which the organism is resistant to isoniazid. So you should not stop at saying resistance to isoniazid. You should also say resistant to isoniazid and susceptible to rifampin. Okay, so we should. And then there is rifampin resistant TB. So they are not susceptible to rifampin, or we can say they are resistant to rifampin based on drug susceptibility testing. And along with isoniazid and rifampin, the other two first-line agents are pyrazinamide and ritonavir. So if the organism has resistance to them also, other first agents, we call it polyresistant TB. Next. So XDR-TB, the previous definition is 2006. I will not go through the definition. But the most recent definition is from 2021. So we will see that. And for that, there is a term called pre-XDR-TB. Last time, when I was giving a presentation, this definition is not exist. It was not in existence. So now there is another term called pre-XDR-TB, where the organism is RR-TB and MDR-TB with additional resistance to fluoroquinolone. So MDR strain with additional resistance to fluoroquinolone is called XDR-TB. And then we have XDR-TB, which is MDR-TB or rifampin resistant TB with resistant to fluoroquinolone. It means pre-XDR-TB plus resistant to another, at least one additional group A drug, which include levofloxacin, moxifloxacin, bedaquiline, and linezolid. So these are the definitions. Next. And I'll just talk, earlier speakers talked about burden of TB. So here there are some facts. So in 2019, approximately 2 lakh cases of MDR TB are detected and notified. So, but that is an underestimate. Only represent 44% of the estimated ones, and even estimated ones can be an underestimation. So at least lakh MDR TB cases are notified and 1,000 HDR TB cases are notified from 81 countries, and India is occupying a prominent place in, unfortunately, in those countries where HDR TB cases. So coming to outcomes, the outcomes are poor actually. Only 57% of people completed treatment. I will tell the definition, what it means by treatment completion, cure, etc. So only 57% successfully completed the treatment. Okay. So really poor. And the reason is because it is MDR TB, it is very difficult to achieve cure compared to drug susceptibility. Can mute the other part. Yeah, and why should we worry about resistant TB? I have given some facts here. It's very difficult to treat. Treatment is complicated. Duration of treatment is very long. As Majirima was telling, it can go up to 2 years. Okay. Treatment outcomes are very poor. It is estimated that MDR TB will kill 75 million people in next 35 years time. Okay. And Sunita ma'am was talking about AMR. So if 3 deaths happen because of AMR, 1 death will be because of resistant to TB drugs. Okay. Treatment options are limited. The drugs are highly toxic, lot of ADRs. They are expensive. So there is a statistics shows to treat drug resistant TB, you spend 1,000 times more. For example, if you are spending 1 rupee to treat susceptible TB, you'll be spending 1,000 rupees to treat resistant TB. And there is an example again in South Africa, 32% of budget is consumed to take care of resistant TB, though it accounts for only 2% of cases. So this is not proper way of utilizing the resources. Okay. And these medications are not always available. You can go to previous. These medications are not always available like the first line agents, and it is difficult to achieve cure, difficult to stop the spread. And this MDR TB can progress into pre-HDR TB and XDR TB. And the other reason why we should worry is we have a goal of eliminating TB. And if it was just drug susceptible TB, maybe there are chances of achieving the target. But because of resistant TB, it is extremely difficult to achieve the targets which each country has set for itself. There is huge economic burden also. So this is the most important slide in this presentation. Yogi, next slide. I'm talking about the 2 kinds of resistance, primary resistance and acquired resistance. Unlike this COVID virus, the bacteria which causes TB naturally does not mutate and develop resistance. That is extremely rare. It can be less than, I think, even 1%. 99% of the times, the resistance is acquired resistance. I will explain what it means. So it means actually an individual is exposed to drug susceptible TB. Okay. Then he is infected with drug susceptible. Because he is infected, he develops active drug susceptible TB. Once he develops active drug susceptible TB, if he gets access to diagnosis and treatment, he will be exposed to TB drugs. But if the treatment is incomplete, or if the quality of drugs is not proper, or patient stops taking it before the completion of therapy, whatever reasons, if the treatment is not completed, ineffective, substandard, then this active drug susceptible TB gets resistance, called acquired resistance, and converts into drug resistant TB. And then again, patient gets exposed for second line agents and further resistance. Okay. So acquired drug resistance is the thing which can be addressed actually. We cannot do anything with the drug resistance if organism develops it through its natural mutation. But fortunately, that is very rare. Acquired drug resistance is where we should focus all our energy. And I will tell you a few reasons. And at the end, I will share my experiences also. A few points which can help you to address. Okay, next slide, you. So I have listed out these factors which contribute to drug resistance. We have classified into like provider-based factors, where basically doctors are responsible, and drug-related factors, especially the pharmaceutical industry involved here, and patient-related factors. ultimately patient is the one who has to take all the medications. So these are the three broad reasons. So coming to healthcare providers, not following the guidelines is the bigger reason, and poor patient education. And basically, they don't have time to educate the patient. And from my experience, diagnosing is a challenging thing compared to treatment. So basically, when doctor makes an accurate diagnosis, 90% they are happy. And when they start appropriate therapy, 95 times they are happy. It's 95% they are happy. But the other important thing which lacks is the monitoring. That is where a pharmacist will come into picture, which is important, which is ignored by other healthcare professionals. So they don't monitor the treatment. Happy by making an accurate diagnosis and starting appropriate therapy. And coming to drugs, here actually I'm reading the point like poor quality medications, but I experienced it 20 years back. And sometimes the medications are not available. They are not stored properly. We don't have proper combinations. And actually last presentation when I made to this college, I gave an example. Doctor intention is to give a combination of isoniazid and rifampin. But for some reason, patient ends up getting only either isoniazid or rifampin. So patient thinks, doctor thinks patient is taking 4 medication, but patient is only taking 3 medication. And when somebody goes and evaluates their medication, they will realize patient is only taking 3. So if you are subjecting susceptible organism which needs 4 drugs and you are giving only 3 drugs, you are encouraging it to develop resistance. That is why it is acquired resistance. It is not because of that organism. It is because of our fault and not treating it appropriately. It develops resistance. Okay? And coming to patients, they don't have information. They have fear of ADRs. And honestly, believe me, I was going through hell when I was taking this medication. It used to take me around 1 hour in the morning to finish taking all the medications. Take one medication, wait for 15 minutes, wait for some more time, take again another medication, control the urge to vomit. And patients lose appetite, don't take like taking food. And that malnourishment again contributes to worse outcomes. Okay. There are social barriers. They don't feel like disclosing it to their own family members or relatives, etc. And on top of it, if they have HIV, the outcomes are worse. Diabetes don't respond well. Malabsorption. And here I have made many interventions, especially isoniazid and rifampin. They have to be taken before meals, before breakfast. But because the patient is not educated, or even if they are educated, they might not understand the reason why it should be taken on an empty stomach. So they happily take it after food. Absorption is decreased by 50%, contributing to poor outcomes. Okay. So every point which I mentioned this in this slide can be addressed by a clinical pharmacist. Unfortunately, what we are doing is carrying a lot of information in our head, but we are not putting it into practice. So it is like having a kitchen with all stove, gas, all material necessary to cook proper meal, but you don't take any effort to cook a meal and eat. So there is no point of carrying all this information in head and not putting it in practice. Especially as a pharmacist, we get this opportunity every day to implement our knowledge and make a difference. Next slide. So what can we do to prevent drug-resistant TB? I'll give more specific points later. One simple thing that can be done is take TB drugs exactly as prescribed by healthcare provider. Okay. Don't miss any doses and don't stop the treatment after you show symptomatic improvement, because like let's say you start taking these drugs for 2 or 3 months, all your symptoms will go, your appetite will improve, you'll feel healthy, you will feel everything is fine, and you will feel like stopping the medication. But not do it because the organism can develop resistance. You complete the treatment course. And if the patients face any trouble taking medications, talk to their healthcare providers. If doctors don't give time, talk to a pharmacist who will definitely give time and try to come up with some solution. Have a mechanism where we can quickly diagnose, follow the recommended guidelines, monitor the patient's response, and we should make sure the treatment is completed. At every aspect, actually, I made an intervention in my internship days. And if patient has drug-resistant TB, isolate them and try to avoid exposure. Next. So there are different things which we can do to and support the patients. Important is health education and counseling. And there are certain things called treatment adherence interventions. You can be using a tracer or a digital medication monitor. You provide material support, psychological support, staff education. So don't underestimate the importance of psychological support. That plays a huge role. And there are certain strategies in treatment administration also. It can be a community or home-based or direct observed treatment. And it is superior over unsupervised treatment. Okay. It can be done by a layperson or a healthcare provider who is trained compared to a family member or compared to administering the treatment unsupervised. And there are certain new things like video observed treatment also. Now today, we don't have to meet at a place to observe this conference. We can sit at our home and do. Okay. Next. So actually, as all the speakers were telling, came together as a team. I'm really fortunate to be working with this core team of IPS CPD, Rajvaidya sir, Manjari ma'am, Sunita ma'am, Yogi, and myself. So we have taken upon certain initiatives, and we have many other initiatives in pipeline. So currently, Jan Andolan, your college is definitely involved here, and we are also recently launched a national-wide antimicrobial resistance program, and we are doing events for World Health Days. Recently, we did World Health Day. We are planning Hypertension Day next month, etc. We are looking for interns to join our team, and I'm sure you will have a great learning experience. You will get a thorough mentorship, and if you are expecting a certificate, we will give that also. All we need is maybe 4 hours of a week commitment, and if you are interested to involve, make a difference for yours and for others. So Yogi, you can thanks for giving me this opportunity. I would like to show you a guideline or a document from where I collected this information. Check that PDF. So the reason I'm telling this is, especially for students, only when you know things, you can put it into practice. First step will be knowing things and learning things from proper resources. Once we achieve the first step of learning, second step will be to implement it in practice. And for learning, I suggest you to start with a standard textbook. And my recommendation will be to start with DPRO, which covers every disease extensively, especially with pharmacist perspective. But textbook again is limited, because let's say if you read tuberculosis chapter in DPRO textbook, maybe it will be 15-20 pages. But all of us have spoken about how challenging it is to manage it. When you think you can learn everything, how to manage this highly complicated disease in 10 minutes, 15 minutes, or by reading 10 pages in a textbook. But reading a textbook gives you an understanding. You will know certain things. But ideally, if you really want to make a difference, you should not limit yourself to a textbook. You should read guidelines. Okay? Here, if you see, this is a 120-page guideline given by WHO and only on drug-resistant TB. I'm comparing it with a chapter in textbook. A chapter in textbook has 20 pages, and in the 20 pages, only maybe 2 or 3 pages is dedicated to discuss drug-resistant TB, which I think will again give you basic, brief understanding, but not enough information to make a difference. So start with the standard textbook and go with the guidelines. Yogi, actually, you can scroll it down. So here, the treatment guideline is only for drug-resistant TB. If it is drug-susceptible TB, maybe it will be again 150-page guideline. So TB alone, we have 500 pages guideline which discusses everything which everybody should know to manage it appropriately. Hold on, scroll down. And if you read this, actually, you'll thoroughly enjoy. So this is the contents. I'll not, keep the content. So I was talking, right? Yeah, go up. Keep the contents page. Up in the sense, like page number, contents. I gave a definition, right? So I said isoniazid resistant TB. So what should be done in isoniazid resistant TB? Then rifampin susceptible TB, you can see. Then rifampin susceptible TB actually is treated like MDR TB. What are the shorter regimens for rifampin susceptible TB? What are the longer regimens for rifampin susceptible TB? Then the other, like what all things should be monitored when you are taking care of patients with MDR TB. Okay. And then because TB and HIV most of the time go together, it is like an offer. Okay. So you should learn about antiviral therapy in patients with TB. And then what is the role of surgery and care and support? Yogi, actually go to this research gaps page. There are, again, in spite of so much information, there are a lot of gaps in research. So you can keep scrolling it slowly. So all this can be taken as your 5th year PharmD projects. And if project is there in B Farm, it can be taken. A lot of information is generated. Lot more information needs to be generated to address the research gaps, which as a pharmacist, which we should try to fulfill. Hold on. Still down. I just wanted to show this. Where are the research gap in terms of care and support for patients? This 8. So section 8 talks about care and support for patients with MDRP and patient support and treatment supervision interventions that are best suited in particular population. WHO has given some recommendations like, let's say I gave a recommendation called video observed treatment. But how well it will be effective in countries like India, which comes under low and middle income countries? That is a question mark. A lot of information is not there. Maybe that strategy might have worked well in high income countries. But here, how does it work? We are not sure. So now we talked about psychological support. What psychological support is more appropriate for our patients? There is a gap there. So all these gaps definitely require a proper research. And once we come up with good data, we can serve our patients. And this can be taken, because why I shared this is, if a 5th year student send me a message, hi, I can assume that they are going to ask me PharmD project suggestion. And if 6th year students ask me, they send me hi, most probably they are going to ask me how should I make use of my internship proper. Okay, so there are many things to be done provided you are interested. So that ends my presentation. If I still have time, I can share maybe 6 or 7 points which are more applicable in hospital setting, which can help you as the TV better. If not, actually, we are planning a workshop. Unfortunately, because of this pandemic, we could not do it offline. We will definitely do it. And I'm sure I will spend 4 hours doing that workshop where I will discuss everything thorough. We wanted to do it, in fact, last month. At night when we planned, next day, government announced that all education. Yeah, so thank you so much for presentation. So as I said, to conclude, we have so much information in our head. It is time for action. We should put in practice. Make sure at least we make one TB patient better. That is as good as anything. So still I have more time, or?
Sir, if you would like to add a few points, or if there's anything else, you can go ahead, sir. Please.
Sure. So I'll take 5 minutes and add and stop my video. These are extremely relevant in hospital setting. Okay. I listed those points based on that. Yesterday I sat for some time and listed out certain things which you might miss. So I will tell the definition of cure. So we cannot simply say, okay, we started the patient on treatment and doing well. So cure means treatment is completed as recommended without any evidence of failure, and 3 or more consecutive cultures taken at least 30 days apart are negative after the intensive phase. So I really love reading that such kind of information and trying to understand. So when can we call a patient cure? So first criteria is the treatment should be completed as recommended. Second, there should not be any evidence of failure. Then we should do 3 cultures, and this culture should be taken at least 30 days apart. For example, if you take culture on 1st March, next culture should be after 30 days. And this should be taken after intensive phase. Let's say intensive phase is 2 months. You should not do it during intensive phase. You start treatment, wait for 2 months until intensive phase is over, then take a culture, then take another culture 30 days apart, and you keep taking so that 2 consecutive cultures should be negative. Let's say first culture is negative, second one is positive. So you cannot call that patient cured. Okay, so that is how effective the definitions are. And maybe let's say if you are seeing a patient of TB in your hospital, you should make sure patient fulfills all this criteria. Only then you can call it cured. Otherwise, you should not be classifying it as cured. Okay. So the other important point which most of the times is missed is, let's say if it is not a pulmonary TB, let's say it is CNS TB, you should choose drugs which achieve adequate concentrations in it should achieve penetration in meninges. Why? Because let's say patient has TB meningitis. You have given 4 drugs, but out of these 4 drugs, 1 drug does not have enough penetration into meninges. So organism will be exposed to only 3 drugs, and because it is not exposed to 10 drugs properly, that can develop resistance. So in first line agents, actually, ethambutol does not have adequate penetration into CNS. So you can suggest ethionamide in place of ethambutol if you are looking to treat a patient with TB meningitis, and this applies to other TB drugs also. You make a list of all the TB drugs which has enough penetration into meninges and recommend those drugs if you see a patient with TB meningitis. Okay. So next other important thing is there is a risk of seizures for certain MDR and HDR TB. You use carbapenems. So there are many carbapenems, but if patient has risk of many seizures, you should go with meropenem. Let's say doctor has given imipenem and cilastatin, and patient developed a seizure. Most of the time, what happens in hospital setting is a doctor does not think it is drug induced. They think it is disease induced, and what they do is they add a drug for epilepsy or seizures. I don't really think the seizure is because of medication. I have seen few cases where patient developed seizure with carbapenem, and healthcare provider added 3 drugs for seizures, and still it was not under control. I made an intervention. I said this drug might be causing. They withdraw the drug, and simply the patient responded better. So that is one factor to keep into consideration. This is about ADRs. Let's say patient developed an ADR seizure, and he really it is scary. Patient will not feel like taking that medication. So as a pharmacist, we can ask them to go for a better alternative which has less potential to cause. So, and another important thing is, most important, this I have seen many mistakes happen. I have read that statement. If a person is infected with a strain, and if that strain is resistant to any one TB drug, and if you are giving that TB drug to patient and adding one more TB drug, the other drug which you added will also develop resistance. So it is very, very, very important to know the drug susceptible status before you initiate and recommend any drugs for patient. Did you understand? Let's say patient has resistance to isoniazid. Without being aware of this fact, you started isoniazid, and along with isoniazid, you started rifampin. So there are chances that rifampin will also get resistance. So that results in getting resistance to other drugs which patient is already not resistant. It is very important to individually check the drug susceptibility pattern. But if that is going to add to cost, and if that facility is not available, so you should take population level data and then recommend treatment. These little things can make a huge difference. Okay. And the other thing I wanted to share is about the adjuvant therapy that can be given in TB. So if it is TB meningitis and if it is cardiac TB, along with TB medication, outcome will depend whether you give a corticosteroid or not. So whenever you come across CNS TB and cardiac TB, you should make sure doctor gives them corticosteroids along with TB medication. And like you can make a note of these drugs: cycloserine, terazidone, isoniazid, linezolid. All these drugs has a potential to cause B6 deficiency. So whenever you come across a prescription with these drugs, as a pharmacist, you should recommend them B6 supplementation. Okay. And we have seen, right, in MDR, HDR, TB, patients will be receiving a regimen containing fluoroquinolones. Okay. And when fluoroquinolones are there, and if patient is taking a vitamin supplement like calcium, iron, zinc, etc., especially the divalent cations, they have interaction with fluoroquinolone antibiotics. They form complexes that decreases their absorption and leads to poor outcomes. Okay, because I think most of the time when I ask for an interaction, the common interaction I get is tetracycline with milk. In that way, there are others also, especially divalent cations with fluoroquinolone class of drugs which are used in MDR and HDRT. And the other reason why patients don't tolerate is failure to adjust the doses in renal impairment. Patient has TB plus renal impairment. And if you continue to give them full doses, just like you are giving it to a patient with normal renal function, they are more prone to develop toxicity. As a pharmacist, we should assess the patient's renal function, and we should adjust the TB drug doses based on their renal function. Pyrazinamide, ethambutol, levofloxacin, cycloserine, dapiromycin, kanamycin, streptomycin, amikacin. All these drugs require dose adjustment in the renal impairment. And actually, this was my daily job. Whenever when I went on rounds, doctor used to tell me adjust the doses of whatever drug is required in patients with PV. Okay. And maybe other points we can discuss later. I will end with a question. So the other important toxicity with TB drugs is hepatotoxicity. So generally when we read, okay, if patient has hepatotoxicity with TB drugs, give a hepatic sparing regimen. But the fundamental thing is, how can you say or when can you say patient developed hepatotoxicity? That is ignored. And honestly, even I ignored when I read TB in my 3rd year. In my 5th year, I learned it. So most of us are aware that with TB drugs, it can cause hepatotoxicity. And if patient notices hepatotoxicity, give a hepatic sparing regimen. My question is, when can you call it hepatotoxicity? Okay, so I will leave with this question. You can always reach me like Srinivas sir and many students I'm connected. Send your answer on WhatsApp. Okay. So thank you so much for this opportunity. And today we came together and this relation should continue. And we should not restrict ourselves to just giving talks. So we have enough motivated people. We have enough knowledge with us. We have enough passion and commitment to do certain things. So this should translate into action. So thank you so much.
Thank you very much, sir. We actually have a few comments and questions in the chat box. Professor Sunita ma'am would like to say that Dr. Karthik, at the end of the session, the gaps in research in the WHO reference is an excellent example of no-do gap because we need data from our country. So utilizing 50-year projects as suggested by you is the first step towards doing meaning research that informs our gaps. This is said by Sunita ma'am, sir. And we have one more question from a student that says, sir, in which stage oxygen is needed to be administered artificially in case of tuberculosis? Is it needed to administer oxygen artificially?
So at least I have never come across any case where patient, so they respond well. Means in my practice, I have never seen any patient.
Okay, sir, thank you very much. Thank you, sir, for sparing your valuable time and giving us this extremely informative session. Rachna, do I have Rachna, my fellow anchor here?
Yes. Now we'll have the presentation of Dr. Gautam Subbaya Kaletenda. Gautam Subbaya Kaletenda is an infectious disease specialist in Gainesville. He is an Associate Program Director of the Infectious Disease Fellowship in the University of Florida. He is also the chairperson of Fellowship Competency Committee. He is also working as chairperson of the Clinical Committee. Sir is working in the TB, Tuberculosis Physician Network. Sir is also the Division Education Director. Dr. Gautam Subbaya Kaletenda is a collaborative learning group leader for medical students.
Sorry, I forgot to ask, is this audible?
No, Yogi, it's not.
Yeah, fine. Sure.
Yeah.
I just got doubt whether that was audible.
I was about to tell you. Yeah, thanks.
Fine.
Good morning, everyone. I'm Gautam Kaletenda. I'm in the Division of Infectious Disease and Global Health at the University of Florida in Gainesville, the US. I thank you for having me as one of the speakers in the Jan Andolan, Mission for Tuberculosis Free India, which is organized by the Sarojini, Naidu, Vanitha Pharmacy Maha Vidyalaya and the Indian Pharmacy Association, the Community Pharmacy Division. So before I begin, my thoughts are with everyone in India as we fight this pandemic, which has ravaged every part of the country. Although it might seem a little trivial to talk about tuberculosis while we are surrounded by COVID-19, remember that there are many other infectious diseases that keep killing people every day. So to give you a perspective, about 1.4 million people die of tuberculosis every year. That's about 160 people who die every hour, on the hour, day after day, month after month, year after year. Close to about 500,000 people die of tuberculosis in India every year. This when it can easily be cured with common antibiotics. India accounts for about a quarter of the global burden for tuberculosis. In 2019, the estimated TB incidence was about 2.6 million. As you know, and as probably the speakers before me have alluded to, the World Health Organization TB statistics for India for 2019 give an estimated incidence figure of about 2.64 million cases, which is roughly about 193 per 100,000 population. So as you can imagine, lots of people are suffering from tuberculosis in India, and lots of them probably go unnoticed. It's estimated that about 40% of the Indian population is infected with TB bacteria. The vast majority of them have latent TB rather than active TB disease. Now, as you probably already know, those are completely different disease patterns and needed to be approached very differently. So without focusing on latent TB treatment strategies for interrupting the chain of transmission of the tuberculosis disease, it's going to be extremely hard to achieve elimination targets that the government has set up for us. There's also a large overlapping socially and medical vulnerable populations like people living with HIV, pediatric TB contacts, children with protein energy malnutrition, homeless people, and even adults with low BMI. Remember, for a lot of vulnerable people, TB is the last thing on their day-to-day agenda. They have a lot of other things that they have to focus on from a day-to-day perspective. For example, let's just think about this. For someone who is a daily wager in India, you are asking him to take tuberculosis therapy for 6 months. Now we know he starts to, but then you're asking him to go to work every day with all the side effects associated with those 4 drugs, which make it extremely hard to even go to work for some of us who sit in a desk job, right? So imagine someone who actually has to go and actually do manual labor. So I think what we really need to also focus on is giving them the social support, the foundation and the infrastructure for this, so that we can help them through this whole process of therapy. So what's encouraging is the fact, as per the National Strategic Plan for 2017 to 25, there's a focus on consolidating the achievements of previous NSPs, right? So the new National Strategic Plan for TB elimination has incorporated many things like provision of digital X-ray with artificial intelligence and teleradiology, universal drug susceptibility testing, which is the most important thing because it actually tells us if someone is resistant to a drug or not. Right, and most of these are rifampin drug resistance tests based on CBNAT and other platforms. So we also have a sentinel surveillance system in India with the National TB Institute Bangalore as a nodal center, and there is a plan setting up those sentinel centers at 10 different sites. So as Madhukar Pai noted in his paper recently, even before the pandemic, right, the cascade of TB care in India has been leaky with long diagnostic delays, complex pathways, and really poor care being provided in public as well as private health sectors. And what we really might be looking at is the tip of the iceberg in terms of high TB fatality rates. right? What the new COVID-19 pandemic has done is really stretched the infrastructure that we have, and probably pushed all our targets back by many years. So again, we know that fewer children receive BCG therapy because of the COVID-19, fewer patients receive DOTS, and testing has decreased quite substantially and drastically, with health resources being reallocated for COVID-19 work. So why is elimination important? Remember, without elimination, no one is really safe. So we spoke about the latent TB, which is, unless we take care of latent TB infections, we really can't get rid of infections because they are a focus that we all have. And we've seen cases of active TB in patients who were exposed to TB like 60, 70 years ago. So unless we focus on latent TB and treating latent TB, I don't think we can achieve elimination. But again, what's important is, I think, tuberculosis anywhere is tuberculosis everywhere. So no matter which part of the world we live in, as this COVID-19 pandemic has shown us, viruses, bacteria don't respect boundaries, right? National boundaries, the geography. So we have to, I think, focus on elimination of tuberculosis worldwide, so all of us in the world are safe. So with that, I want to thank you for giving me this opportunity again, and please stay safe, and thank you.
Thank you, sir, for an informative webinar. Now, we would like to express our gratitude and appreciation for the time and effort you all took to share your knowledge, thoughts, and experiences. Your comments and presentation has been very interesting and helpful to all of us. Thank you. Over to you, Richa.
Thank you very much to all the guest lecturers who have spared their invaluable time and gave us their knowledge and experiences. Thank you, sirs and ma'ams. I would like to express my honor to call upon our chairman, sir, Mr. B. Prabhashankar, to speak a few words. Sir, Prabhashankar.
Am I audible?
Yes, sir, you're audible.
So, on behalf of Sarojini Naidu, Vanitha, Pharmacy Maha Vidyalaya, and Indian Pharmaceutical Association, Community Pharmacy Division, Indian Pharmaceutical Association, Telangana State Branch, and Pharmacon Society for Pharmacy Practice, we all together organized today the Jan Andolan Mission for Tuberculosis Free India by a virtual conference. And I am very happy to see that so many good and eminent speakers were present and giving their expertise on this management of tuberculosis and how. And especially like to express our sincere thanks to Madam Professor Sunita Chandrasekhar Srinivas, a visiting professor, Rhodes University, South Africa, special interest group member, IPA CPD, for talking on tuberculosis, a primer, which was followed by Mr. Raj Vaidya, co-lead antimicrobial stewardship initiative, IPA CPD, who spoke on National TB Elimination Program. Then we would like to express our sincere thanks to Mrs. Manjari Garat, Vice President IPA and Chairperson IPA CPD, for speaking on IPA's DOTS TB Pharmacist Project and how pharmacy institutes can contribute to TB-free India. Then I heard the lecture of Dr. Karthik Rakham, who spoke on managing the double trouble of TB and antimicrobial resistance, and also heard Dr. Gautam speaking on infectious disease specialist, means eradication on TB by 2025. It is very surprising to see that this 25% of TB patients are residing in India, and 2.64 million people are suffering throughout the world with TB. And out of that, around 9,700 people have died. HIV patients have died, who were also TB patients. And thanks to Indian government, which has come with a national strategy for 2025 to ensure that they would like to eradicate TB by 2025. I don't know whether they will be highly successful in that, because the TB cases are increasing day by day, and the most challenging job for pharma professionals and medical profession is the resistance in TB patients. And we have got various types of medications available today, but also facing the challenge of resistance coming across with those medications. And the pharmacist has to come out with new medications for the treatment of TB. And today's patients. Hello. I'm able to. You are able to hear me?
Yes, sir.
Yes, sir.
Yes, sir, you're audible.
Yeah. Because I saw that when we were studying B pharmacy in 1975, the TB sanatoriums used to be there outside the city outskirts, and the people who are going to TB sanatoriums were treated like untouchables those days. But gone are those days, and nowadays, patients with TB, as it is curable, treatable, and they can have the treatment as well in the city itself, in the hospitals available to them. And most of the patients, I heard that they do not know that the government gives free medicines for the TB patients in the government hospitals, but everybody prefers to go to the private hospitals because of the social status. And also people do not inform the others also that they are suffering from TB because of the social obligations. And the word TB is so spelled like it is like a HIV, where a person today, the moment we come to know that a person is suffering from corona, we run away from those people. Same case happens with the TB also. But nowadays people are able to know that the awareness is there, that TB is treatable, curable, and our role of pharmacist should be to bring awareness among the general public by doing various activities to tell them that TB is treatable and there are medications, and also we can educate them about these resistance issues, and they should not stop medications halfway when their symptoms are gone. So they have to consult the medical professionals for the treatment, for the completion of the treatment. And we have nowadays chest hospitals everywhere in India, which are treating the TB patients also. So our message of pharmacists should go to the general public for bringing awareness among them, and also what kind of help we can do as a pharmacist, especially to the doctors as well as to the patients. And I would always suggest that our pharmacy students also should pay a visit to the chest hospitals which are located in the city or outside the city, and visit the TB patients, and also give them assurance that they will be that they will come out with a successful treatment of TB. And we should also ensure that there is enough research going on to find a new medications for the treatment of TB because of the resistance issues. And I once again would like to express my sincere thanks for all the guest speakers for coming forward to join our one-day virtual conference on Jan Andolan Mission for Tuberculosis Free India. I look forward for many such events in association with the Indian Pharmaceutical Association Community Pharmacy Division, and also Indian Pharmaceutical Association Telangana State Branch, and Pharmacon Society for Pharmacy Practice. Thank you very much, all of you.
Thank you, sir, for your kind words. Now I would request our Vice Principal Ma'am, Dr. Sarita Jyotsna Ma'am, to speak a few words and deliver the vote of thanks.
Thank you, Akanksha. Honorable dignitaries, respected faculty of various colleges, and my dear students. We are very fortunate to have some eminent speakers from the academia and industry. I deem it a pleasure and honor to propose the vote of thanks on this occasion. I would begin with a quote by Randy Pausch. Showing gratitude is one of the simplest, yet powerful things humans can do for each other. With this note, on behalf of the management and the entire staff of Sarojini Naidu Vanitha Pharmacy Maha Vidyalaya, I extend a hearty gratitude to our distinguished speakers for gracing your presence and sharing your valuable thoughts and opinions today. We thank the management for providing us this platform and logistic support where we are able to join virtually and share our thoughts. We are indebted to our Chairman and President IPA Telangana State Branch, Dr. B. Prabhashankar Garu, who constantly motivates and guides us to achieve our endeavors. We are profoundly grateful to our collaborators, Indian Pharmaceutical Association, Community Pharmacy Division, Telangana State Branch, and Pharmacon Society of Pharmacy Practice for initiating and helping us to organize this seminar, Jan Andolan, Mission for a Tuberculosis-Free India. We are thankful to our director, Dr. N. Srinivas Garu, and our principal, Dr. V. Jyoti Garu, for your continuous support and advice, which had greatly helped us to successfully organize this seminar. I express our deep appreciation to our first guest speaker of the day, Professor Sunita Chandrasekhar Srinivas Garu, visiting professor, Rhodes University, South Africa, for sharing your thoughts on tuberculosis, a premier, and explaining to us TB fact sheets. We are grateful to Mr. Raj Vaidya Garu, co-lead antimicrobial stewardship, Initiative IPA CPD, for demonstrating your expertise on tuberculosis and elimination program, and also you are explaining us the revised technical and operational guidelines for TB Control India, and also national strategic plans for 2017 and 2025. And we express our sincere thanks to Mr. Manjari Garrett Garu, Vice President, IPA and Chairperson, IPA CPD, for enlightening us on the topic IPS.TB Pharmacist Project and how Pharmacy Institute can contribute to TB-free India, and also she explained the role of pharmacists in eradicating the TB. We also express our heartfelt gratitude to Dr. Karthik Rakabgaru, President, Pharmacon Society for Pharmacy Practice, for sharing your valuable thoughts and managing the double trouble of TB and antimicrobial resistance. And also, sir explained his personal experience related to TB. We are very grateful to Dr. Gautam Subbaya Garu, an infectious disease specialist, assistant professor, University of Florida, USA, for highlighting the importance of eradication of TB by 2025. I extend gratitude to all the delegates of the seminar for your participation, and we hope that you have benefited greatly from the various sessions and will use the knowledge gained through this in various spheres of life. I am also thankful to scientific committee for their valuable suggestions. Last but not the least, I am thankful and fortunate to be backed by a team of enthusiastic and dedicated colleagues and staff who were involved in careful planning and organizing and are essentially the backbones for the successful conduct of this virtual seminar. And I once again thank everyone whose contribution has been profoundly significant, and it has been a great pleasure in sharing the platform with all of you. Thank you all.
Thank you very much, ma'am, and thank you to all the speakers who made our morning so enlightening and informative. It has indeed been an amazing session. Well, I think it's time to see what talent my fellow classmates and students have got. So it's time to move on to the competitions. Over to you, Gauri or Akanksha.
Yeah, yes, Richa. So now I would like to start the following program with elocution. The topic, competition on Jan Andolan to eradicate tuberculosis by 2025. So now let us have Aisha Tabaya from Family 5th year. Aisha?
Aisha Tabaya from Family 5th year. Do we have you?
I think Aisha hasn't joined yet, or there are some connectivity issues. We can move on to the next participant.
Okay, so let us have our next participant, who is Salva Mohammed from B Farm 4th year.
Good morning, ma'am.
Yeah, you can come.
Okay. Good morning to one and all. Today's topic of elocution is Jan Andolan to eradicate tuberculosis by 2025. Jan Andolan is mass movement or public movement. So why do we need to eradicate tuberculosis by 2025? Because failure to do so will cause serious individual and global public health consequences. Tuberculosis is potentially serious infectious bacterial disease that mainly affects the lungs. In India, tuberculosis kills 480,000 persons every year and more than 1,700 daily. The Government of India announced its plan to eliminate tuberculosis by 2025. India must start to seriously tackle key determinants of tuberculosis, especially poverty, undernutrition, and tobacco smoking, which have been clearly linked with tuberculosis and mortality. As per Dr. Harshvardhan says, at a time when COVID is taking prioritized attention, we should not lose the sight of goal to eliminate tuberculosis by 2025. Fight against tuberculosis needs to be through Jan Andolan, a people's movement. So, for tuberculosis to eradicate, we need an effective communication strategy which would focus on reaching the maximum population, complement with preventive, diagnostic, and curative aspects of tuberculosis management. While high level of political commitment is welcome and necessary, the real question now is how India can go from rhetoric to real progress. Here are some suggestions that might help bridge the gap between ambition and reality. First and foremost, India needs to give priority to and begin investing in health. For decades, Indian government expenditure on health has been one of the lowest in the world, at 1.4% at GDP. Furthermore, India must invest in research and surveillance. Research will need to focus on development of new tools, while surveillance will require periodic service. It is very important to have early diagnosis of tuberculosis, including universal drug susceptibility testing, treatment of all people with tuberculosis, including drug-resistant tuberculosis, and patient support in chief concern. In conclusion, India's plan to eliminate tuberculosis by 2025 demonstrates much needed ambition and intent. We call on Government of India to ensure that declaration is followed through by ensuring adequate funding and implementation support. I would like to quote Asadi. I saw poverty loading its pistol with malaria and tuberculosis to shoot humanity on the forehead. Thank you.
Thank you, Salva. Next, I would like to call Janavi from B Farm third year.
Before starting, we request all the participants to on their videos before presenting and during the presentation, elocution.
Janavi from B Farm third year. We'll go with the next. Saishta from B Farm third year.
Am I audible?
Yes, sir.
Good morning to one and all. My name is Shaista. I'm here to speak on the topic Eradicate TB by 2025. Tuberculosis is the biggest killer among all the other infectious diseases on the planet. Tuberculosis is a lung disease caused by a bacteria, Mycobacterium tuberculosis, particularly common in poorer socioeconomic communities with dense living conditions. According to World Health Organization, about 2 billion people worldwide are infected with TB. It spreads primarily by droplets sprayed out when an infected person coughs or sneezes, explaining why it thrives in closed communities. The resurgence of what was thought as a low-key health problem is due to global epidemic HIV. HIV weakens the immune system and gives TB an opportunity to overcome the body's defense and destroy it. Globally, tuberculosis claims 1.5 million people every year, two-thirds of whom are HIV infected. These statistics are exacerbated by the spreading of multi-drug resistant tuberculosis. TB can be controlled by improved screening and testing methods and enhancing the monitoring of disease and patients and the screening of tracing of TB contacts and providing access to effective drugs. But this is not enough. The problem remains on one scale. The scientist plays a key role in knowing and treating the disease. Instead of treating the disease, they can prevent and even can eliminate it. The World Health Organization has set a goal, virtually eliminating TB by 2025 by reducing the TB deaths by 95%, which is global pandemic, as a part of global pandemic. So, however, to achieve this, every patient must have access to effective diagnosis, treatment, and cure.
Sorry to interrupt you. You have 30 seconds left for your elocution. Yeah, Please, you can
Okay.
continue.
So lastly, in India, the government is implementing national strategies plans to ensure to end TB by 2025 by funding over 12,000 crores for the next 3 years to ensure that every TB patient has access to quality diagnosis, treatment, and support. Therefore, TB is treatable and curable, and it can be eradicated if we have the will. Modern science, political capital, and social drive can make this possible. Thank you.
Thank you, Saishta. Now let's go with Harini from B Farm third year.
Yeah. Okay. Good afternoon, everyone. Able to hear me?
Yes, Harini.
Yes, Harini.
Okay. So, well, today's we start off by so I just all we've been talking about how to eradicate tuberculosis by 2025. It's so as you all know today, TB is still one of the world's biggest infection killers, causing more deaths than HIV or malaria altogether. So, as as an individual, as a pharmacist, what can you do to eradicate by simple steps? You can um, spread awareness by telling everyone, to increase immunity. In a way, by increasing immunity, you can fight tuberculosis. And as we have learned till now by the all the webinars held till now, that there's been stigma towards TB, and which discourages people from getting any help they need. So we need to bridge the gaps which may delay our process to eradicate the tuberculosis. Like we need to develop better diagnostics, faster acting antibiotics, more effective vaccines. Um, as you all know, for children, BCG vaccine is being given. Children suffering from tuberculosis, which may not be much effective for adults. So we need to prepare more effective vaccines which can be equally effective for adults as well. And as a pharmacist, we can even monitor tuberculosis through Arogya Setu app or any other developed apps for this certain matter. And um, and hopefully with these advancements, we can be able to exclusively make TB a thing of the past. Yeah, I would like to end my elocution over here. Thank you.
Thank you, Harini. So let us have Dhanyantra from PharmD first year now for the allocation. Do we have Dhanyantra from PharmD first year?
Dhanyata, it's Dhanyata from PharmD first year, Akanksha.
Okay, ma'am.
Wait a minute, I'll call her.
Okay, till that time, let's move on to our next participant. Tabassum from PharmD first year.
Dhanyata, can I?
Yeah, Dhanyata. Yeah, you can.
Thank you. I'm sorry for the delay. My computer just hanged.
Yeah, it's okay.
Yeah. So, good afternoon, one and all. My name is Dhanyata from PharmD first year. So, today I'm going to talk about the effectiveness of a vaccine in curing a disease. It's not just tuberculosis, but any kind of disease. So what exactly is the effectiveness of a vaccine? Vaccine effectiveness tells us how well a vaccine works under real world conditions once people outside the clinical trials receive the vaccine. Now we all study that vaccine helps in eradication of disease, elimination of a disease, control of mortality, mitigation of disease severity, prevention of infection, and so on. But let's just take a step back and refresh our memory. What exactly is a vaccine? A vaccine is a biological preparation that contains virus or bacteria that cause a disease that are injected into your body, only that these virus or bacteria are weakened enough so that they don't make you sick. But they help in the production of antibodies in your body that fight against the same virus or bacteria if you ever get infected with it in the future. So basically, a vaccine helps build up your immunity to a particular disease even before you get a chance to suffer with the disease. Now, vaccine effectiveness. Do you think a vaccine actually works? Do you think a vaccine is effective enough to cure a disease? Well, there's an obvious answer, yes. So, yeah, people everyone in the world is having hope on a vaccine, COVID vaccine, to get cured. But keeping this COVID aside, how does a vaccine, how is a vaccine effective? Like, different people have different immune systems, different people, they have different problems. So the effectiveness of a vaccine depends on many factors. Now, a few of them being the health of a person getting vaccinated. A person might be allergic to the components in the vaccine, or a person who is on immunosuppressant medications, the vaccine might not be effective enough. And then the mutation of a virus or a bacteria. Like, evolution is a process that takes place everywhere, all the time. So a vaccine that is effective
Vanitha,
right now.
you have 30 seconds for your elocution.
Yes, thank you. So a vaccine that is effective right now cannot be effective in the future. So keeping all that aside, is a vaccine effective? Yes or no? And the answer can be both. If you take a MMR vaccine, it is 97% effective against measles, 88% effective against mumps, and 97% effective against rubella. Now, if you take an yes for an answer that a vaccine is effective, the first ever human disease that was eradicated.
Citra, your time is over.
Yes, just 2 minutes. It'll be done. 2 minutes. In 1979, the smallpox vaccine, the smallpox was eradicated completely. So day by day, the ratio of decrease and yeah, so we are working for the production of vaccines every day, and we can do it. Thank you.
Thank you, Dhanvita. Let's have Sidra Tabassum from Family First Year.
Sidra Tabassum from Family First Year.
Do we have Sidra Tabassum? Okay, then let's move on to our next participant, Aisha Fatima from Family First Year.
Hello.
Yeah,
Am I
Aisha.
audible?
Yes, Aisha, you're audible.
Yeah. So good afternoon, everyone. My topic is Jan Andolan, eradicating tuberculosis by 2025. So as we all know, there is a global challenge to eradicate TB by 2030 to 2035 of 95% of tuberculosis should be end. But our Prime Minister Narendra Modi have take a challenge to eradicate TB in our country by 2025 itself. Among this growing COVID pandemic, we should not lose the sight of the goal to eradicate this TB by 2025. And all of us, everyone, private sector, public sector, politicians, administrators, everyone should be participating equally. Even we, even common people should be participating equally. So here are some of the suggestions that would help to eradicate tuberculosis by 2021. So first one is there should be a strong effort by politicians and administrators, etc. So that as the sir said at starting session, that during the elections they will be going to every door and door and ask for votes. Why not for this tuberculosis? Do they don't care for their for us, for society? They should have that role, and private sector, the government should recognize the role of private sector in eradicating tuberculosis, and ensure that all the tuberculosis cases are being notified to the government. And then the government should look after some special cases, like there is undernourishment, there is poverty and malnutrition, and like diabetes, HIV, etc. And that will have an adverse effect on tuberculosis, like it will take more time to get cured. So that one, and there should be a research and surveillance should be going on, research for and validation for new diagnostics, new drugs and vaccines for TB, and then surveillance.
Actually, you have 30 seconds. Yeah.
Okay. And surveillance for how much of them are drug resistant TB, and how many deaths are being caused each year, and these type of surveillance should be carried out, so we know at what status we are, and how far and what efforts should we do to overcome this. Thank you so much.
Okay. So let's go on to our next participant, Srijana from PharmD first year. Do we have Srijana?
Am I audible?
Yes, Srijana.
Yeah.
You can just turn on your video. Yeah. Thank
you. Good afternoon, one and all. I'm Srijana from PharmD first year. And my topic for allocation is effectiveness of the vaccine. Vaccines are the these are the vaccines induce the antibodies which fight against the disease. These the work of the vaccine is actually the vaccine this vaccine contains the antigens of a bacteria or a virus which is infectious, like which causes the infection to the others. Then these are injected to a person or a separate individual to so that it will have those antigens inside, so that person has the antigens to him, and he develops antibodies against the antigens which fight against this disease. So here in case of the reappearance of the diseases, these can be these antibodies fight with those disease which are infectious to us. So, and I say the vaccines are vaccines are the highly effective. They are very highly effective. There are and may not be in case of smallpox, as Danyata said. Smallpox, we have the vaccine effectiveness for the 80%, but it may reappear in case of some symptoms. So I conclude my allocation over here. that the vaccines are effective for some extent. Thank you.
Thank you, Srijana. So now I would like to call Kamila Afreem from B.Pharm second year.
Hello, am I audible?
Yes, Kamila. Yeah, you're audible.
Okay. Health is not valued till sickness comes. The greatest wealth is health. A very charming afternoon to everyone. Here's a hearty welcome, big and warm enough to encompass you all. Here today, I want to talk about on the topic Jan Andolan to eradicate TB by 2025. So I would like to ask, do you remember what was on 24th March? Yes, it is World TB Day. It is celebrated every year since 1982 as it is the 100th anniversary of Dr. Robert Koch who discovered TB bacillus. Why are we even celebrating it? To spread awareness about TB. Because first step towards change is awareness. Actually, sitting at home, most of us underestimate the potential of the bacteria Mycobacterium tuberculosis, which causes TB. Sitting in these four walls, we do not know what is happening around the world. But little do we know that TB kills about 1,400 individuals every single day. But this isn't the worst of it. What is even more worse is that in reality, we have to know that out of 5 individuals, 1 is a TB patient in the world is an Indian. Let me repeat this. 1 out of 5 individuals in the world is an Indian. Can you imagine that? Going back to the start, back to the roots, in understanding what actually TB is. TB is an infectious disease that attacks our lungs normally, but it can also spread to brain and spine. The symptoms of TB are chest pain, night sweats, fatigue, loss of appetite, and weight loss, obviously fever. Stressing on the little face, you never know what the future holds. So if you think positively, India can be a TB-free nation by 2025 or even before. Only way to achieve that is by Jan Andolan, People's Movement. This was stated by Dr. Harshvardhan, who said that at the time when COVID is taking prioritized attention, we must not lose our sight towards TB. Our Honorable Prime Minister also told that prevention of illness and promotion of wellness should be followed. And poor should also get effective treatment through Ayushman Yojana. Health infrastructure and healthcare professionals should increase in quality as well as quantity. Entire world's target is to eradicate TB by 2030, but India wants to do that within 2025. Isn't that great? Then only TB harega and desh jeetega. I want to say that we must all support this ambitious call to action by putting our best foot forward towards it. Because unitedly, if we do this, unity words also starts with the letter U. If it's not you, then who else can? As the saying goes, prevention is better than cure. I would like to highlight few points about prevention of TB. The general points being avoiding personal contact with the body
You have
fluids
30
of
minutes,
the TB patient.
Okay. After 30 seconds left.
Okay. As I want to conclude the speech, I would like to thank my teachers for giving this opportunity. I'm really very happy to get this privilege of being that agent to spread awareness about TB through speech. Lastly, I would say the right way to fight with the bacteria not captured by our sight is to do this prevention measures. This might not happen overnight, but someday, very soon, we will light up this darkened world. Thank you.
Thank you, Afreen.
Sorry, hello? Hello, Gauri? Am I audible?
Yes, ma'am.
This is Vidyalaya madam from SNV PMV. Could you please call to join Jahnavi B.Pharm 6th semester? She is unable to join due to power connection. Now she is online. Could you please join us?
Sure.
Thank you.
I would like to call Janavi from B.Pharm third year.
Good afternoon to everyone present over here. I am Janvi of 6th semester. I'll be telling about the End TB campaign. Tuberculosis kills 5,000 people every day. The social and economical impacts are devastating, including poverty, stigma, discrimination. While the world has committed to ending the TB epidemic in 2030, actions and investigation don't match the political issues. We need a dynamic socio-economical multi-sectoral approach. The two great opportunities to move forward are the first World Health Organization Global Ministerial Conference to end the TB in the general way, which is conducted in the Moscow in 2017, followed by the first UN General Assembly high-level meeting on TB in 2018. These are the two main sectors which build the momentum, get different sectors engaged, and accelerate our process of efforts to make the TB a history. On 26 September 2018, the United Nations held its first ever higher meeting on TB, elevating the discussion about the status of the TB epidemic and how to end it to the level of heads of the state and government. It followed the first global ministerial conference on TB hosted by the WHO and state and government. It followed the first global ministerial conference on the TB hosted by WHO and Russian government in November 2017. The outcome was a political declaration agreed by all the UN members in which existing commitments to the SDGs and the World Health Organization and TB strategy were reaffirmed and new ones were added. The SDG target 3.3 includes ending the TB epidemic by 2030. The End TB strategy defines the milestones into the process of the 2035 for the reductions in the TB cases and the deaths. The political declarations of the UN high-level meeting included the following things. Therefore, we can say that with apt measures and also the awareness among the people, we can inculcate a process of prevention and cure with the usage of social media and articles and use for the curation of the disease. Therefore, we can say that awareness is main important for the cure of the TB. Thank you.
Thank you, Janavi. Now, I would like to call Vaishnavi K from BPharm second year. Vaishnavi from BPharm second year.
Hello, can you hear me? Hello?
Yes, Vaishnavi, we can hear you.
Yeah, you're right.
Good afternoon, respected sirs and teachers. My topic is eradication of TB in India.
Vaishnavi, sorry to interrupt you. Can you switch on your video?
Ma'am, here there is network issue, ma'am. So my video is not on, ma'am.
Okay.
Sorry for that, ma'am.
It's okay, Vaishnavi.
This eradication of TB in India, it is by 2025. Actually, the WHO has decided that the eradication of TB by 2035. The Indian government has set the limit before 10 years. And in March 2017, the government of India has announced about the eradication of TB by 2025. And in India, we have the largest amount of TB cases. It is approximately 26 lakhs of 40,000. In 2019, according to the estimated rates, 9,500 of HIV patients are died to HIV positive patients are died due to the TB, and 4,36,000 HIV negative patients died because of TB, ma'am. And India is the second highest HIV associated TB cases. Drug resistant TB, actually in TB we have a drug resistant TB which is mostly effective, and it is almost 130,000 patients are suffering with this MDR or RR-TB, which is multi-drug resistant TB. In this TB, what will happen is that drugs which are used for TB will not affect on that person. The person is resistant to the TB drugs, and these TB factors are more in India than normal TB. We'll find more this kind of TB. And when we come to the sectors, actually in government sector, the TB treatment is free. But whereas due to the lack of proper knowledge and all this stuff, the people are more interested to the private sectors, as India is contained of both private and...
Sorry for disturbing. 30 seconds are left.
Okay, ma'am. So most of the people will go to the private sectors, by which the people will undergo more debts, ma'am, and they will also face with the problem with money. And Indian government has started a new plan like National Strategical Plan of 2025. By this, what they'll do is they'll go to the various organizations and various professions so that they can the other multinational companies can invest in this scheme so that they can help the people who are suffering from these problems and they can help them. And national government also started a nutritional support plan to TB patients, so which they can give some nutrition proteins, nutrition food to that patient. And this COVID also, the COVID has impacted more on the TB services as 2020 is gone under the lockdown. So many patients could not get their routine health checkups. By this, the cases has been increased rapidly. And as from mid-February, it has been somewhat okay. But again,
Vaishnavi, your time is done.
Okay, thank you, ma'am.
Okay. So with this, we end our elocution session. And now we are going to have a lunch break till 2 o'clock. So I request all the attendees to come back and join us by 2 o'clock. And there are many questions about the e-poster presentation about the timings. So they are going to be 3 minutes, 15 seconds given for the presentation, and 30 seconds will be allotted for the QA session. So I request all the participants who are participating in e-poster to be ready by 2 o'clock. So yeah, thank you.
Shall we end the session?
Hello.
Sir, shall we end the session, sir, now?
Yeah, we can end and start at 1:55 and we'll wind up fast.
Okay, sir. Okay.
Okay, bye. Thank you.
Okay, sir. Thank you.
Can you start speaking?
साइड में रख लो।
ప్లైవుడ్ తోటే చేసి
Good afternoon, sir. So should I start?
Yeah, madam, you can start.
Okay, sir. Good afternoon, everyone. Welcome back, everyone. So now we are going to have e-poster presentation with topic e-poster presentation on infectious diseases. I request all the participants to turn on their videos while presenting the e-poster. So I would like to call Rushda Ahmed from Family 5th year.
Good morning. Hello. Am I audible?
Yes. Yeah. Yes.
Excuse me, Richa.
Yes, ma'am.
Richa, can you ask that I could not able to share my screen?
Yeah, Bhargavi, you can share now. Okay, you can share. You are co-host.
Yeah, okay, thank you, ma'am.
Can I start?
Yes, you can start.
Okay, so my name is Rushda Ahmed. I'm from Family 5th year, and I'm going to present a case on meningitis. So initially, what is meningitis? Meningitis is the inflammation of the membrane that covers the brain and the spinal cord. Okay, and meningitis could be because of many causative organisms like bacteria, fungi, virus. So let's come to the case study. So here, this pretty lady, she's a 57-year-old, and she came to the hospital with the reasons of severe headache, altered consciousness, hallucination, high fever, nausea, and vomiting. So she had these symptoms for 2 weeks. So she came to the hospital and she got admitted. After admission, a physical examination was done, and it was seen that there was a third cranial nerve palsy. That is yes, so there was a third cranial nerve palsy, which causes your eyes to squint. So squint is like when you're looking, it seems like you're looking, both the eye look in a different direction. So that is one of the main symptom in a meningitis case. And there's neck stiffness. Neck stiffness is also one of the main physical symptoms seen in meningitis, and positive Kerning and Brudzinski signs. So this is the main sign in meningitis, which curdlings is when there's a severe pain in your thigh when you try to extend your leg. So that is one main physical symptom which is seen in a meningitis case. So here we know that the patient has a meningitis. And the next thing we have to do is identify what are the positive organisms that cause meningitis. So a lumbar puncture test was done for the CSF. So if you notice that the lymphocytes are high in count and the glucose is less. So this is a main feature of bacterial meningitis. So now we know that the patient has meningitis and it is a bacterial meningitis. So agglutination test was done for Brucellus, that is a gram-negative bacteria. So a Rose Bengal test. Rose Bengal test is where you take the sample and you compare it with the standard sample for the presence of the bacteria. So the presence of Brucellus was confirmed. So after confirmation, antibiotic therapy was immediately started. That is doxycycline and ceftriaxone was started. And along with that, demethasone was given because she had a third cranial nerve palsy was seen. So after 2-3 days, her condition was checked and there were no signs of recovery. So then another test was done where the CSF was checked for presence of Mycobacterium tuberculosis, and Mycobacterium tuberculosis was seen positive in CSF and urine. So the treatment for tuberculosis also initiated simultaneously. So here the patient had dual cause of meningitis. One is because of tuberculosis and other is for Brucellus bacteria. And after a week of anti-tuberculosis therapy, here you can see that rifampicin, isoniazid, pyrazinamide, and ethambutol was given as tuberculosis therapy along with the Brucellus therapy. So after a week, her CSF was again checked, and there were symptoms. Okay. So her symptoms were subsiding. Another, if you see that third cranial nerve palsy was also seen. So ophthalmic examination was done and was seen that she had choroidal metastatic foci. It is also seen in tuberculosis. So this is an example of extrapulmonary tuberculosis. So it infected her eyes also. So after 30 days of the therapy, she was discharged with anti-tuberculosis therapy for 12 months. And after the diagnosis, after the discharge, first and third months were checked for her. All the clinical reports were checked and all the laboratory tests was done, and they were seeing some improvement in her.
So your time is done.
Okay.
Now there's a question and answer.
I just like to conclude that this case is first initially when you see it is a system, you feel that it is a systemic bacterial infection, but after test all done, it is seen that there is co-infection of meningitis. Thank you.
Yeah, Rashida, one small advice.
Yes, sir.
Actually, you have to keep the titles on the top of your poster with the title followed by your name, your department, and name of the institute. So it should not keep in the last. You know, your name and your department has kept in the last. There is no institute name. In poster presentation, I think this needs to be improved. And you have concluded orally, but conclusion also should be there, and the references also. At least there should be reference, because the reference is not there. How can we believe that whether it is a real case study or it may be designed by you?
Yes, sir. Yes, sir. Okay.
Okay. So next time when you are presenting, please correct these things.
Yes, sir. Yes, sir. Thank you, sir.
Any questions?
Rashida,
Yes, ma'am. Yes, ma'am.
is there any combination of antibiotic drug?
Yes, ma'am. Doxycycline and ceftriaxone was given for the treatment of Brucellus. That is a bacterial infection. So initially this drug was given, and along with this, anti-tuberculosis therapy was also initiated.
Why dexamethasone is given?
Dexamethasone is given because there was a third cranial nerve palsy.
Okay. And what is these laboratory findings? You mentioned 63 polymorphonuclear leukocyte cells. PML.
Yes,
What
that
is 63?
So 63, that is the cell count that was seen in the CSF.
And the same number of 63 lymphocytes.
Lymphocytes was also seen in the CSF, sir. So the range is between 0 to 5, but 63 cells were seen.
Okay. So why glucose levels were decreased?
Glucose levels are usually decreased in the bacterial meningitis, sir. So glucose levels are decreased and lymphocyte cells are increased. So that is the main clinical feature, laboratory feature which is seen in bacterial meningitis.
Okay. So what do you think? These patient also have meningeal infection? Meningeal tuberculosis.
Yes, so meningeal tuberculosis along with bacterial tuberculosis also seen, sir. So this patient is from Turkey. So this Turkey has a epidemic for tuberculosis and brucellosis.
Will these anti-tubercular drugs cross meningitis, blood-brain barrier?
Yes, sir. Yes, sir. For meningitis, tuberculosis also anti-tubercular therapy is given. But if in chronic cases, if the patient does not get stable, intrathecal therapy is also given for anti-tuberculosis drug.
Okay.
Any questions from judges side?
We can move to next presentation, I think.
Yes, I have a question, Rashida.
Yes, ma'am.
Can you name the vaccine primarily used against TB?
Sorry, ma'am?
Vaccine primarily used against TB, tuberculosis.
Vaccine?
Any vaccine?
I think you might have undergone.
Yeah, everyone.
Childhood.
Very simple question, Rashida. Don't think in that way. It's very simplest question.
When you are young baby, you are
Okay,
given
I'll
a
tell you
vaccine.
what you just elaborated. BCG vaccine. What is BCG?
BCG vaccine. BCG is
Yeah, Form D 5th year means you have to tell.
Full form of BCG.
Bacillus carmatic guarin. Okay, madam, I think we can move to next presentation.
Yes, sir. Yes, sir. Sir, instead of judges, you are asking more questions, sir. You want to add it in panel, sir, then?
No problem. Anyone can ask.
Only you can ask, madam. Actually, as a pharmacologist, that is coming out from my. I'm unable to control. I can.
Sir, but see that time should not extend up maximum 5 minutes, sir. 1 minute extra.
No, I won't ask questions, madam. Next.
You ask, but simple. Simple manner so that it will not take more time.
Fine.
Okay, sir. Thank you.
Okay, now I would like to call Viharika from family 5th year.
Am I audible?
Yes, Viharika. Yeah.
Harika, please go ahead.
Ma'am, can I use my phone?
Bhargavi, screen is not shared. File you have to open.
I have shared it.
No, ma'am, screen isn't shared.
Bhargavi? Yes, ma'am.
It's okay now.
Okay, ma'am.
Viharika, you can start now. And the time limit is 3.5 minutes only for explanation, followed by remaining time for discussions. Okay?
Okay, ma'am. Thank you. Good afternoon, everyone. I'm Viharika, family 50, and today I'm here to give an e-poster presentation, hepatitis B virus. Hepatitis means it is an inflammation of the liver. When the liver is inflamed or damaged, its functions can be altered. So due to heavy alcohol use, toxins, or some medication side effects and certain medical conditions, it can cause hepatitis. So hepatitis is a vaccine preventable liver infection caused by hepatitis B virus. And some people with hepatitis B virus become sick for a few days. That is acute infection, chronic conditions. The disease progresses to serious lifelong illness. And the transmission, it is the body of someone who is not infected, and it is also spread through blood from mother to child by sharing needles, surgical instruments, by having sex with the infected partner. And hepatitis B is not spread through food or water or through coughing or sneezing. And coming to the pathogenesis of hepatitis B virus, hepatitis
Viharika, there's a disturbance in the sound.
in order to enter the hospital. Is it okay now?
Yeah, continue.
Coming to the pathogenesis of hepatitis B virus, hepatitis B virus, in order to enter the host cell, it should have two surface antigens, that is PS1 and PS2. After entering into the host cell, the virus uses the host enzymes in order to replicate, and then hepatocytes, when the hepatocytes gets damaged, the CD8 plus 4 the CD8 plus 4 recognizes that there's some damage through the MHC class 1 receptors. And now in order for the cytotoxic cell to eliminate the virus, the hepatocyte the damages, in order to cytotoxic cell to damage the virus, it has the hepatocytes as when the enzymes such as ALT and AST are released. Now the immune system recognizes that there is some damage in the hepatocytes, and then it reaches the CD4 plus cells, the regulatory one. Then this suppresses the cytotoxic C cell in order to preserve the hepatocytes. This shows that the person is infected with the chronic infection. And coming to the risk and statistics, currently there are 300 million people who are affected with chronic infection, who are affected with the chronic hepatitis infection, and each year 30
Viharika,
million.
your time is done.
Hello, Viharika. Viharika,
Ma'am,
is there any difference between hepatitis B and tuberculosis? They are the same or they are any difference?
ma'am, they are different, ma'am. Hepatitis affects the liver, ma'am, and tuberculosis affects the lungs, ma'am.
Okay. So, which is the best medication for hepatitis B virus?
Ma'am, generally tenofovir is given, ma'am, for hepatitis B virus, ma'am, and entecavir also given for as the first line drugs for the treatment of hepatitis B.
Okay.
And for the prevention, vaccine is given, ma'am.
Okay. So, references you should keep little 3 or more. References, I think you have to keep 1 or 2 references.
2 references, ma'am.
Journals you should quote it first.
Viharika, as there was some internet problem, you can continue for 20 seconds.
Important points you discussed, Viharika.
Yes, ma'am. Thank you, ma'am. Coming to the symptoms, following are the symptoms of a hepatitis B acute infection. When a person is infected, they start showing symptoms after 90 days, and some people feel sick for several weeks to almost 6 months. And coming to the chronic infection, they doesn't show any symptoms. If they show any symptoms that are similar to the acute infection. Coming to the serological markers, hepatitis B surface antigen is generally done. If the result shows positive or reactive, it shows that the person is infected hepatitis B virus, and the result is positive or reactive, it shows that the person is protected against hepatitis B virus. And coming to the prevention, the best way is to prevent by getting vaccinated with hepatitis B vaccine. And Engerine is a vaccination, that is a recombinant HB vaccine. containing HBs AG is generally given for hepatitis B virus. And coming to if you're infected with hepatitis B virus, injection, that is injection of immunoglobulin, is given within 12 hours of exposure. And medications such as entecavir, tenofovir are generally given, and influenza injections are given if liver damages, then liver transplant. Ma'am,
Yeah, we can continue with the Q&A session.
Niharika,
yes, ma'am.
who are at more risk of getting hepatitis B?
Ma'am, if someone who is in contact with hepatitis B virus, or diabetic patients, ma'am, are risk of getting hepatitis B virus, and unknowingly the blood transfusion. Adolescents, children who are less than 19 years of age should get vaccinated, ma'am, against hepatitis B.
Sir, Venu sir, you can ask questions, sir.
Viharika, information is very good, but too much of information is dumped in your e-poster presentation. When you are going to present a e-poster, just you have to brief the information. You have to explain in each and everything. The statistics are very good. Yeah, this is my suggestion.
Yes, ma'am, sure.
Next participant.
Now I would like to call C.H. Travali from Family 4th year. Shravali, you're on mute.
Good afternoon, everyone.
Good afternoon, Shravali. I'm sorry to interrupt, ma'am. I would just like to read one comment that Dr. Karthik Rakam sir has put in the chat box regarding previous Viharika's presentation. Sir has said, please read about Entecavir, a drug that is used in HBV and interaction with food. I made a couple of interventions regarding that. Sir has written this, so to the concerned poster presentation participant and everybody.
Sure, sir. Thank you, sir. I'll go through it.
Shall I continue?
Yeah,
sure.
Good afternoon, everyone. Myself Shravali Chilikamari from Family 4th year. The topic I have selected for my poster presentation is COVID-19 and the need for action on mental health. As everyone knows and everyone is aware that COVID-19 corona is becoming a global pandemic condition. This corona not only has an effect on our physical health condition, it directly or indirectly shows an effect also on our mental health condition. Like many questions will be running in your mind, like what if I catch corona? What if my family members? What if our dear ones catch corona? And how long does it takes time to lead a very normal life without mask, without sanitizer, and without any social distancing? Like everyone is happy if we can go outside very freely without any restrictions. Because of all these questions running in our mind, without our conscious, directly or indirectly, COVID has an effect, also an impact on our mental health condition. And even research has also shown that COVID has effect on our mental health condition and also on our brain health condition. It has shown that National Service in 2020 has shown that 35% population in China and 60% population in Iran, 45% population in USA were distressed because of this corona state condition. It also affects our physical health condition, but also has an effect on our mental health condition. So like if we catch corona, we'll be having a different kind of symptoms. The symptoms also include neurological manifestations like headache, impaired sense of taste and smell, agitation. All this may, if we have fear of what happens if I'm not cured, all these questions running in our mind will directly or indirectly has an effect on our immune system, because this our health condition may be become severe. Because of the severity in health conditions, we may be there may be a chance for the risk, or there may be a risk for hospitalization conditions and stress, social isolation and violence. This also affects our brain health. And a study has proven that a middle-aged group like adults are middle-aged group, that is adults, are directly having effect on our mental health. Like we adults don't want to be home lockdown by 24/7. Because of home lockdown by 24/7, we'll be feeling of loneliness, irritation, we'll be not having interest in doing any work, difficulty in concentrating. All this have shown effect on middle-aged group, that is adults. And the mental health of healthcare workers, they are not having another option. Like if we don't go and if we don't work outside, no, apart from physical and mental health, financial status will also be disturbed, so everyone will be working outside. So workers are also having effect because of this corona. Like in China, that is 50% of the population, that is 50% of the workers were in need of psychological support, and also highly depressed, and 45% people were
Shravali, your time is done.
Okay, I'll be
Conclude, Shravali.
I'll be giving conclusion. So there are really minimizing consequences. How can we be free from our mental health? Like we need to government and people must come together. We must be providing support and support recovery from COVID by building mental health services. We should also follow healthy diet and healthy routine. Wake up early in the morning, have some physical activity, go on with our daily routine activities without being disturbed mentally, without having any thoughts in our mind. And steps must also be taken to address stigma of discrimination at all phases of COVID-19 emergency response. Ensure widespread availability of emergency mental health and psychological support. Thank you.
Shravali?
Yes, ma'am.
Your presentation is good, but the name you have written right side of the poster. Okay?
Yes, ma'am. Yes, ma'am.
On the top and your college name, everything. Your presentation is good.
Okay,
you have explained about the mental health conditions also. You tell me coronavirus enveloped with either with RNA or with the DNA. Either it's a single stranded or double stranded. No, simply I am asking.
Double stranded, ma'am.
Not double stranded, it is a single stranded. And the next one, is it remdesivir is injection is useful to treat the corona patient?
Yes, ma'am.
Yes,
have you referred any journals for this information?
Yes, ma'am, I have referred an article, and few articles I have referred and given. I have put all the information in a single poster, ma'am.
How many death cases are occur in India?
Ma'am, daily we are able to find 1 lakh corona cases are being registered, ma'am. Daily 1 lakh, 2 lakhs. It's increasing day by day.
Okay. Okay, nice presentation.
It is
Shravali?
Yes, ma'am.
Yeah, what are the other drugs which are under clinical trial for corona COVID treatment? Do you know any clinical trials related to COVID-19? And what about our mental health and healthcare and Canada? And you have mentioned China. What about India?
Yes, ma'am. I didn't give information about India.
So what are the other drugs also you have to check in clinical trial government.in. So 6 or 7 clinical trials are there. So some are intravenous, and which route is better for COVID-19 treatment? Either intravenous or inhalation route?
Inhalation route, I think, ma'am.
in inhalation route. So what are the drugs under clinical trial? You just check once.
Okay, ma'am.
Next poster, Amma.
We'll move on with the session. I would like to call Tirtha from family 4th year.
Yes, ma'am. Good afternoon, everyone. Ma'am.
See, before starting, think about time also, Tirtha. You all of you can able to complete within 3.5 minutes.
Okay, ma'am. Okay, ma'am.
And my request to judges, once the time is done, let the student complete the conclusion. Ask them to conclude.
Better.
If they cross the time, because don't stop there itself. Just ask them to conclude.
And the judges can make a note of the time extended. Either it's half minute or 1 minute, if possible. Leave it for seconds.
Yes,
if
ma'am.
it crosses in minutes. Okay.
Okay, ma'am.
Okay. Thank you.
Ma'am, can I start, ma'am?
Yes.
Okay, good afternoon, everyone. Myself, Nampali Tirtha from PharmD 4th year. Today, I am here to present a poster on a case, a COVID patient presenting with pneumothorax. I have chosen this topic because many of the cases have seen that it is showing that negative in PCR test and also in rapid test, but it is showing a mild infection in the CT scan. So, coming to introduction, coronavirus has corona disease 2019 was officially declared as a pandemic on March 11, 2020. The symptoms of this disease is fever, dyspnea, and cough. And in severe cases, it may cause acute respiratory distress syndrome. It can be seen in chest imaging, and it can also diagnose with RT-PCR and also rapid test. Here is the case of a 15 years old boy, not known to have any chronic medical condition, was brought to the emergency department of Namzi Hospital. His chief complaints were shortness of breath, neck pain, chest pain on the last day before admission. No history of cough, and he was no contact to infected patients. His height was 160 centimeters and weight was 64 kgs. When coming to vitals, his oxygen saturation level was 87% and heart rate was 120 beats per minute. Temperature is 37 degrees Celsius and respiratory rate was 40 per minute. So when coming to laboratory examination of arterial blood gases, pH was normal and partial oxygen was very less. As he was suffering from COVID, we can diagnose chest X-ray findings. In chest X-ray findings, it was found that he has a double diaphragmatic sign, air around the left border of the heart, and subcutaneous emphysema in the neck associated with pseudo pneumomediastinum. You can observe in the figure 1 and figure 2. Ma'am, can you? In CT scan, it was revealed that he has a significant emphysis matters. We can observe in the figure 2 that he has a pneumothorax and pneumomediastinum and subcutaneous emphysema. So when coming to paraclinical findings of the patient, he has everything was normal, but WBC and neutrophils were very high, and lymphocyte are low. WBC and neutrophil are high because of the underlying infection of the patient. So when coming to the discussion, as we know, the patient was diagnosed with even the COVID test of the patient was positive. Ma'am, can you please don't slide? Yeah, pneumothorax is the accumulation of extrapulmonary air within the chest, and pneumothorax is finally diagnosed as the pneumothorax is mainly caused due to long-term mechanical ventilation or ARDS and underlying pathology of emphysema. In this case, the pneumothorax is caused due to the patient is having the corona disease that has led to ARDS. So here no markings in the chest CT scan and X-ray of COVID positive, but RT-PCR and nasopharyngeal test has led to positive of COVID-19. Here, when coming to the pathophysiology of corona, due to the corona, cytokine storm mass very high, that leads to the ARDS, that leads to pneumothorax. First primary spontaneous pneumothorax was occurred, and then later
Teresa, your
secondary
time is up.
spontaneous pneumothorax. Ma'am, I finally conclude the case, ma'am. So this patient, whenever only the PCR test, if there any symptom of COVID-19, whether fever or shortness of breath, anything, go for the PCR and rapid test. But if the test is negative, still the patient is having any symptoms, they have to go for the further diagnosis like CT scan and chest X-ray. That's it, ma'am. Thank you, ma'am.
Any questions?
Hello.
Well, ma'am.
So for pneumonia, you have explained about the pneumonia, no? Isn't it?
Pneumothorax, yes, ma'am.
So this nowadays doctors are saying that the steaming is better for curing.
Ma'am?
Steam inhalation is better for curing.
Yes, ma'am.
Statement is correct. How we will prove that?
Yes, ma'am. It is correct only because whenever the person is under steaming, the blockade in the nose or blockade in the lungs may reveal during the steaming, ma'am. So that the patient can reveal from shortness of breath, he can take the oxygen correctly. He or she can increase the oxygen levels.
Okay. Is there any drugs, antibiotics for the treatment of this?
No, ma'am. Mainly, as this is a viral infection, we cannot prescribe antibiotics for this case, ma'am.
Okay.
Yeah, Tirtha, well done presentation. So one synthetic polypeptide is there. Do you know that for the treatment of COVID-19, just not treatment, it is under clinical trial. So, but it is previously known as a vasoactive intestinal polypeptide, that is known as VIP.
No, ma'am. No idea, ma'am. Sorry, ma'am.
No idea, ma'am. Okay, sir. So this is also known as today in nowadays aviptadil. Aviptadil is a drug which is also used in the trial as the inhalation route and as the intravenous route. Okay.
Okay, ma'am.
Yeah. So which route is better? Just I am asking. Inhalation or intravenous? Why?
Ma'am, according to the situation of the patient, we'll go either inhalation or intravenous, ma'am.
Okay.
For what condition you are asking, ma'am?
For this pneumonia and COVID-19 treatment, for this condition only.
Ma'am, if the patient has vitals, if the patient of oxygen saturation is very low, it is better to go with the inhalation first, ma'am. Then we can then we can give a IV form.
I request the participants to mute.
Okay. Okay. So please go under clinical trial studies for the confirmation. Okay. Done.
Okay, ma'am.
I request all the participants to mute themselves. Thank you. I would like to call about Revati from family 4th year.
Good afternoon, everyone. Myself, Revati from family 4th year. Today, I'm here to explain about the poster presentation on overview on the multiple drug resistant tuberculosis. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis. Today, TB is the most common cause of death from infectious disease. The term multiple drug resistant tuberculosis implies to the resistance for the drugs like rifampicin and isoniazid. If the patient infected with a Mycobacterium species which is resistant to rifampicin and isoniazid, then the person is said to be resistant to the patient is said to be affected with MDR tuberculosis. The types of drug resistance. There are two main types of drug resistance. There are primary drug resistance and acquired drug resistance. In the primary drug resistance, the patient is infected with the mycobacterium species, which is already resistant. That means he has infected with the disease from the other person who is resistant to rifampicin and isoniazid. Whereas in case of acquired drug resistant tuberculosis, the patient is initially not resistant to any drugs, but during the course of treatment, the person may develop resistance to the rifampicin and isoniazid. Risk factors for development of drug resistance. The risk factors may include patient non-adherence, administration of single drug therapy, administration of inappropriate regimen, large bacillary burden. Coming to mechanism of drug resistance in acquired drug resistance. Generally, when a person is taking rifampicin and isoniazid or any other anti-tubercular drugs, when the genetic mutations in the organisms leads to drug resistance. These genetic mutations may occur due to any spontaneous reactions. When the genetic mutations occurs in the organisms, and these genetic mutations leads to drug resistance. But for an organism to completely resist the drug which is given to him, there must be a suitable conditions for the organisms to grow in the resistant domain. The selective pressures that favors the growth of resistant microorganisms are the risk factors which I mentioned in the below session. Those are patient non-adherence, administration of single drug therapy, administration of inappropriate regimen, large bacillary burden. When these risk factors along with the genetic mutations combine together, it leads to the resistance of the drug. When the resistance and these risk factors combined, and when the host defense mechanism is not appropriate in eradicating the microbacterium, then the resistant species will grow in a large amount, and this lead to the growth of microorganisms in an amount that is much more greater than the normal susceptible species. The diagnosis of the multiple drug resistant TB can be done through two ways. First one is proportion method, and second one is backtech method. In the proportion method, the microorganism, the blood specimen of the individual is collected, and the blood specimen is inoculated in a culture media which is having minimum inhibitory concentration of rifampicin and isoniazid. If the microorganism grows, and there will be a test solution and reference solution. The ratio between the test and reference, if it exceeds from 1:100, then the person is said to be affected with MDR tuberculosis. In the backtech method, it is a
The time is up. Revati.
Okay. And the drugs that are used for treatment of MDR TB are group A drugs. Those are levofloxacin, bendaquilin, linezolid, and group B drugs. If the person is not curing with group A, then we will go and adding to the group B drugs. They include clofazacin, cyclosporin. Group C drugs. If the person is not treated with the group A and group B, then after considering the risk to benefit ratios, we may add group C drugs. This may include ethambutol, delaminide, pyrazinamide, etc. Thank you.
Questions, please.
Hello.
Yes, ma'am.
Revati,
Yes, ma'am.
what are the second line drugs?
Madam, group B drugs are considered to be second line, ma'am. Generally, we will go for the group A drugs initially. If the patient is not treated with the group A, then we'll go for the group B. And if the patient symptoms are not curing with group B, then we'll go for group C, ma'am. These are the lines of therapy.
What is the duration of MDR TB treatment? How long it is required?
As that of normal TB, it may require up to 8 months, ma'am, based on the condition.
Okay.
Any more questions, ma'am? Okay, we'll go with the next one. I would like to call Richa from family 4th year.
Good morning, ma'am. Am I audible?
Yes, yes.
Yes, ma'am. Good afternoon, everybody. This is Richa Regekar from Family 4th Year, and I'm here to present my poster presentation on Cabenuva, the newest approved drug for human immunodeficiency virus, HIV-1 infection. Now, just a little background, HIV infection destroys cells that help our body in fighting infections, rendering it more susceptible to pathogens and more diseases. It spreads through casual intercourse, body fluids, or injection sharing. Now, this was about HIV. Now, coming down to the treatment, earlier, the usual antiretroviral regimen for HIV was taking one pill every single day. But in February 2020, FDA approved this injection, intramuscular injection, Cabenuva, which is supposed to be taken once per month, just once per month. So coming down to the mechanism of action, now this Cabenuva, it consists of two drugs, that is Vocabria and Edurant. Vocabria or captogravid and Riplivirin. Now this captogravid, it acts as an integrase stand transfer inhibitor. And rivilpirin, it acts as a diaryl pyrimidine non-nucleoside reverse transcriptase inhibitor. So what it does is, this Cabenuva attaches to the active integrase site and blocks HIV integrase. Then it inhibits the retroviral DNA integration stage. This stage is most necessary for HIV replication stage. If this stage is blocked, HIV doesn't replicate and hence it doesn't grow further. So this is what Cabenuva does. Now, coming down to how this Cabenuva is given. This Cabenuva is an injection, like we all know. It is given extramuscularly. It is an extend-release injectable suspension whose complete dose is administered with 2 gluteal intramuscular injections. It is given on the buttocks. But now, before Cabenuva is taken, the first dose of Cabenuva is taken, 2 drugs are given orally, which are Vocabria and Edurant. These 2 drugs have to be taken for 1 month before you take Cabenuva, because to see how your body reacts towards that dose. So these 2 drugs are given first. Next, coming down to the ADRs. There are not many ADRs to Cabenuva. There are just simple, such as fever or fatigue, blisters, stomach cramps, or joint pain, swelling of your mouth, face. This happens in extreme cases. Or sometimes there can be allergy or hypersensitivity reactions. Also, a few post-injection reactions, small reactions such as dysapnea or abdominal cramps or changes in blood pressure can be seen. But with patients with liver disorder, it can be a little dangerous. Their transaminase levels can increase. Now, these were the areas of Cabenuva. And clinical trials, there were 2 clinical trials that were conducted by 2 pharmaceutical giants, which are Viv Healthcare and Pfizer Shionogi. Viv Healthcare, which was a joint venture between GlaxoSmithKline and Pfizer. These 2 pharmaceutical industries together developed Cabenuva. Now, they conducted clinical trials along with FDA. Now, in trial 1, patients who were never treated for the infection before received an approved therapy for 20 weeks. And in trial 2, patients who were successfully previously treated for the infection were given Cabenuva. And this is how the efficacy of Cabenuva was seen. And it was seen that Cabenuva is efficacious. It has good efficacy to treat HIV-1 infection. That's it. Thank you very much, ma'am.
Richa, is it available in India?
No, ma'am, not yet. It was just approved last year. So it's still, I think Pfizer will be, I think one of our Reddy Laboratory, etc. They're trying to combine with Pfizer to get it, but not yet, ma'am.
So what is the cost of this drug averagely?
Cost, I don't know, ma'am.
Okay.
Approximately $3,000, ma'am.
Yeah, they have mentioned approximately $3,000. It's
Yes,
a very
ma'am.
costly drug.
Yes, ma'am, extremely costly, ma'am.
For monthly treatment, I think so.
Yeah, ma'am, it is costly, ma'am, but it has a few less side effects as compared, and it is easy to take, ma'am. The adherence is less, so.
Okay.
Yes, ma'am.
Hello, Richard.
Yes, ma'am.
You given the presentation very fast. It's a good.
Oh,
I
sorry,
also
ma'am.
only 3 minutes 30 seconds. No, I'm not.
Ma'am, I was told that 3.5 minutes only you have to talk, ma'am, so I spoke fast, ma'am.
That time we finished. So only my one question is, how long does it take for HIV symptoms to appear?
Ma'am, your voice is breaking, ma'am. Could you please repeat?
How long does it take for HIV symptoms to appear?
How long does it take for HIV symptoms to appear? Usually, I'm not sure, ma'am, but usually 2 or 3 months. But in some patients, symptoms also don't appear, ma'am, for HIV.
Okay, thank you.
Yes, ma'am. Thank you, ma'am.
Can you say, Richa?
Yes, ma'am.
Can you say heart therapy for HIV? Like, what does it contain? How many drugs it contains? HIV.
Ma'am, what therapy for HIV, ma'am?
Heart, HAART.
HAART, heart therapy, ma'am. Oh, I don't know, ma'am. Heart therapy, I don't know, ma'am.
Okay, it is highly active antiretroviral therapy.
Okay.
Okay.
Oh, heart therapy. Oh, okay. I don't know. Okay, ma'am.
Okay, the next one I would like to call Sushma from Family 4th year.
Am I audible?
Yes, Sushma.
So good afternoon, everyone. Today, my name is Pushpa Samboti from Family 4th year. Today, I'm going to present a poster on something which is spreading faster than COVID-19 itself. Do you know what it is? Forwarded messages on COVID-19. So let's get some facts checked about these forwarded messages by our beloved WhatsApp scientists. The first message is like, sniff some camphor to increase your oxygen level. Actually, camphor is a natural block reliever for your stuffed nose. It cannot increase your oxygen levels. If your oxygen levels are decreased, it only means that your fluid is getting filled inside your lungs. So your camphor can't do anything about that. Eat garlic every day to get rid of corona. Garlic and all healthy foods are known to improve your immune function when you are healthy. But you may not get COVID, but you can be a carrier for COVID itself. The third one is the stupidest thing that I have heard. Menstruating women can get vaccinated. Seriously, this is a matter of logic than a matter of fact, because do you think people, the scientists from clinical trials are going to exclude women who are menstruating and they are going to conduct their trials as it is? Fourth one is check your lungs and oxygen levels. This is also a stupid video. It says that from point A to point B, you have to hold your breath. You have to breathe in and breathe out. Please don't do it if you get it. You are not a balloon to get inflated and then hold it and then actually remove it. WHO already told that you cannot diagnose COVID at home. The fifth one is vaccines are dangerous. You can also get reinfected even if you take a vaccine, and they cause serious side effects. Yeah, there are chances that you can be reinfected even if you take a vaccine, but no vaccine is 100% safe. Taking a vaccine is a sense of security that you're providing for your body. There are many minor side effects like redness and rashes, but they can be excluded because the benefit is greater than the risk itself. This is one of my favorite WhatsApp messages. See, when everyone gets vaccinated, no one will get COVID-19, so that I can escape vaccination when everyone around you is immune. Listen to me. Herd immunity can protect you from a disease. It is true. But remember that people who are vaccinated can also be carriers for COVID-19. One of your co-worker may be vaccinated and can be a carrier. If he sneezes on your face, what will you do? Go to your corner and cry, because COVID is going to play IPL with you now. So the last forwarded message is, now you can register for vaccination on WhatsApp itself. Just see the website name, iamafool.com. Please click those links only if you are feeling free to get fooled by scammers. Now that we are finished with our WhatsApp scientists, let's go to the advantages of vaccination. Vaccine protects you against severe illness. And even if you're reinfected, you can experience only milder symptoms and reduced hospitalization period. By vaccinating yourself, you can protect yourself and your community. If everyone gets vaccinated, eventually we can be mask-free. Things you should be afraid of while vaccinating. You should be afraid of fake messages. of not getting vaccinated. Please don't be afraid of safety and side effects of the vaccination. If you don't know the website, I have mentioned it here. Please register here for your vaccination. So these are my references: WHO direct website and also from the WhatsApp forwarded messages. The reason why I like to conclude my poster with the reason why I took this topic, because every day in news I'm seeing that people are dying every day, not because of COVID, but the fear of getting COVID. After getting COVID, they are very afraid of the disease. They are feeling like they are going to die, and WhatsApp messages are playing a prominent role in it. So it's our duty as a pharmacist to educate ourselves and our community on this. Thank you.
It's a very nice idea of doing this, Sushma. Really, it is nice.
Thank you, ma'am.
Yeah, your poster presentation is
really good. I have a question. Can you name the approved vaccines for COVID in India?
Covaxin and Covishield, ma'am.
Approved vaccines. Okay, which one is good?
Both of them are effective, ma'am, but here they are discussing like Covishield and good. Covaxin is not good because it is giving fewer side effects and all. I also saw our seniors, juniors to spreading these forwarded messages in the status saying that don't get vaccinated when you're on your period. I thought it is better to tell about it.
Shushma, hello. Can you hear me?
Yes, ma'am.
Can you name one severe side effect being shown by Covishield?
Serious side
Rare, it is rare, but severe side effect which is being shown by Covishield.
I'm not aware of it, but I'll make a note of it.
Right. It's blood clots.
Okay, thank you.
Okay, great.
Okay, I have a doubt, Sushma. Humans are infected, but why not animals? They also breathe. They may also be infected, no?
Yes, ma'am, they may also be infected, but I don't know the exact reason, ma'am. I'm sorry.
Even I also don't know. Anyone please can share?
I think we are not testing on animals if they are COVID affected with COVID or not.
So I always have a doubt on this. So humans are being infected, but not animals.
Animals also affected, ma'am. Actually, you can see some news items like few animals in zoo and all got infected, but not to the extent that we are. But they are also infected.
Okay.
Like in fact, like it came from. There are theories. It came from bats and it came from other some non-veg market in China. The origins.
Yeah.
Yeah, like what Srividya madam has said, we have not tried it on animals. We have not checked with animals, even our pets also.
Yes, ma'am.
We are still dealing with human itself. Maybe in a year or two, we'll go back to animals
But
also.
death is not seen in animals, no, ma'am.
Maybe the severity may be less. We don't know, but we have not checked on them.
Yeah,
Because
yeah.
pet animals will be the first to come across.
No, it's not only animals, but even children also. The symptoms are not so severe.
Yeah,
and
yeah.
they are getting recovered very quickly after drug treatment, and they are acting like a carriers. So same is the case with most of the animals. Even if we do this corona test to the pet animals in the homes where the patients are there, I think we might get positive.
Okay. Okay.
Okay, we'll go with the next one. I would like to call Vaishnavi from Family 4th year.
Good afternoon, one and all. I am Vaishnavi from Family 4th year. And here is my presentation on the largest vaccination drive going on. Ma'am? Here is my presentation on the largest vaccination drive going on. What is coronavirus generally? The coronavirus is the largest family of virus that causes illness from common cold to the since to large diseases like death. And coronavirus is spherical in shape and
Vaishnavi,
it
don't get disturbed. You just continue your presentation.
okay, sir, thank you. and and it has spike protein on its surface, where the spike proteins get attached to the cells of the human membrane and get fused with the cell membrane, and we get infected and our mRNA get transcribed. And now let's talk about the vaccination available vaccine. Why do we take vaccination? Vaccination is a biological preparation that prevents that boosts our immunity, activates our immunity. And the vaccination available in the world are: first, the AstraZeneca or Covishield vaccine. It is developed by Oxford University and is approved almost everywhere in the world, including European Union, India, Argentina, etc. And its mechanism of action, the double-stranded DNA present in the humans protein is protected in the safe virus. The infected cell expresses the spike proteins, and then after a spike protein gets expressed, then the immunity will be developed automatically. Its efficacy rate is 82% and to be taken in 2 doses, and the storage conditions are 2 to 8 degrees Celsius. Can be stored for 6 months. Bharat Biotech or Covaxin, it is developed by India. It generally chemically inactivates the chemical beta propiolactone, so that the virus will be inside our body, but it is in an inactive stage. Efficacy 81%. Dosing, it should be taken in 2 doses, 28 days apart. Storage condition 2 to 8 degrees Celsius. Pfizer, developed with BioNTech, authorized by US, UK, European, and also WHO. And the mechanism of action of both Pfizer and Moderna are same, where the lipid nanoparticles will be expressed and the spike will be observed, and the spike proteins will be expressed where the immune response is produced. Efficacy of Pfizer is 95%, and the dosing will be 0.3 ml, 2 doses, 21 days apart. And dosing for the Moderna is 0.5 ml, 2 doses, 28 days apart. Its efficacy rate is 94%. And the post-vaccination symptoms should be pain at the injected site, fatigue, headache, muscle pain, chills, and diarrhea. So the caution would be, as a healthcare workers, we need to just caution the people who came to vaccination, take a mild analgesic like paracetamol, not a potent one. And India will be the most vaccination capital of the world. Vaccination research development. Generally, vaccination studies are done phase 1, phase 2, and phase 3. Then it will be come to market after the FDA approval. But due to the pandemic, the accelerated model have came to the picture, like phase 1, phase 2, and quarter of phase 3 will be done. And during the phase 3, FDA will be given the approval, and the vaccine will be manufactured and given. And I conclude here that prevention is better than cure. So let's hope to get more vaccines with less side effects and more efficacy. And let's be safe, stay home, stay safe, and thank you. And I address the queue present here to get vaccinated with the largest vaccination drive, that is from tomorrow, May 1st, and get enrolled and get vaccinated yourself and your beloved ones, and stay away from Corona. Thank you.
Vaishnavi,
Ma'am.
if we are stay at home, we are safe. How many days we have to stay at home?
Ma'am, means we can prevent it by wearing the mask, carrying a sanitizer, and taking all the preventive measures. No, ma'am. We can't constantly stay at home, but if there is not that urgent work, we can stay at home. If it is particularly to attend the work, then we can live with by taking all the precautions.
Hello, Vaishnavi.
Ma'am.
So you have mentioned number of companies producing this vaccine.
Yes, ma'am.
So which one is having more efficacy?
Ma'am, according to me, according to the poster presentation, Pfizer and Moderna is having more efficacy, but every vaccine have its own value, and every vaccine will produce antibodies and is effective.
Okay.
We can't think that this vaccine is more efficacy and we can we can't get corona by taking only this vaccine. Every vaccine developed has more effectiveness on human, ma'am.
Okay. Thank you.
Okay, so now I would like to call Jayashree from Family 4th year.
More question, please. What is
Okay,
the
ma'am.
active constituent in Moderna vaccine? What is the active constituent in Moderna vaccine?
No, ma'am.
Once check it. It is a
Okay.
polypeptide.
Okay.
Okay.
I'll check it out.
Good afternoon, everyone. Can I start?
Yes, Jayashree.
Good afternoon, everyone. I'm Jayashree of Family 4th year, and my topic is about why COVID tests positive after vaccination. I start with the introduction. COVID-19 is an infectious disease caused by newly discovered coronavirus. Vaccination is the act of introducing a vaccine into the body. Vaccine is a biological preparation that provides active acquired immunity to a specific disease. Coming to the point, can COVID test positive after vaccination? We all know that the answer is yes, but a very few people who fully vaccinated against COVID-19 will still develop COVID-19 illness. Experts take cases like these are not surprising and do not indicate that there was something wrong within the vaccine or how they were administered. Here is why. Here is the answer for the question. Like vaccines don't work instantly. It takes a few weeks for the body to build up immunity after receiving a dose, and the vaccines require the second shot after a few weeks of the first one to reach its effectiveness fully. Nor they do work retroactively, which means that a person at the time of taking vaccine might have already affected with the virus and have not tested. So in this case, the person may test positive after the vaccination. The vaccine prevents illness but may not infection. COVID vaccines are being authorized based on how well they keep you from getting sick, needing hospitalization, and dying. Scientists don't know how effective the vaccines are at preventing the coronavirus from infecting you to begin with, or keeping you from passing it on to the others. Even the best vaccines aren't perfect. The efficacy rates for vaccines are not 100%. Then what is the rate at which they are effective? According to the Indian Council of Medical Research, the data showed breakthrough infections were extremely rare in India's vaccinated population, with an incidence rate of less than 0.05%, which is like only 5 people in all 10,000 people are getting affected by the virus, and only 77 out of 87 million people who got vaccinated in US till 20th April died due to COVID, according to the US Centers for Disease Control and Prevention. So this data shows that vaccines reduce hospitalization as well as death in the COVID cases. Here I have shown you some regarding the post-vaccination breakthrough infections. So they are very less. And here is a graph showing the number of people got vaccinated in each country. So here the India stands at the bottom with a very few percentage of people got vaccinated, around 1.7%. So I conclude that to bring this pandemic to an end, a large share of world needs to be immune to the virus, and the safest way to achieve it is with the vaccine. Vaccines are a technology that humanity has often relied on, even in the past, to bring down the death toll from infectious disease. And I end up with a small quote by William Schaffner that a short period of discomfort is whole better than a visit to the ICU. Thank you.
Hello, Jayashree.
Yes, ma'am.
You told that we required immunity to our body. Okay. What are the natural sources available for immunity? Or how to improve our body by getting natural sources for immune system?
Yes, ma'am. There are a lot of foods which can increase our, which can boost up our immunity, and we need to exercise regularly. With even with some natural foods, we can get immune.
Okay.
Give some examples for natural food.
Like walnuts, almonds, citrus foods, which can boost our vitamin C and increases immunity.
Okay, we'll move forward. I would like to call Harini from Family 4th Year.
Hello, good afternoon, everyone. Myself, Harini of Family 4th Year. Here is my poster on norovirus. I want to give a general awareness about this infectious disease. Though it is not so prevalent in India, this infectious disease is seen in United States and other Northeast countries. Coming to introduction, norovirus is a very contagious virus that causes vomiting and diarrhea, sometimes leading to death. People of all ages can be affected by this virus, and this virus belongs to the family Calliciviridae. They are a group of non-enveloped single-stranded RNA virus that primarily cause acute gastroenteritis, which is inflammation of enteric system. Treatment includes drinking plenty of liquids to balance the fluid lost by vomiting and diarrhea. There is no specific medicine to treat people with norovirus infection. And also here a point to be noted is antibiotic drugs doesn't work on this type of virus because antibiotics only work on bacteria but not viruses. And also norovirus is sometimes called as stomach flu or stomach bug. Though stomach flu is caused by influenza virus, this is called as stomach flu or stomach bug. And coming to vaccine, there is no current vaccine for this virus. Although it is an area of active research, there is no research going on this vaccine for norovirus. And here is a pie diagram showing the norovirus outbreaks from food contamination. The restaurants are playing a major role in spreading this virus, and others include schools, daycare and healthcare facilities, and private residences. So here are some estimates of annual number of illnesses and associated outcomes of norovirus in US across all age groups. There are around 9,000 deaths per year because of this virus, and also 109,000 hospitalizations, 465,000 emergency department visits, 2.27 million outpatient clinic visits, and 19 to 21 million total illnesses. So, coming to how contagious is norovirus, just a very small amount, as few as 18 viral particles of norovirus on foot or hands can make a human sick. In fact, the number of viral particles that fit on a head of a pin would be enough to infect more than 1,000 people. Here are some fast facts about norovirus. This virus is globally causing around 1 in every 5 cases of acute gastroenteritis and sometimes leading to death. Approximately 50,000 children aged younger than 5 years die each year because of this virus. And the yearly financial burden of norovirus is $60 billion worldwide due to healthcare costs. So here my poster is on norovirus, and it's gender. I want to give a general awareness. That's it. And I have collected this information from CDC and which is Center for Disease Control. And can you scroll up? And NFID. It is a national foundation for infectious diseases, which gives a lot of information on many infectious diseases. Thank you.
Hello, Harini.
Yes, ma'am.
Then how we will treat this norovirus patient?
Just taking a preventive measures, ma'am. Same as coronavirus, ma'am. Maintaining proper hygienic conditions and sanitizing our hands regularly.
Okay. How do you identify the person is suffering with norovirus, or what are the symptoms of norovirus infection?
Symptoms, major symptoms are diarrhea and vomiting, ma'am. If a person is admitted in a hospital with such symptoms, they go for a diagnostic test such as RT-PCR and they can go for a diagnostic test like RT-PCR, ma'am.
Okay.
Yes, I have a question, Harini.
Yes, ma'am.
How is it being transmitted?
It is being transmitted by the infected people only, ma'am. By
What is
not
the
maintaining
mode of transmission?
through fecals, through contaminated food. Even a small amount of contaminated food can cause this virus spread, ma'am.
Okay, is this virus present only in GIT?
Yes, ma'am. It mainly affects the GIT, ma'am. Causes gastroenteritis.
Okay, Harini, what is its incubation period?
Incubation period.
Any cases are seen of people suffering with this?
Yes, ma'am, but not in India, ma'am. It is mostly seen in United States, ma'am.
Okay.
And how many days the patient after patient recovers?
The person can be treated within 1 week, ma'am, if he takes the proper fluid intake. And in serious conditions, he or she may take the supportive care such as intravenous fluid, ma'am.
Okay, now we'll go with the next participant. I would like to call Sneha from Family 4th year.
Good afternoon, respected madams and sir. I am Sneha, Family 4th year. Here I am presenting an poster on miliary TB. The TB is an infectious disease which is caused by Mycobacterium tuberculosis. The differences between pulmonary TB and miliary TB is the tuberculosis, which affects only the lungs, is called pulmonary tuberculosis, and the bacteria may extended into the body and spreads to our organs and effects is called miliary TB. The symptoms are similar in both pulmonary TB and miliary TB, which includes our weight loss, fever, chills, weakness, general discomfort, and difficulty breathing. If the infection of the bone marrow may cause severe anemia and other blood abnormalities. The complications include tuberculous meningitis, and intracranial tuberculosis. And it is diagnosed by the presence of diffused miliary infiltrate on chest radiography or high resolution computed tomography. The treatment which includes are in miliary TB is similar to the pulmonary TB, and the treatment is extended. The drugs which we will use in miliary TB are rifampicin, isoniazid, pylazinamide, ethambutol. It is an first line drug which we will give for, it is an initial treatment which give for 2 months, and it is extended for 15 to 2 years in miliary TB. Treatment flow chart. If we will go for acid fast bacilli test, if there is presence of cavitation, we will go for isoniazid and rifampicin for 4 months. We will continue the treatment for 4 months, and we will again check the acid fast bacilli. If it is positive, means we can continue the treatment up to 9 months, and if it is negative, means we can continue the treatment up to 6 months. And again we have to check the acid fast bacilli test, and we will go to the further treatment that may extend it to 9 months of the treatment. If there is absence of cavitation or acid fast bacilli, we can go through the isoniazid and rifampicin up to 4 to 6 months, and it is given once weekly. The precautions which we have to take is we have to avoid the salt, because the salt may increase the mucus production, and which can lead to shortness of breath. And we have to keep our surroundings clean and neat, which we will prevent the more infectious diseases. And precautions, we have to follow the prescription as prescribed by the physician. Thank you.
Okay, Sneha.
Ma'am.
How this miliary TB is diagnosed? It is a test.
It is diagnosed through chest radiography or high resolution computed tomography scan, ma'am.
Okay, it is called HRCT.
Yes, ma'am.
Okay. So is it curable?
Yes, ma'am, it is curable, but the treatment may extend it to the 15 to 2 years or 3 years, ma'am.
Okay. You told that antibiotics we can use for this.
If there is any bacterial infection, means we can use the antibiotics, ma'am.
Along with the antibiotic, can we use the corticosteroids also?
Yes, ma'am. Corticosteroids are the second line drugs, ma'am.
Okay. Thank you.
Thank you.
Now I would like to call Rishika from Family Third Year. Rishika?
Yes. Can I start?
Yeah, you can start.
Good morning, one and all. I'm Nishika from Palmly Third Year. I'm here to explain about COVID-19 vaccination. It is, as we all know, this pandemic going on, and we know how important COVID vaccination is. And let's know some information regarding vaccination, how vaccine works. An inactivator or an weakened part of a particular pathogen containing an antigen are injected into the host cell, which triggers the immunoresponse within the body and produces a specific antibodies against the specific pathogen. Later, at any state, if the body is affected with the active pathogen, the immune system will produce a specific antibodies and fight against the virus. What does the inactivated virus contain? Based on the code of the virus, the viruses are differentiated. The coat contains different types of proteins. The proteins present on the surface receptor does not make the virus active. The virus can inactivate with the help of heat, chemical, and radiation, which makes the genetic material of the virus inactive. The inactive virus cannot replicate the virus. The inactivated virus does not contain any genetic material. Let's know the information regarding two main vaccines of COVID, which is Covaxin and Covishield. Covaxin is delivered by Bharat Biotech in Hyderabad and ICMR, manufactured by Bharat Biotech. What does it contain? It is an inactivated vaccine, means it contains a dead virus which cannot infect a person, but still it can teach the immune system to prepare a defense mechanism against the active virus. This is one of the older method of vaccination. Doses. Covaxin contains 2 doses of vaccination given 28 days apart. Storage. It can be stored at 2 to 8 degrees Celsius. Efficacy. The efficacy rate is 80%. Side effects. Abdominal pain, stomachache, injection side pain, fatigue, nausea, vomiting, fever, headache, muscle ache, and other common symptoms. Now let's know about Covishield. Covishield is developed by Oxford AstraZeneca, manufactured by Serum Institute of India, Pune. What does it contain? This is vector vaccine, means a adenovirus called CHADOX1 is the vector present in the. It is an adenovirus which is called as CHADOX1 is the vector that has been modified to carry the coronavirus spikes protein into the human cell. They inject cool virus which is harmless. It serves as a instruction manual for the body on how to fight against the similar virus. This platform is used for the infection like Ebola. Efficiency rate is 70.4%. Storage. It can be stored at. Sorry?
The time is done.
Okay, it's done. Storage, it can be stored in 2 to 8 degrees Celsius. Side effects, it has common side effects as it is an adenovirus. So it has common side effects like cold, flu side effects will be there. It is nothing but fever, headache, muscle ache, abdominal pain. Dosage, it contains 2 doses given in 28 days apart. Thank you. By concluding, I would say prevention is better than curing. So please take the vaccination, which by this you can get immunized from COVID-19. Thank you.
According to what is the suggestion, which is Covishield or Covaxin?
Sorry, ma'am?
Which one is better, Covishield or
Yes.
Covaxin? And what is the difference between the vaccine and antibiotic?
Antibiotics are the medication form, ma'am. Vaccines are taken to get immunized, to get a specific antibodies in our body, ma'am, to fight against that particular virus or a pathogen.
Rishika, is there any other vaccine which is approved other than Covaxin and Covishield?
Yes, ma'am. There is a vaccine called Saponix V. It is a Russian vaccine, and we don't have proper information regarding that.
It's Sputnik 5 Russian.
Yes, ma'am. 5 or
Sputnik 5.
Yes.
Sputnik 5.
Russian.
Yes.
Okay, my question is, do you need vaccine if you have COVID?
Actually, no, ma'am.
Already antibodies have been developed now.
Yes, ma'am. It won't be that effective, but it is better if you can take a vaccine.
Okay, how
Already
long after COVID?
Yeah. After 45 days. After you getting affected from COVID-19.
And Johnson and Johnson also, the vaccination is mentioned. It's a single dose, I heard. Is it correct?
No, ma'am. There are 2 doses actually. And that is
But
not approved in India, ma'am.
not in India. In US might be they approved. It's a single dose.
As I know, there are 2 doses for Johnson and Johnson, ma'am. And right now they are not giving the second dose because the side effects which are caused by that vaccine.
So they have withdrawn from the market?
No, ma'am. We actually don't have any information regarding that as it is not approved by Indian government.
Rishika,
Yes, ma'am.
my question is, why the government is fixing the 4 to 6 weeks between first dose and second dose?
Between 4 to 6 weeks, we can get our body will recognize the antigen of that particular pathogen and then create an antibodies in our body to fight against that particular pathogen or a virus. It is a maximum period that our body or that our immune system can recognize and create its own antibodies.
Okay. So why after second dose also some people are suffering with virus, even though you are saying the antibodies are there? What is the reason why they are affecting with virus again after second dose?
Maybe it is because of the mutated version of virus, ma'am.
Yes. Okay.
Now we'll go with the next participant. I would like to call Shailaja from third year. Sorry, sir.
Hello.
Shailaja.
Am I audible?
Yeah.
Okay. Good afternoon, one and all. I'm K. Shalja, family third year. Today, I'm going to present an e-poster on the concept of new antiviral drug, where clinical trial is going on this drug. We shall know the brief information of this drug and what are the investigations which are done on this drug and in what stage of clinical trial it is entered. First of all, we'll see the description. The drug name is molnupiravir. It is an antiviral drug. First, we'll see the description of this drug. This molnupiravir is an experimental oral antiviral. It is an antiviral originally developed to treat influenza previously. It is an orally active prodrug of synthetic nucleoside derivative N4-hydroxycytidine and exerts its antiviral action by introducing copying errors during viral RNA replication. MK4482 and EIDD, it's a brand names of the molnupiravir. So it consists of nucleoside analog and N4-hydroxycytidine. Molnupiravir has been evaluated against coronaviruses, including SARS-1, MERS coronavirus, and SARS-CoV-2. And let's see the antiviral history of molnupiravir. Molnupiravir was originally developed at Emory University by its drug innovation company, Drug Innovation Ventures at Emory. It was later acquired by Ridgeback Biotherapeutics announced the launch of phase 2 clinical trials to test the efficacy of EIDD 2801 as an antiviral treatment for COVID-19. A study published on April 29, 2020 found the potency of this drug against multiple coronaviruses, and oral bioavailability highlights its potential utility as an effective antiviral against SARS-CoV-2 and other future zoonotic COVID coronaviruses. On June 19, 2020, Miami-based Ridgeback Biotherapeutics announced the launch of 2 phase 2 clinical trials to test the efficacy of this drug as an antiviral treatment for COVID-19. The phase 2 were randomized, placebo-controlled, double-blinded clinical trials of this drug in adults and men and women tested positive for SARS coronavirus 2. Infection within 144 hours of polymerase chain reaction confirmation and are hospitalized with a diagnosis of COVID-19. Rapid enrollment and treatment will be initiated such that the first dose of this drug or placebo will be administered as soon as possible. And within 7 days of onset of symptoms, on July 1st, 2020, Merck and Ridgeback Biotherapeutics LP announced that the US Federal Trade Commission granted early termination of the waiting period under the Hart-Scott-Rodino Antitrust Improvements Act. All closing requirements have been completed for the previously announced partnership transaction to advance the development of this drug. Can you scroll up? Now let's see the clinical trials. The companies announced on April 15, 2021 based on a planned interim analysis of data from phase 2. The dose finding portion.
Shailaja, the time is up.
Let me conclude it. I'll just tell the benefits of it. Naidu Pharma seeks emergency note for molnupiravir capsules for COVID-19 treatment. Patients treated with this achieved response within 5 days of therapy, indicating that the duration of treatment is short, with the additional advantage of being an oral therapy. Naidu Pharma Ltd has applied to the Central Drug Standard Control Organization in India for approval of phase 3 clinical trials of molnupiravir capsule for the treatment of COVID-19 positive patients. Preclinical data have shown the molnupiravir has broad spectrum anti-influenza activity, including highly potent inhibition of SARS-CoV-2 replication. Naidu is hoping that CDSCO would give emergency approval for this drug based on compassionate use for patients. Thank you.
Shailaja?
Ma'am?
Drug, is it useful for COVID treatment?
Yes, ma'am.
Told that pro-drug, isn't it? So
yes,
pro-drug of what?
Ma'am, can you repeat?
No, this drug, molnupiravir, is the pro-drug of what?
What is the active drug? She's asking, what is the active drug? If
Yeah, ma'am.
molnupiravir is a pro-drug, what's the active drug?
I'm not aware.
You told no, initially it is obtained from cystidine. Pro-drug of
N4-hydroxy. It's a synthetic analog of N4-hydroxy.
Okay.
Now I would like to call M. Divya from PharmD third year.
Yes. Is it audible?
Yes, Divya.
Okay. Shall I start?
Yes.
Good afternoon to one and all. Now, I'm myself Divya from PharmD third year. Now, I'm going to present a e-poster on infectious disease, giardiasis. This is a disease is also known as beaver fever. It is caused by flagellate protozoa parasite known as Giardia lamblia. This is an intestinal infection which was marked by diarrhea, greasy stools, nausea, vomiting, dehydration, and stomach and abdominal pain. Where does this organism live? Actually, this organism has two forms, active form and inactive form. Active form is the trophozoite and inactive form is the cyst. When this, actually the cyst form of the protozoa parasite is found on the surfaces and soil, food and water, and it is contaminated, and these all have been contaminated with fecus from infected human or animal. How this infectious disease is caused by, it is caused by injecting a cyst form through direct fecal oral route or by indirect ingestion of contaminated food contaminated food and drinking contaminated water. Contaminated water. And this disease is diagnosed by the stool test. By the stool test, the identification of the cyst and the tropocyte form and the parasite is identified, and how it is managed. This infectious disease is managed by some drugs like metronidazole, tinidazole, and nitazoxanide. This nitazoxanide is a prodrug, and metronidazole is a one of the drug which was mostly prescribed for giardiasis, and this drug was contraindicated in the pregnant woman because the pregnant woman also have a chance to get infected by the giardiasis. Um, Giardiasis, so it is contraindicated in the pregnancy, so it is not prescribed for the pregnant woman. And indazole is also prescribed. And how shall we prevent it? Like it is mostly occurred in the areas where the poor hygienic conditions, and it is also have not washing hands properly. All these also having uh, all these conditions also causes this disease. And if the condition is disease, if it is not treated, it may lead to the chronic diarrhea with greasy and stools, but these stools does not have the blood and mucus, and it may, after the incubation period of 1 to 14 days, acute giardiasis also develop, and these may last for 1 to 3 weeks. Thank you.
Divya? Hello?
Yes, ma'am.
So you
Yes, ma'am.
have giardiasis, metronidazole you are giving, isn't it? In the slide you have mentioned.
Yes, ma'am.
Is there any drugs which are used for this treatment apart from metronidazole?
Ma'am, once again, ma'am.
No, in the slide you have mentioned metronidazole is used for this treatment.
Yes, ma'am.
Is there any other drugs apart from this?
Yes, ma'am. This tinidazole, nitazoxanide are there, ma'am.
Okay. There's what type of drugs they are? They are antibacterial or antiprotozoal or antiviral? What are they?
Anti-amoebic and anti-protozoal drug, ma'am.
Okay.
Like this metronidazole contraindicated pregnancy, ma'am. For this pregnancy woman, we will give paramomycin drug, ma'am.
Okay.
We'll go with the next participant. I would like to call Colin Manisha from Family Second Year.
Good afternoon, respected madams and sirs. Here myself, Colin Manisha from Family Second Year. Malaria. Malaria is one of the major public health problem in our country. Malaria is caused by protozoan parasite Plasmodium. The parasite are inoculated into the human host by female Anopheles mosquitoes. The 4 Plasmodium species that infect humans are Plasmodium falciparum, Plasmodium vivax, Plasmodium vallis, Plasmodium malaria. Etiopathogenesis. Human infection begins when female Anopheles mosquito inoculate Plasmodial protozoans from the salivary glands. During a blood meal, the microscopic motile form of malaria parasite are carried rapidly via bloodstream into the liver, where they invade hepatoparenchymal cells and begin asexual reproduction. By amplification process, a single sporozoid eventually produces 10,000 to 30,000 daughter merozoids. Swollen liver cells eventually discharge motile merozoites into bloodstreams, release the merozoid invaded and red cells invaded into the red blood cells and multiply 6 to 20 folds every 48 to 74 hours. After entering into bloodstream, merozoites rapidly invade erythrocyte and become trophozoite. Attachment is mediated via specific erythrocyte surface receptor. During early stages of intraerythrocytic development, can you please show me? Okay. During the early stage of intraerythrocytic development, the small ring form of four 4 parasitic species appear similar under light microscope. As a merozoite enlarges, the specific characters become evident, pigmented, and become visible. The parasite assume irregular amoeboid shape. A parasite has consumed nearly all hemoglobin and occupy the most of the RBCs. Now it is called schizozoan. Multiply nuclear division has taken place and RBC is ruptured to release 60 to 30 daughter merozoite that potentially capable for invading the new red blood cells and repeating the cycle. Clinical features: intermittent fever, chills, headache, and anorexia, nausea, vomiting, running nose, diarrhea, dysentery, skin rashes, painful swelling, joints, ear discharge, and severe malarial symptoms, coma, metabolic acidosis, severe anemia, hypoglycemia, acute renal failure, acute pulmonary edema. Slide is not visible. Excuse me, ma'am.
Yes, Manisha, just a minute. Ma'am, can we present Manisha's slide, ma'am?
Yeah, we'll ask Bhargavi to share it properly. Bhargavi, please share the slide, no?
Yes,
Yeah, extra time. We'll give extra time, Amma. 1 or 2 minutes extra.
And pregnant women, symptoms with pregnant women, acute malaria are considered to be high risk groups and must be promptly treated with suitable and safe anti-malarial drugs. Malaria in pregnancy is associated with low birth weight, increased anemia, and death. And in Florida, a genetically modified mosquito is released to eradicate completely malaria. 7,050 million genetically modified malarias are released. If the female malaria is taking birth in pupa state, it leads to death. By corona, we are listening within 1 year, listening 8 lakhs deaths per year. Since many years, by malaria, there are more than 8 lakhs deaths per every year. And how to patient education and how to be safe using mosquito nets, preventing reinfection, repellent creams, mosquito repellents, motivating the patient to take prescribed medicine regular without fail. In case of doses is missed, the patient should be advised to not miss the doses and not to double the dose if due to next dose. Help the patient to know about their medication, such as what for the medication as prescribed, dose, duration, potential side effects, and strategies to prevent them.
Hello,
anti-malarial combination drugs like anti-malarial combination therapy with stimulate users 2 or more schizontocidal agent
Bhargavi, can you share the slide? Bhargavi, can you share the slide once again? Share the screen. Do you have any internet problem?
Ma'am, maybe Bhargavi is not there, ma'am. Maybe some internet issue.
I will call her and I'll inform. Don't worry. How much time is left that you note it?
Ma'am, I completed, ma'am. Only drugs are left.
Let her tell. Okay, you can continue now. Judges will ask the questions.
Okay. To treat malaria, chloroquine is the best option in the doses of 25 mg per kg per day, 3 consecutive doses. And anti-malarial combination therapy also used. Ma'am, I completed, ma'am.
Okay, Manisha,
Yes, ma'am.
is there any natural drugs available for the treatment of malaria?
Ma'am, that chloroquine, that dalchini, which can be treated naturally.
Dalchina.
That I don't know, ma'am.
Cinchona. Okay.
Yes, ma'am.
So you have a nice about asexual method of life cycle of malaria. Okay. Who has discovered this life cycle of malaria? Because you have explained in a good way asexual method.
Ma'am, can you?
You have explained asexual method of life cycle of malaria.
Yes, ma'am.
So who has discovered this life cycle? You told correct, Henry.
Life cycle of malaria.
Yes, yes. You have explained, no, asexual method of life cycle.
I didn't.
Henry, amma, you చెప్పావు కదా asexual method.
Yes, ma'am. Yes, ma'am.
1948 he has explained. Okay.
What are the
Now
dosage
we have
forms available for this treatment?
Ma'am, Rose, I think.
Yeah.
Rose has I heard like Rose has discovered, ma'am. Rose Henry.
We'll go with the next presentation. We are having a joint presentation by Amulya and Kejia from Family First Year.
Good afternoon. Good afternoon. Am I audible?
Yes, Kejia, you're audible.
Good afternoon, myself Kejia and my friend Amulya from Family First Year. Today we are presenting a poster on COVID-19, which is an acute respiratory syndrome. At the end of 2019, novel coronavirus were identified as a cause of clusters of pneumonia causing over China. The WHO designated the disease of COVID-19. The virus is designated severe acute respiratory syndrome. Coronavirus, or called as SARS-CoV. Clinical features are an incubation period of less than 14 days, and majority of people are asymptomatic, and spectrum of diseases.
We can't hear you, Amulya.
Majority. Yes, I'm back. I'll continue.
Yeah.
And spectrum of disease, mild or no mild pneumonia. In severe cases, greater than 50% lung involvement and dyspnea and hypoxia is seen. In critical cases, respiratory failure or shock and multiple organ dysfunction syndrome. And complications are acute respiratory distress syndrome, cardiac arrhythmia, and acute cardiac injury, deep venous thrombosis, and acute stroke, and infection can be seen. We can diagnose these COVID by chest X-rays, and normal in early or mild disease, consolidation and ground glass opacities in bilateral, peripheral, and lower lung zone distributions. Um, in CT scan, ground glass opacities, more than 83% cases are seen, and GGO with mixed consolidations, pleural thickening, and interlobular septal thickening, air bronchograms. Less common findings are bronchodiastasis, pleural effusions, pericardial effusions, lymphadenopathy, crazy pavement pattern, that is GGO with superimposed septal thickening. And the diagnosis, treatment, and vaccine will be continued by my co-partner Amulya.
Myself, Amulya. I will be continuing diagnosis, treatment, and vaccination. And in diagnosis, there are seven methods. First is clinical suspicion, and second PCR, and third ECG, fourth blood test, and serology, imaging. First most thing is symptoms, clinical suspicions, new onset fever, cough, fever and cough, history of contact with a COVID positive case or suspect within last 14 days, history of travel within last 14 days, history of work in healthcare settings, history of severe illness. And second thing is RT-PCR, which stands for reverse transcription polymerase chain reaction. This is a commonly and preferred test for COVID-19. Specimens are nasopharyngeal swab and nasal swab and oropharyngeal swab. And third one is serology, which detects the antigens, nucleocapsid or spike protein, uncertain sensitivity and specificity. Imaging CT, this is done on thorax, bilateral, peripheral, and lower zones. Lower zones. And
Amulya, the time is up.
Okay. I just want to say that before before corona affects a person, prevention is better uh, rather than curing. So get vaccinated, everyone. And I don't say vaccination would completely prevent from corona. It just reduces the risk. Thank you. Thank you for giving this opportunity. Thank you.
Amulya,
Yes, ma'am.
how long this coronavirus remains on the surface of the objectives? And how many hours it will stay on the surface?
Maybe 72
It depends
hours.
upon the object, ma'am.
Okay. When they have given the name, COVID-19 name, in which month, which year they have given the name?
19, ma'am. 2019.
Month?
Month December, I guess.
They have given the name on February 2020. They have named. Okay.
We'll go with the next presentation by P. Srujana from Family First Year.
Am I audible?
Yes, Srujana.
Yeah, hi. Good afternoon once again. I'm Srijana from Family First Year. Here is my e-poster presentation on swine flu. Swine flu is also is equal to corona. Past, it is like in past it happened. Swine flu. It is also known as H1N1 virus. And then next. It was first discovered in the humans and then became pandemic in 2009, and it is originated in pigs. It is transmitted to a person, but not to an animal to a person. This we get when a meat is intake, like undercooked meat is intake. We take pork is uncooked meal, that uncooked meat of pork is consumed. We get like this. And the synonyms are influenza A, H1N1, pig flu as it is originated from the pig, and hog flu and pig influenza. Can you scroll down please? Then next we come, then it incubation period is from 3 to 4 days prior from the first day, and after prior from the first day and ends to the seventh day after the symptoms. Causes and then next it spreads through it spreads through sneezing, cough, and touching the contaminated surface. And next next comes sign and symptoms. Symptoms are fever, cough, sore throat, diarrhea, vomiting, and joint pains. This is even fatal due to the common causes of the death are respiratory failure, pneumonia, sepsis, and dehydration and high fever, and also due to the electrolyte imbalance. The next, here comes the diagnosis. It can be diagnosed by the history and the clinical examination and nasopharyngeal swab culture. It is done to check whether it is infected by the influenza A or B. And next comes the complete blood count. That is where you see where we can see the fall down of a WBC. And next, fourth one is and we have it in severe cases, influenza can also be diagnosed by the X-ray, that is chest X-ray and the ECG. Treatment of two kinds, that is medical treatment and non-medical. Medical, here comes, we take the drugs like antivirals, antipyretics, anti-analgesics, and antiemetics, and antibiotics uh, like um, um, like metronidazole. Then next, non-medicated treatments are.
Srijana, the time is up.
Yeah, I will conclude in just a minute. Non-medicated, taking rest, taking plenty of water, and having proper diet. Then next is prevention. It is same as same prevention for the coronavirus. And next, here I conclude. This includes it is a rapid transmission from human to human, and it reside. So, and here are some drugs are available for this in market also, but due to the side effects, people uh, are not taking it. Scientists are doing some herbal therapy also. The risk factors for this are persons who are about 25, they have the high risk factor, and children under 5 years, and adults who are undergoing the aspirin therapy. And next, it is combination with individuals with combination of AIDS and diabetes and etc. Here is my conclusion, and I'm done with my e-poster presentation. Thank you.
Hello, Srijana. Srijana?
Yes, ma'am.
Are there any swine flu vaccines are available in the market?
Yes, ma'am. Vaccines are also a kind of for prevention. And the vaccine are of two types, ma'am. It is inactivated, and one is attenuated influenza vaccine for adults, and this inactivated vaccine is for children. And the marketed name is Panvax and Fluzone, ma'am.
Hello, students. Students, am I audible?
Yes, sir. Yes, sir. You're audible, sir.
Yeah. So, dear students, a loud applause for all the students. Even our chairman sir asked me to convey the same. He was happy at 300-digit audience, and the kind of speeches that were held and the way the students were calmly listening. He felt very happy. Let me convey that. Then second is, I really, really appreciate the enormous patience that you had. Post lunch, we assembled at 2 o'clock. To my knowledge, I have not seen anywhere where the students are not moving here and there, bound to the screens for 2 hours with only one event called posters. Even in IPC, in any conference, nobody can sit for 2 hours listening to posters. This enormity of patience really, I really appreciate all the students. Only Vanitha students will have this enormity of patience and this. So I am not that patient enough. So let me put one question to who is the student?
Srijana.
Srijana. And after this question, we will have a break of some funny debates.
So
And
only
after,
student is there, sir.
Sir, we will complete Form D, sir. Then we will take break, sir.
okay. Inka any family.
So
Still
how many?
only one participant is there, sir, from Form D. Still only one participant is there.
But B form all are there. Okay. If Form D one is remaining, no issue. We will complete all posters. But those who prepared for debate are also anxious. So till 5 o'clock, let us complete the debates, whatever is there. Then we will start this Form D one poster. And after that, we will have the remaining posters of B form. Nothing we will miss. And
Sir,
and suggestion to the
sir, one small request, sir.
madam,
So if
let me complete.
okay, sir.
One suggestion to the people who are putting questions, when they are speaking in first minute itself, you will understand the concept and their preparation. You put couple of questions and after that listen for a minute. 3-4 minutes it will be over. Srijana, there is one diagram you have given. The person is sleeping.
Yes, sir.
Sleeping or suffering? Is
He's
it before
suffering, sir.
medicine?
He's suffering and he's taking rest.
After medicine? Or he is suffering because of the disease or because of the medicine? This is my question.
Actually, he's suffering from a disease. That's why he's taking rest now, sir.
And he is not taking medicine, then why, if he suffers like that, then why are we here?
He's also taking medication, sir. See there, his bed is full of medicines
Doesn't look
down over
like a
here.
medication, that blue one, no?
Bottle, sir. Here one is bottle and the
Bottle is not
medication is on the table.
that bottle is not looking like medicine bottle. It is looking like medicine in Telugu bottle.
Actually, we say that wine is also a medication, also. But
Maybe
I don't.
know. My teacher never told me like that, and I don't know about such things. New things I am listening from the students. Okay, Venu sir may note that it is also medicine. Students are teaching us.
No, alcohol beverages are not considered as medicine, but they possess most of the qualities of medicine. That's all.
But students are teaching us, sir. Let us learn from them. Did he tell that he did not take the medicine?
Like, sir, I was in a mean to say that assumption, like taking alcohol, like wine, especially wine, in a limited, it is good. I was able to.
Sujana, my question is how it is good?
You are
Yes,
titling something
but
and
how
you
it
are
is
telling something.
Sorry, sir.
Your title is something and you are telling something. Title is a petty, you are telling wines and all. What is this going on? Judges, you please disqualify the student. She is keeping swine flu heading and talking all different. Okay, anyway. So over to Richa for next program.
Yes, sir. Thank you to all the participants who have participated with
Very
your.
good, Srijana, don't feel.
Sir, sir, one small request, sir. Judges can do the average of marks, no, sir. If one student completes means
Okay, after 10 minutes, we will have one.
Only one student is there.
only one student, sir. That form D, they can do
Okay.
the average and they will complete, no, sir, at least.
Okay, madam. Okay, madam.
Thank you
Let
so
us
much,
come.
sir.
Okay, madam.
Now I would like to call PS Sweta from Family First Year.
Good evening, everyone. Am I audible?
Yes, Sweta, you can continue.
Yeah. I'm going to discuss the topic about brucellosis, which is an infectious disease. Infection spread from the animals to people. It's also called as Mediterranean fever. It is caused by gram-negative Brucella bacteria. Here is a picture of Brucella bacteria. The incubation period is usually 2 to 4 weeks, ranges 5 days to 6 months. The most common complications for this brucellosis is osteoarticular and reproductive, and it affects on the reproductive system. Although endocarditis is a inflammation of the heart walls or destruction of the heart walls, which may lead to the death also rarely. And Brucella species, there are several types of Brucella species. If it cattle, sorry, Brucella abortus affects on
Hey,
the
don't get tense. Whatever you know, you tell. No one is there with you, okay?
okay.
Madam,
Brucella abortus affects on the cattle, and Brucella canis affects on the dog, and Brucella suis affects on the pigs, and Brucella mellitinus affects on the sheep and goats.
5 minutes.
Symptoms like symptoms which we get by this brucellosis are fever and loss of appetite, chills and sweat, night sweating, weakness, fatigue, and joint, muscle, back pain, headache, etc. And several complications. If it may lead to several complications if it is untreated, osteomyelitis, and meningitis, endocarditis. As can you share the screen, please? Yeah. It mainly affects on the digestive system, and there are two types of Brucella species: zoonotic and non-zoonotic Brucella species. As we can see in the picture, we can see here the prevention. We can prevent it by avoiding unpasteurized dairy products, cook meat thoroughly, wear gloves. We should vaccinate the domestic animals.
A few questions to you.
Yes.
You said it will be infected to geriatric and pediatric.
Pediatric, yes.
The other population?
It affects to both pediatric
Adults.
Adults, yes.
Okay.
Sir.
So treatment includes vaccinating domestic animals. Huh?
Treatment is antibiotics, sir. Doxycycline, streptomycin, ciprofloxacin, and rifampin, tetracycline. Doxycycline is for 100 mg. If you use for 45 days, it may cure immediately, sir. And streptomycin is for 1 gram.
Doxycycline, is it a broad spectrum antibiotic or narrow spectrum?
Sir, I don't know about it. I'm sorry.
You are of family first year, huh?
Yes, sir. Family first year.
Okay. Tetracycline, is it antibiotic or antiseptic?
Antibiotic.
Antibiotic, antibacterial, any difference?
Antiseptic is this.
Antibiotic definition?
Define antibiotic.
which works against the microorganism which affects the body.
Yeah. So
Yes.
microorganisms, when they are fermented, they produce penicillin, right?
Sir?
Penicillins can be
Yes.
produced from microorganisms through fermentation, right?
Yes. Sir.
So you heard of that, or it's not there in your syllabus, right? Okay, then leave it. Okay, good effort. Okay, thank you. Who is next?
So diagnosis.
Still, she is giving.
It's okay, sir said to close, no?
Okay, so thank you.
It's good, right? Very good. Okay. Being first year, you have taken a very good topic, very tough topic. So very good. Okay. Bye.
Shweta, one
you.
small suggestion. So try
Yes,
to
sir.
keep your
Name.
name, your class details and all
Yes.
below the title of the poster. As you are in first year, so you may have to give so many presentations during your Form D. So name
Yes,
should
sir.
not be the bottom. Name should be below the title and then your class and your institute name. Okay.
Okay.
Can we go ahead with the program, sir?
Yeah. Carry on, Richa.
Okay. Thank you to all the family participants who actively participated with their posters today.
Bhargavi, share screen తీసేయమ్మా. Okay.
Yes, ma'am. We shall move on now. We shall move on to the interactive session now. We first have Rachna and Apurva from B Farm third year who are here with a small live session. Over to you, Rachna.
Good afternoon to the respective faculty and all my dear friends. I hope you are bored of these e-posters and the continuous session. So here we are just to light up and do the conversation between the vegetable seller and the reporter. I myself will be acting as a vegetable seller. Apurva?
I'm Apurva and I'm acting as a TV reporter. Anusha, can you please continue?
నమస్తే వనితా న్యూస్ కి స్వాగతం. నేను అనుష, మీ ప్రతినిధి. దేశంలో కరోనా ఉగ్రరూపం దాల్చింది. రోజు రోజుకి కరోనా కేసులు అనేవి పెరుగుతున్నాయి. ప్రస్తుతం తార్నాక ఏరియాలో ఉన్న రైతు బజార్ నుంచి లైవ్ అప్డేట్స్ అందివ్వడానికి మన ప్రతినిధి సత్య లైవ్ లో ఉన్నారు. సత్య, చెప్పండి, అక్కడ తార్నాక రైతు బజార్ లో ఎలా ఉంది పరిస్థితి, జనాలు ఎలా?
హలో అనుష, ప్రస్తుతం మనం తార్నాక ఏరియాలోని రైతు బజార్ దగ్గర ఉన్నాము. ఇక్కడ పరిస్థితి చూస్తుంటే ఎవరు సామాజిక దూరం పాటించినట్లుగా లేరు. ఇక్కడ ఉన్న ప్రజల మనోభావాలను మనం అడిగి తెలుసుకుందాం. నమస్కారం అమ్మా, మేము వనితా టీవీ నుంచి వచ్చాము.
నమస్తే. నువ్వు ఏ టీవీ నుంచి వస్తావు నాకేంది కానీ చెప్పు, నీకు ఏమేమి కూరగాయలు కావాలి? ఆలుగడ్డలు కావాలా, బెండకాయలు కావాలా? చెప్పు, నీకు ఏది కావాలి?
అలా కాదమ్మా, ఇప్పుడు నువ్వు టీవీలో కనిపిస్తున్నావు.
ఓ అట్నా, నేను టీవీలో కనిపిస్తున్నానా? ఓ కెమెరా మంచి తిప్పి పెట్టు, నేను మంచిగా కనిపిస్తున్నానా? చెప్పు, ఇంటర్వ్యూ అన్నా కూర్చొని మాట్లాడు.
ఇప్పుడు కరోనా వ్యాప్తిస్తుంది కదా, దాని గురించి మీరు ఎలాంటి జాగ్రత్తలు తీసుకుంటున్నారు?
అవునవును, కరోనా గురించి నేను కూడా వింటున్నా. అది పోతేనే మన దేశం వదిలి, అమ్మో నేను చాలా పరేషాన్ అవుతున్నా. ఎట్లనో ఏమో, ఏం చేయాలో నాకు అర్థమే అవుతుంది.
ఏంటి నువ్వు పరేషాన్ అవుతున్నావా? నువ్వు పరేషాన్ అయితే నీ మాస్క్ ఏదమ్మా?
అవును సారు. మాస్కా? నాకెందుకు మాస్క్? నేను చాలా గట్టి మనిషిని సారు. నేను పుష్టిగా తింటా, చూసినావా? నాకు దగ్గు లేదు, సర్ది లేదు. నేను ఇంత మంచిగా మాట్లాడుతున్నా. నాకేం కాదు కరోనా, నాకు ఆ నమ్మకం ఉంది.
నీకు లేదమ్మా, నీ దగ్గరికి ఎంతో మంది కూరగాయలు తీసుకోవడానికి వస్తారు కదా, వాళ్ళల్లో ఉందో లేదో నీకు ఎలా తెలుసు?
దానికి సరిపడా జాగ్రత్త నేను తీసుకుంటానులే. నేనేం వాళ్ళు ముట్టుకోను, వాళ్ళ దూరం నుంచే ఇగో ఈ గల్లె పెట్టెలు డబ్బులు వేస్తారు. నేను అక్కడ నుంచి కూరగాయలు ఇచ్చేస్తా కావాలా. ఒక నిమిషం ఉండండి సార్, ఎవరు వచ్చినారు. ఓ అక్క, మంచిగా ఉన్నావా? ఎన్ని రోజులు అయ్యారా అక్క? చెప్పు, నీకేం కావాలి? టమాటాలా 2 కిలోలు? నమస్తే అక్క, తీసుకో. ఆ డబ్బులా? వద్దు అక్క, వద్దు. నువ్వు తర్వాత ఇద్దులే, ఉండని.
ఇప్పుడే కదమ్మా ఎవరిని ముట్టను అది అన్నావు.
అయ్యో మర్చిపోయిన సారు, తెలిసినక్క కదా ఇక షేక్ హ్యాండ్ ఇస్తాం కదా తెలియకుండా, అట్లా ఇచ్చిన షేక్ హ్యాండ్ మర్చిపోయిన సారు, నేను మళ్ళీ రిపీట్ చేయాలి.
అదే కదమ్మా చెప్పేది, ఇప్పుడు పొరపాటు జరిగింది. అదే కదమ్మా చెప్పేది, ఇప్పుడు పొరపాటు జరిగింది కదా. ఇప్పుడు ఆమెకి షేక్ హ్యాండ్ ఇచ్చినప్పుడు కరోనా ఉందో లేదో నీకు ఎలా తెలుసు?
అది కూడా నిజమే, అయినా కానీ నాకు ఒక్కసారి ఏదో పొరపాటున జరిగిపోయింది సార్, అట్లా ఏం కాకుండా నేను చూసుకుంటాలే మళ్ళీ నుంచి.
ఇప్పుడు నీ వల్ల మీ ఇంటి వాళ్ళకు ఏదైనా స్ప్రెడ్ అయ్యి మీ ఇంట్లో చిన్నపిల్లలు ఉన్నారనుకో, అప్పుడు పరిస్థితి ఏంటి? ఇప్పుడు హాస్పిటల్స్ లో కూడా బెడ్ సరిగా ఉండడం లేదు.
ఏంటి నా వల్ల? మా ఇంట్లో వాళ్ళంతా మంచిగా ఉన్నారు, నువ్వేందయ్యా పొద్దున వచ్చి నా వ్యాపారం చెడగొడుతున్నావు. మా ఇంట్లో వాళ్ళకి ఏమైతుంది? బెడ్ లేకపోతే నేనేం చేసేది? నాకు కరోనా రాలేదు, వాళ్ళకి వస్తుందంటే ఏంది? నువ్వు ఎక్కడ అయ్యా? పొద్దుగా వచ్చి ఎవరో ఫోన్ చేస్తున్నారేంది? హలో హలో రమేష్ అన్న, ఏమైంది? నీ టీ షాప్ తెరవనే లేదు, 15 దినాలు అయిపోయాయి. ఏంది నీకు కరోనా వచ్చినదా? అయ్యో నీకెట్లా వచ్చినదన్నా? ఎంత గట్టిగా ఉంటావు, ఇంత జాగ్రత్తగా ఉంటావు, నీకు వచ్చినదా? అయ్యో నాకు బుగ్గులు అవుతుంది. ఫైల్ అమ్మారా? నీ షాప్ నేను చూసుకుంటానులే, మంచిగా ఉంది ఇప్పటికైతే. నువ్వు జాగ్రత్త అన్నా. ఓ టీవీ సారు, నాకు బుగ్గులు అవుతుంది సారు. టీవీ షాప్ పక్కన టీవీ షాప్ అని అతనికి వచ్చిందంట, అతను జాగ్రత్త మనిషి.
అదే కదమ్మా ఇప్పుడు నేను చెప్పేది. ఇప్పుడు నువ్వు చేసిన నిర్లక్ష్యమే కదా. కేసీఆర్ సార్ తెలుసా నీకు?
కేసీఆర్ అన్న, కేసీఆర్ నాకేం తెలీదు. మొన్న బతుకమ్మ పండగకి మా ఆడపిల్లలందరికి చీరలు పెట్టినాడు కదా, కేసీఆర్ నాకు తెలుసు సారు.
ఆయనకు కూడా కరోనా వచ్చింది తెలుసా నీకు?
ఏంది కేసీఆర్ సార్ కరోనా వచ్చిందా? అంత పెద్ద మనిషి నేను నమ్మ సారు, మీరు ఉట్టిగా చెప్తున్నారు. నాకు ఇంత బందోబస్తు ఉంటారా సార్ కి? నేను నమ్మ. ఆ సార్ గట్టి మనిషి, ఆ సార్ కూడా
అన్ని జాగ్రత్తలు తీసుకుని ఆయనకే వచ్చింది. ఇప్పుడు నీకు రాదన్న గ్యారంటీ ఏంటి?
అమ్మో ఇదేదో
అందుకే కదా జాగ్రత్తలు తీసుకోవాలి అని చెప్పేది.
నాకు గూగుల్ అవుతుంది సార్, ఇప్పుడు నేను ఏం చేయాలి చెప్పు నాకు జరా.
భయపడాల్సిన అవసరం ఏమీ లేదు. మాస్క్ ధరించాలి, శానిటైజర్ యూజ్ చేస్తూ ఉండాలి, సి విటమిన్స్ ఫ్రీక్వెంట్ గా తీసుకుంటూ ఉండాలి, సామాజిక దూరం పాటించాలి.
సి విటమిన్ అంటే ఏంటి సారు?
నిమ్మరసము ఎక్కువ తీసుకుంటూ ఉండాలి.
నిమ్మకాయలు చాలా ఉన్నాయి మా ఇంట్లో, నేను తాగుతాను రోజు. నాకు కూడా బుగ్గులు అవుతుంది, ఇప్పటి నుంచి నేను కూడా మాస్క్ పెట్టుకుంటాను సారు. థ్యాంక్స్ సార్, చాలా మంచి ఇన్ఫర్మేషన్ ఇచ్చినావు నాకు. నీకు చెప్పు ఏం కూరగాయలు కావాలి, నీకు ఫ్రీగా ఇచ్చేస్తా. నేను చెప్పు నీకేం కావాలి, నేను ఇచ్చేస్తా ఫ్రీగా.
ఇంతకీ నువ్వు టీకా తీసుకున్నావా?
టీకానా? అమ్మో టీకా నా వల్ల కాదు సార్. టీకా అంటే చిన్నప్పటి నుంచి నాకు భయం, సూదే నేను తీసుకోవాలి చిన్నప్పటి నుంచి. ఇక నువ్వు మాస్క్ పెట్టుకోమన్నా పెట్టుకుంటా, నిమ్మకాయ రసం తాగుతాను నేను. ఇక టీకాలు అవన్నీ నాతో కాదు సార్, నాతో అయ్యే పనే కాదు అది. నాకు బుగ్గలవుతుంది. అమ్మో
అట్లా కాదమ్మా, నువ్వు టీకా తీసుకుంటే నీకు ఒక్కరోజు జ్వరం వచ్చిద్దేమో, కానీ ఇప్పుడు నువ్వు టీకా తీసుకోకపోతే ఒకవేళ నీకు కరోనా వస్తే నీ జీవితమే కదా నువ్వు ఫనంగా పెట్టేది.
అమ్మో కానీ నేను
జ్వరమా కావాల్సింది, నీ జీవితమా?
నేను ధైర్యం చేయలేను సార్, ఒక్కరోజు జ్వరం. అమ్మో నాకేమో భయం అవుతుంది, మళ్ళీ ఏమో అయితే నాకు టీకా తీసుకొని.
టీకా తీసుకుంటే ఏమీ అవ్వదు, జ్వరం తప్ప చిన్న చిన్న సైడ్ ఎఫెక్ట్స్ ఉంటాయి అంతే, తీసుకోవచ్చు, ఏం పర్వాలేదు.
సరే సార్, అది నువ్వు చెప్పినావు కాబట్టి నేను ఆట నమ్ముతాయి. కానీ నేను ఇక కేసీఆర్ సార్కి వచ్చింది అంటున్నావు, ఇక నాకు ఇక పరిశాన్ అయింది. నేను చూసుకుంటా, నేను టీకా తీసుకుంటా. ఎప్పుడైనా తీసుకోవచ్చా సార్ టీకా?
ఇప్పుడు May 1 నుంచి టీకా తీసుకోవచ్చు. 45 years బిలో ఉన్న వాళ్ళకి రిజిస్టర్ చేసుకో.
అట్లా సార్, నేను తీసుకుంటా సార్, టీకా తీసుకుంటాను, మాస్క్ వేసుకుంటాను, ఎవరిని ముట్టుకోను, దూరం నుంచే మాట్లాడి పెడతాను సార్. చాలా థ్యాంక్స్.
Thank you for giving us this opportunity. Stay home, stay safe.
Yeah, thank you so much.
Thank you very much, Rachna Apurva, for this indeed refreshing and very, very nice session. Thank you so much. Srinivas sir or Venu sir, over to you.
Start a debate. So we'll keep now the debate session for B Farm students. So first years, second year students, if they are ready, then see the rules will be. So there will be 5 minutes discussion. One has to speak about the positivity and otherwise positivity about their topic, and they have to negatively comment about the other topic. Okay, so time given is 5 minutes, and first year versus second year B Farm. So it will be for 5 minutes, and then third year versus fourth year another 5 minutes, and then the next 5 minutes there will be final for the winning teams, final between winning teams. So initially we will conduct for these B Farm students, and first year and second year students, please be ready and switch on your cameras. So Richa, please alert them. B Farm first year and second year teams. So class in charges, please read out their names.
Sir, what about the topics? Sir? It will be given then and there, or will the participants be given time to discuss?
Yeah. So vegetarian food versus non-vegetarian food is the topic for first and second years.
Okay, sir. So I would request all the e-pharmacy first year and second year students to on their cameras and unmute themselves and introduce themselves.
Yeah, please do it fast because we are lagging behind because there are B Farm poster session is there.
Yes, sir. So first we'll be having B Pharmacy first years. Can you please introduce yourself?
So first years has to support the vegetarian food, and second years has to support non-vegetarian food.
Okay, sir.
Yeah, you can introduce yourself.
With your name and class, ma.
I am K. Mayuri from B Farm second year, ma'am. Respected jury and my teachers, my friends, honorable guests, and all my near and dear ones, a warm good afternoon to one and all. I'm Mayuri from B Farm second year.
I'm B. Vaishnavi Reddy from B Pharmacy second year.
I'm Kamala Afin of B Farm second year.
I'm Lisa from B Farm second year.
Repeat
So
your
we are
name.
all supporting the non-vegetarian food. We can't see our opponents.
Yes, ma'am.
Can we have our B Pharmacy first year students introducing themselves who are participating in the debate?
Yeah, actually, there is no information from first year students. And then second year students, you please be wait, and we will have debate between third and final years. And the topic of discussion is serials versus cinemas on mental health. So second years, please wait for some time. Third and final year students. Yeah, class in charges, please read out the names of third and final year participants. Third years, please introduce yourself. Those who are participating in debate.
Hello, sir.
Yeah.
Sir, this is Sri Lalita, madam. Sir, I'm third year in charge. I didn't get any names from debate for the debate from the third year, sir. Only I got electrician and e-poster.
What about final years, madam?
Sir, finally, yes, 3 people given, sir. This is Sirisha, sir, faculty. Finally, yes, 3 people given, sir, names.
Then the competition is between second and final years, madam.
Okay, sir, first years also nobody given, sir. I said yesterday only. Nobody given.
Okay. So now competition is between second and fourth years.
Okay, sir, I'll inform you.
Yeah, that's right, sir. It's a good decision. Carry on.
Sir, serials versus cinema or veg or non-veg, sir?
Shalini.
Venu, sir.
Madam.
Which topic Anuradha madam is asking? Serial versus cinemas or veg versus non-veg?
Serial versus cinemas on mental health, madam.
Okay.
So second years will support serials, and fourth years will support cinemas.
Fourth year's names, sir.
Good evening. This is Nikita from BPharmacy 4th year. I am along with my team members Shailendra and Mansa. So we are going to speak about for serials in favor of cinemas.
Good afternoon, everyone. This is Shailendra Kaur from BPharm final year.
Good afternoon, everyone. I am Vanitha from BPharm final year.
So now what you do, initially for 1 minute, each group will talk about their support about their topic, and later the next 3 minutes, then there will be discussion.
So I have a doubt. Should we speak about good things or bad things, sir?
The good things about cinemas and bad things about serials. And those who are supporting serials, they will talk about good things about serials and bad things about cinemas. Hope you understood.
Sir, can you repeat who is for what?
Second year students will support the serials and oppose the cinemas. Okay. Whereas
So
final year students,
also, there are good ways and bad ways. No, sir. We have to support what, good or bad.
see, second year students means they have to say that serials are good and cinemas are bad. Final years has to say that cinemas are good, serials are bad. Do you got my point?
Yes,
sir. Yes, sir. Yes,
Yes,
sir.
sir.
And you should relate to the mental health.
Okay, sir.
I really support serials because by day serial episodes, our mothers and some of the ladies can entertain. Daily they can see, but by seeing cinema only for 2 hours they can enjoy. But daily they will have it particular time they can enjoy, they can feel it. So I really suppose serials.
And what about cinemas?
So cinemas are negative, sir. Some negative cinemas are there. So they impact youth, sir. Whereas serials are mostly watched by married women or like old age women, we can say. But movies are like when we go to theaters, many youth are engaged in watching movies. So movies shows more impact on mental health than that of the serials. So our youth is going to be gone in a wrong way by watching the movies. For example, if we take the Arjun Reddy movie, he's an aggression problem. So he will be aggressive all the time. And by seeing him, many youth, I have read many news, I have seen many news channels that students and youth who are there are started behaving like him. They are imitating him. So I can say that movies are impacting, like mental health impaction is more in movies than compared to serials. So.
Yeah, now it's final year's turn.
Yeah. As you said that movies are really showing bad impact on mental health when it's regarding youth. But there are also certain movies like Yuri, which is related to surgical strike, and also Razi, which is also a patriotic film. That also, I think, shows good impact on the youth. But there are no serials made upon patriotism, basically.
I would like to add on a point. Serials, for example, Big Boss, we see it like there is no other serial like that. So when it depends on the choice of the viewer, what kind of serial or what kind of cinema he or she prefers to watch. So same is the case with the cinemas. There are many patriotic biographies and many. I can give you an example like Mangalyaan was the movie. Like it is based on science. So it depends on you what kind of movie you watch. It's not like every movie is bad.
And one more point, serials are very prolonged. They go on for many decades. Like if you see Ye Rishta Kya Kehlata Hai, it's been going on from since when we were in 4th class. So there's no conclusion for the serials. Even though they promote that joint families should be together, there are some impractical things which happen in serials that should be avoided. First of all, the prolonging time should be reduced. They should be short and sweet. Like movies, there even if you watch for 2 hours, you can at least learn something. It helps you refresh. Like if you watch 3 Idiots, it helps you refresh in a good way. It helps you to learn about friendship and the various facts.
Okay, so the point I would like to say is this is not Big Boss. Okay, there are some Satyameva Jayate. If you ever have seen the serial Satyameva Jayate and Roadies, they show the real talent of the people and the real cases.
But we can.
There are even some serials on autobiographies such as Shivaji Vikramaditya, which give a positive impact.
As I know, Dr. B.R. Ambedkar, which shows the history of our Ambedkar story, life story of him, fought for the freedom and caste religion, writing of the constitution, everything will be shown in the serial. So I really support serials.
During this COVID time when we are sitting at home, serial is the only way to get out of stress.
There are even
Also
OTT
about the
platforms where
single
we can watch movies also, right? And even coming to Roadies, even if you watch Splitsvilla, there is a lot of foul language that also impacts children, the youth. They'll also
As you told, it will be the viewer who wants to take what, like good or bad.
Yes.
See, you have spoken about
good or bad. So as you have said, you can choose the movie which you want to see. Right?
The serials also we can choose we want to
The same applies to cinema also. So it completely depends upon the viewer's opinion.
And plus cinema is only for 2 to 3 hours, but serials like they are for ages. So through serials only we have impact, like daily ka dose hai serial ka. So daily small doses of serial impacts our mental health very well. More than the cinema, which is just like month mein kitni release hoti hongi? Only 3 or 4 maybe. Like at least that much, right? So each cinema is of 2 to 3 hours max, but it won't impact. See, if you get motivated or you get influenced by a cinema which is of 2 to 3 hours ka length, then it will have impact only for only for a couple of days. But serial you are curious about is day by day, and it gives you
Yeah.
small dose of mental science every day. It has impacts on you every day rather than cinema, which are like monthly and stuff.
Second years, do you want to add any point?
Women who are daily working,
They are
daily working their household works can be getting relief at evening period by watching a small bit of serial.
But yeah, they can also get relieved by watching a movie.
And also,
See, the
everybody don't get the
women are relaxed only when they see something different, right? They want an eye treat. So eye treat is basically given by serials and cinemas also. But the thing is, serials are prolonged, and you get curious about them day by day, and that has a more weightage on your daily life. Whereas cinemas, of course, it is an eye treat. See, basically, you are talking ki, after a long day of work, you need an eye treat, you need a relaxation. So cinemas do that, right?
mostly
Like you don't get
usually will go to see
distracted.
See, women not only get
inspiring women, sir. For example, Anupama serial is there. I think it's the most watched serial. So it is inspiring women, and also you all know that they are Batiham. So that is also an inspiring story.
Yes.
Women.
Don't you think? But don't you think Diyar Bati mein they pictured the lady like she's an officer, of course, but she is always in the household only. मतलब वो घर के काम में ही उलझती रहती है.
That is
What are you actually depicting?
Just a second.
Yeah.
Now it's the conclusion time. Now, final year students, you conclude within a minute.
Yes, sir. Only 1 minute.
Yeah. So I want to conclude it by saying that not only serials relax women, there are certain other activities where women get relaxed, and if women also can prefer watching movies, because right now due to this pandemic, no one can go outside and watch movies, but at least they can purchase a OTT platform, and they can watch all sorts of movies. There are different kinds of movies where you get relaxed. They are comedy oriented, but when you talk about serials, there has only drama going on. There is nothing more than that. So yeah, I think
I would
people
like
don't
to
get.
add on to the conclusion.
Okay, now second years conclude.
Yeah, sir. I would like to conclude it. Serials, they give better platform for many members. You see in movies, there are only certain celebrities, and they will be for one movie the same celebrity, the other. In serials, there are many characters, many people can participate. So there is good motivation. We have good scope in serials. Also, it is having a minimum amount of time for entertainment. It will not waste your 3 hours of time, and even if and also it is like very good entertainment source. It will be repeated many times, unlike for you
And
for
moreover, it
example
is free of cost. You don't need to buy any Prime
yeah,
or
buy tickets.
You're giving money monthly, like you're paying monthly for the cable.
You're paying monthly for the cable.
Mental stress, right? Where we can get the money? If there is
time to conclude, right?
You are already paying for the cable. Already paying for the cable.
Yeah, you're paying for the
Time
dish
asked him to
TV.
conclude.
It's okay to pay 129 or 999. People are preferring a luxurious they can watch movie.
See, now you are discussing like a serial, and we have to finish like a cinema. And
serial will be finished in 30 minutes.
See, even sir is also supporting movies.
The reputation of serial is also affected because
platform for your talent. Cinema isn't a platform for talent.
So yeah.
Done. It's nice, and you have given very good points, both the teams. And now judges have already taken your points, and we will
Yes, sir. Yes,
let
sir.
you know the result at the end. Anuradha madam, you want to say something? Anuradha madam, you want to say
Next
something?
team, sir.
Yeah,
No,
next
sir.
team.
Over. That's over. Yeah, we'll go to next.
Yeah, actually now it's the time for B.Pharm students to present the posters, because please don't go anywhere. Another 3 interesting topics are there for Pharm D, and we will have a lot of fun. So before that, we'll try to finish these the B.Pharm presentations. Yeah, Richa, please go ahead.
Yes, sir. Sir, before starting the presentations, I'm sorry to interrupt. Dr. Karthik Rakam, sir, would like to speak for a few minutes. He would like to tell us about an event and a competition. Karthik, sir, over to you. And Bhargavi, ma'am, if you could please share the screen of
Hello.
Yeah. Hello.
Yes, sir, you're audible, sir.
Yeah, sorry to interrupt. Like you, all of you are doing great job. So I just wanted to share a contest which IPA has planned. So as we discussed in the morning, we have started a countrywide antimicrobial stewardship initiative. And as part of that, we are looking to involve students and invite them to participate in logo and slogan design competition. So I'll be putting a Google form link in the chat box. You can open that link and share your, like if you participate in logo contest, you can design a logo and put it there. Or if you want to participate in slogan, you can design a slogan related to this theme of antimicrobial stewardship. And even you can participate in both of them together. Okay, so this is one thing I wanted to share. And other thing is, as I said, like we are planning a lot of initiatives like TB Jan Andolan, antimicrobial stewardship, and health events. Next event is going to be about hypertension and tobacco. So if you want to join our team as an intern and involve, you can reach me. So I will share my contact number in the chat box. So these are the two announcements I wanted to make. So thanks for giving this slot. You can proceed with the other programs.
Yeah, thank you. Thanks, Karthik sir, for patiently listening to our student presentations and all this. Thank you and bye, sir.
And honestly, sir, I have not seen this proactive students anywhere. Like I have done workshops in more than 100 colleges across India. And I'm constantly in touch with more than 235 colleges across India through my WhatsApp. So I'm really impressed with
Thanks for the
proactive.
compliments, and we'll be in touch, sir.
Sure.
We'll be in touch. Thank you, sir.
Sure.
Teacher,
Yes, ma'am.
now we'll have poster sessions for B Pharmacy.
Yes, ma'am. Yes, ma'am. We'll proceed with the BFAM e-poster presentations. Akanksha, are you there?
Yes, Richa.
Yeah, you can go ahead with the...
Yeah. So let us start e-poster presentation by B Pharmacy students on infectious disease topic. So, ma'am, can we, yes, thank you. So first we are going to have e-poster presentation by P. Pujita from B Pharmacy 8th Sem.
Hello. Can you hear me?
Yes, Pujita.
Okay. Good evening, everyone. I'm Pujita from B Pharmacy 4th year, and I'm here to present a poster related to one of the most deadly diseases that is still prevalent in India and also in most of the uh, regions worldwide, that is malaria, which is a life-threatening disease. So, it is considered to be one of the most major public health problems in India. And according to the World Malaria Report, it's been observed that there are 249 million cases worldwide. So coming to the spreading, it is basically caused by a parasite, namely Plasmodium species. And these are carried by a vector called female Anopheles mosquito. And there are different types of Plasmodium species, but mainly 4 species are responsible for causing malaria, which include Plasmodium vivax, Plasmodium mobile, Plasmodium malariae, and Plasmodium falciparum. So, as I've indicated, to the next, that is about the extent of the infection that each species cause. Coming to Plasmodium vivax and mobile, they just cause benign tertiary malaria. That is, they cause we observe fever for every 2 days. When coming to Plasmodium malaria, it causes benign cotton malaria, which indicates it causes fever for every 3rd day. And coming to Plasmodium, which is one of the dangerous species, which causes malignant tertiary malaria. That is, even it causes fever for every 2 days, but this is considered to be malignant. This is considered to be dangerous. Coming to the symptoms, they appear after 10 to 15 days after the mosquito bite, which include fever, chills, headache, nausea and vomiting, fatigue, diarrhea.
Pujita, what is the difference between benign and malignant?
Benign is not a serious complication, where malignant is considered to be serious, which spreads more. Next slide, please. And I would like to give a glimpse about the life cycle of the malarial parasite. I will just talk about the malarial parasite forms at the end of the cycle. So we observe two important cycles, that is sexual cycle and asexual cycle. The sexual cycle occurs in female Anopheles mosquito. And by the end of the cycle, we observe sporozoites that are formed by
Pujita, you're left with 30 seconds.
yeah, okay. That are formed from the gametocytes. And then coming to the asexual cycle, which occurs in females. So we observe sporozoite form, and merozoite and trophozoite form, where trophozoites undergo rapid phase of multiplication and they infect RBC continuously. Coming to diagnosis, there are included the major diagnostic tools, which includes microscopic study, antigen rapid diagnostic study for the detection of antigens, and NAT, that is nucleic acid amplification test for detecting the nucleic acid that is present in the pathogen, and serological test for detecting antibodies that is present. And as you see, World Malaria Day is celebrated every year on 25th April for raising awareness of the global effort to control and completely eradicate malaria. And finally, there are some do's and don'ts that we have to follow for preventing.
Pujita, your time is up.
I'll just conclude. So there are some do's and don'ts which we have to follow for preventing ourselves from malaria infection, like using mosquito repellents, making sure that all the containers and tanks which are filled with water are completely covered with lids, and ensuring that our surroundings and local spaces are not extremely filled with water. And we have to prevent self-medication, and also should not take paracetamol and aspirin as medication without any kind of medical supervision. Thank you.
Do we have any questions for Pujita?
Pujita, who has identified these Plasmodium parasite?
Ronald was actually discovered the life cycle of malaria.
See, why we are unable to produce vaccine for malaria? Do we have malaria vaccine?
Yeah, we have malaria vaccine, but that is only available in Africa because the extent of infection that occurred in Africa is very intensive.
What
But in India, there is no vaccine. They are still working on it.
Yeah, why vaccine is not there? What is the problem?
Because the parasite is getting resistant to the medications that are being taken. Like, for example, chloroquine. Plasmodium falciparum got resistant to the chloroquine, and which is no longer used now for preventing infection.
Okay. See, why the cycle is existed in the mosquito, part of its life cycle?
Yeah, when it sucks blood from human, gametocytes enter female Anopheles mosquito. They are produced from trophozoites.
Yeah, I'm done.
What are the drugs used to treat pediatric patients?
The thing is chloroquine, as well as the natural quinine, the natural alkaloid that is obtained from Symphonia bacteria.
Okay, so hopefully we are done with the questions. So let's move on to our next participant, who is S. Shailendra Kaur from B Pharmacy 8th Sem.
Good afternoon, everyone. I'm gonna present an e-poster on COVID-19. So, a calamitous ongoing viral infective disease since 2009. Coronavirus presently was identified in Wuhan in 2019, and it is caused by SARS-CoV-2, that is severe acute respiratory syndrome coronavirus 2, which is a single-stranded RNA beta coronavirus similar to SARS-CoV and MERS-CoV. It is the 7th coronavirus that was identified to infect human beings. It is zoonotic. That means it is transmitted between animals and humans. Symptoms, of course, include cough, fever, respiratory symptoms, shortness of breath, breathing difficulties, etc. It can be transmitted by close contacts with the infected person with his droplets of vomit, and it is also transmitted from mother to child and animal to human. Well, my poster presentation mainly focuses on the treatment ongoing. So we have three types of treatments presently ongoing, that is repurposed drugs, antibodies, and vaccines. So there are many mechanisms through which repurposed drugs act on the virus. First being uh, through virus-related targets such as RNA genome. Examples of the drugs include remdesivir, favipiravir, ribavirin. Favipiravir inhibit the RNA-dependent RNA polymerase enzyme and terminate the viral propagation or replication. Favipiravir inhibits by acting on the immunosin monophosphate dehydrogenase enzyme that controls the intracellular genome intracellular GTP pool. By exhausting the GTP pool, it indirectly inhibits the RDRP enzyme. So it interferes also with mRNA capping. Then through polypeptide packing, examples include combination of lopinavir, ritonavir, which is also known as Kaletra. It is a combination of protease inhibitors, which inhibits by acting on the enzyme 3-chymotropin like protease, thereby disrupting the viral replication and release from the host cell. Next mechanism includes through antiviral immunity of the host. As we all are aware, interferons are produced and show an antiviral effect on the invasion of the virus. Other example includes lopinavir, rotinavir, and in combination with interferon beta. The next mechanism includes by interrupting or by targeting the viral uptake pathway. Examples include chloroquine and hydroxychloroquine, which interfere with the entry of virus into the cell. The virus has the viral receptor binding domain has more affinity to the receptor ACE2. So the chloroquine or hydroxychloroquine bind to this receptor and prevent the binding of the binding of the viral receptor and thereby prevent its entry into the cells. And another drug, Arbidol, also known as umifenovir, causes the trimerization of SARS-CoV glycoproteins, spike glycoproteins, and inhibiting its adhesion to the host cell. Next line of action is monoclonal antibodies. So bamlanivimab from Eli Lilly consists of two antibodies directed against SARS-CoV-2 spike proteins and its receptor binding domain. Next examples include casirivimab and imdevimab. These two bind to the different regions of SARS-CoV-2 spike proteins and also affect the binding domains of the virus. In 2020, November 2020, FDA granted emergency use.
Shailendra.
Okay, can I conclude by the main part?
Yeah.
So the highlight of the e-poster is the pipeline vaccines. There are many pipeline vaccines which have
Shailendra,
been
your time is
designed.
up.
Sorry, hello. Can I conclude?
Yes,
by this
yeah.
Yeah,
You
you
can
can
continue.
conclude. Yeah.
Okay, there are many pipeline vaccines which have been designed to tackle the virus. The most talked or most effective being the Codagenix nasal vaccine, which is an intranasal live attenuated vaccine. It is important because it is already in phase 1 and it is designed to give immunity against a wide range of SARS-CoV-2 strains. And rest all, as you can see on the slide, include CVA CoV-21, COVAX UB612, and VLA 2000, Luna CoV-19. I conclude on this note that even after we are vaccinated, we should follow the do's and don'ts and be safe, have a positive mindset during this pandemic. Thank you all.
Yeah, Shailendra, it's nice
Yes, sir.
presentation. Yeah,
Thank you, sir.
actually, I have one basic question. Generally, for a lung infection, if drug is given in the form of nasal drops, I think it is effective because directly reach to the target organ. But
Yes, sir.
how a vaccine in the nasal drops, how it will help? Because we we have to activate immune system, right?
Yes, sir. Like when the vaccine enters the lungs, like when you're taking it intranasally, the live attenuated vaccine helps in like triggering the immunity of the host very quickly because it is on the site. It works on the site, and
But
antibodies.
antibodies will not be produced from the lungs, right?
Sorry, sir.
Antibodies will not be produced from the lungs. Why it will? How it will help?
Sir, cell also like because sir we are having inflammation in the affected areas, so there are many factors already present now, sir.
See,
So they might
you
because
can answer
phagocytes.
other questions. I know that you can answer other questions. That is why I'm asking you some little uh, some what I can say is having some logic. Drug when instilled into the lungs, it will cure because target will be there, drug will bind. But how vaccine will help? Antibodies will not be produced from the lungs, right?
No, sir. So can you tell me the answer?
But you said you are it's efficacious, very efficacious. It will be very efficacious vaccine.
So I said that because they are like they act on the site of action, like where the infection is present.
See,
Maybe
the
because
antigen
drugs.
antibody will be produced by immune system only, but immune system will be quickly triggered because
That's what
when
I
it
said, sir.
enters into the lungs, the vaccine means what? Inactivated pathogen.
Yes, sir.
So when it enters into the target organ, it quickly triggers the immune system so that action will be immediate.
Sir, I mentioned that initially, sir.
Yeah, fine, fine. That's good, good presentation. So can we proceed to next presentation, Richa?
Thank you so much.
Yes, sir. So we'll have next presentation by Apurva from D Pharmacy 6th term.
Good evening, everyone. I'm Apurva of 6th semester B Pharmacy. I'm here to present e-poster on the topic, what can pharmacists do for you? Let us see the important role of the pharmacist here. Your pharmacist, your medication expert. Interpret drug interactions. Pharmacists look at all the possible interactions between not only prescriptions, but also over the counter, herbals, and supplements. So be sure your pharmacist knows everything you're taking. Counsel on prescriptions. Whether handling you a new prescription in your community, pharmacy, or visiting a room in the hospital, pharmacists explain what you need to know about your medications and answer any questions you ask. Manage chronic diseases. Diseases like diabetes, high blood pressure, high cholesterol, etc. Pharmacists know about treating these conditions, and they can be a valuable resource between the physician and the patient. They can act as a bridge between them. They can also help you. They can also help you figure out what to do when a problem arises. Pharmacists can helpful in quitting the bad habits like smoking, etc. Pharmacists are knowledgeable about tobacco use and can offer you support and encouragement as well. Recommend options to help you quit. Make it easier to take your medications. Pharmacists help pinpoint why it might be hard to take your medications as prescribed, whether it is keeping you up to late night or you're simply forgetting it, anything the reason might be. And they can recommend you strategies, they can give you tips to help you to remember to take your medications. Stay up to date on what matters to you. We follow all the latest science, and will stay up to date and filter through new updates to find out what will impact. Verify, prepare, and check medications. Uh, they ensure that medications is right for you based on medical conditions and lifestyles. As said above, they know well about the drug interactions. Then they check the medication dose and instructions to be sure you have received the drug for you. Wellness screenings. Many pharmacies will offer screening for blood pressure, cholesterol, diabetes, etc. They can help you figure out what to do next if there is a serious problem. They can suggest you help. Make medication information understandable. Uh, we know you don't need to know everything as a patient. So we determine what is important to you, such as we can suggest you and we can help you in using of the medications and when to expect the results and what to do if the if you experience any side effects like that. Pharmacists will help you and understand you. They provide vaccines. Pharmacists give vaccines that prevent serious diseases such as flu, pneumonia, etc. OTC counseling. OTC stands for the over the counter. Pharmacists also know about the over the counter and natural products out there. So the next time you're not how to treat your cold symptoms or if you should try glucosamine for arthritis, talk to your pharmacist.
Apurva, your time is over.
Okay, I'll conclude. Help you stay out of the hospital, whether it's an emergency room, hospital, nursing faculty, or at home. Pharmacists are key partners in ensuring that you and your providers are up to date in your medications. So finally, I want to conclude that pharmacists play a major role and key role, and they act as a bridge between the patient and the doctor.
Okay, what is this Northeast Ohio Medical University? On the screen, we can see this university name. Apurva, can you answer?
Sir, actually, I've sent it. I prepared and I sent that. Here, my name will be there. I don't understand your why to say. Here, my name will be written like Apurva B Pharmacy third year.
I agree, but what is this Student Society of Health Pharmacists, Northeast Ohio Medical University? Is it your presentation or not?
Yes, sir.
Can you see the screen?
Yes, sir.
Okay. Okay, so leave it. So such things should not be visible because you can mask it. Suppose you are copied from the internet sources. Where
No,
pharmacists
sir,
have this
actually,
many
what I
qualities.
sent will not be written here. A green color mark will be there, and my name will be written here, sir.
Okay. I think it is not your original file. Okay, okay.
Sir, I took from some internet resources, but not the same one, sir.
Okay.
I made some modifications.
What I am trying to tell you is it should not be. Because anyway, we will get the information from the internet sources, but we should not keep as it is. We have to prepare the slide by our own. That is required. And the second thing is, do you know what the salary of a pharmacist in a private medical store? Do you have any idea?
I'm sorry, sir. I'll make a note.
No. Okay. Okay. At least tell me, is pharmacist is a highly paid professional?
No, sir.
And the pharmacist have this many qualities. Why he is not paid much? What could be the reason?
Actually, pharmacists are not getting much importance because, like, they are giving certificates to some other non-pharmacists who are not pursuing, who are not getting a degree in pharmacy, and they are running the medical.
There are some issues with the regulatory authorities also. But you have given a wonderful message to all the audience that the pharmacist, to call as a pharmacist, the person should have this many qualities and this much knowledge, right?
Yes, sir.
Am I right?
Yes, sir.
Yeah, so all of we should remember that we should get expertise in all these areas before completion of our course. So any other questions, madam? If there are no questions, then we can move to next presentation.
Okay, sir. So now the next presentation is by M. Ritika from B Farm 6
Good evening, one and all. I'm Marie Rutika from B Farm third year. I'm here to give a small presentation on Zika virus disease. Zika virus disease is caused by the transmission of virus primarily by Aedes mosquito bite. You're audible? Am I audible?
Yes, Ritika. Yes,
Yeah, you are audible.
The symptoms of the transmission are generally mild and include rashes, conjunctivitis, headache, muscle pain, malaise, etc. These symptoms typically last for 2 to 7 days. In most cases, there are no symptoms. In a few cases, Zika virus can trigger paralysis. In pregnant women, it may cause subsequent birth defects. Zika virus has been identified in several body fluids of infected individuals. In most cases, it remained detected in blood from few days to 1 week after the onset of symptoms and can persist longer in urine and in semen. This virus has no particular vaccination or specific medications. The total focus is on relieving the symptoms and includes rest, rehydration, and acetaminophen for fever and pain. Aspirin and NSAIDs like ibuprofen should be completely avoided. The detection of this virus infection can be done by IgM antibody assays. Zika virus, Zika virus is a mosquito-borne disease. The best prevention is avoiding or repelling mosquito with the help of mosquito repellents containing picaridin and diethyltoluamide. Thank you.
Okay, is Zika virus causes mortality? Leads to death?
No, sir. More symptoms are not yet specified. So
do we see these mosquitoes in India? Aedes mosquitoes. Yes.
yes, sir.
The mosquitoes are there in India, but it is
Yes, sir.
they are transmitting this infection. Can you hear me?
Yes, sir.
Yeah, these mosquitoes are there in India.
Yes,
Aedes
sir.
mosquitoes.
Yes, sir. They are.
Means Indians are suffering from Zika virus infection.
Yes, it's rare in India, like extremely rare. 1 in 5 get infected here.
See, in the slide itself, it is clearly visible. Present in Canada.
Yes.
The mosquito known to transmit the virus are
Yes,
present in
Ritika.
They are not present in Canada, sir.
Huh?
Present in Canada.
Okay.
Yes, what is its incubation period? Like how many days after symptoms are seen?
Around 2 days after symptoms are seen, ma'am.
Yes, sure. And if there is no treatment, like how the person can be cured, like within how many days the person can be cured?
Like the symptoms, will focus on the symptoms, ma'am, like fever, pain, and skin rashes. We'll cure that. So
Okay,
So
how
why
can
we
it
should
be
avoid aspirin?
diagnosed?
Yeah. Yeah, madam, you can ask.
Yes, how can it be diagnosed?
it is diagnosed by IgM antibody assays, ma'am.
Okay, only one assay.
Yes. Yes, ma'am.
Okay, we'll proceed to the next presentation. Richa, call
Okay,
other
sir.
person.
Yes, sir. Now I would like to call Rachana from BPharm 6M.
Good afternoon to the respective faculty and all my dear friends. I'm Rachna. I'm here presenting my poster on the topic a role of pharmacists during the COVID-19 pandemic. Throughout the COVID-19 global pandemic, pharmacists were rarely mentioned as essential frontline healthcare providers. by the news, media, the public. Around the world, pharmacists are working on the front line of healthcare every day, providing healthcare and helping the patients, educating them through they're not identified. So today we'll see what are the roles they are playing by the pharmacists. Drug therapy. Hospital pharmacists are evaluating emerging COVID-19 drug therapy options to rapidly make patient care decisions, monitoring and adjusting COVID-19 medications to prevent adverse side effects, managing numerous drug shortages, maintaining uninterrupted drug supply. There's also a small example. Experience from the one of US hospital identified that COVID-19 patients received an average of 19.8 different medications and pharmacists, made by an average of 8 interventions by the patients. Drug therapy, the pharmacist develop COVID-19 medications, guidelines, or protocols to the patients. They also monitor COVID-19 medications, identify therapeutic medications alternatives. And they also identify and standardize priority standard dosing to support managing. Pharmacists assess patient conditions for COVID-19 medications and all research. As we all know, there are many labs research going on research from the 2019 itself. Many pharmacists are working, lab technicians are working on this. Recently, we heard of this Covishield and Covaxin are being developed, but not so effective. But researches are being done. Educating the public. Educating the public is the main role of the pharmacist, I feel, where nowadays the patients are getting panicked by the COVID. And I also heard many of the patients are dying, not because of this COVID, because before that, the fear is killing them. So it is the main key of the pharmacist to educate common people that it is not harmful, it can be cured, and all the medication and the steps to be followed by the patient, like taking the right food and making the steam inhalation. And if the COVID is in the mild stage, the pharmacist can explain to the patient to take the hydroxychloroquine tablets. So it's a main part of the pharmacist to educate the patients and all the common people. Drug shortages, how the pharmacists will do on this. During these times, the drug shortage could lead to serious consequences when it comes to patient outcomes. The risk of medication errors may be highlighted, including that of drug emission dispersions. There are many cases that people are suffering without oxygen cylinders and also shortage of beds. So pharmacists can also act as a drug analyzer. Okay. I hereby conclude that if India and the pharmacist is given his right status at right time at right position, this pandemic would have not attained the work peak and witnessed piles of dead bodies. Thank you.
So what do you feel
Yes,
the
Rachna,
pharmacist is not playing?
your conclusion I like very much.
Thank you, sir.
So Rachna, what do you feel as of now the pharmacist what they have to do they are not doing in this pandemic situation?
As from like many days, still I'm joining B Pharmacy, I felt that India is not given much chances to enter the hospital field as compared to US abroad states. In India, pharmacists are given least opportunities. At least pharmacy have this all main qualities. They can educate the people, they can arrange data analysis, they can do several things, but Indian hospitals are not encouraging pharmacy students, I feel.
So you are talking about the pharmacy professionals or pharmacist?
Pharmacist, sorry, yes, pharmacist.
Okay. Pharmacy professionals are they are there in various fields. So pharmacist is different.
Yes,
Madam को phone करके दे.
Okay, Rachna, nice presentation.
Thank
so,
you,
Richa, shall we move to next presentation?
I would like to call Geetika from B Farm 6M.
Good evening to everyone. Myself Geetika from B Pharmacy third year. Here I am to present on infectious disease influenza. Influenza is an acute respiratory infection. Yes. It is an acute respiratory tract infection commonly known as flu, and it is an highly contagious infection caused by the influenza virus belonging to the family Orthomyxoviridae, which are classified into 4 genera. It includes influenza virus A, B, C, and D. With regard of human health, influenza virus A and B are of main concern that causes the respiratory tract infection. Pathogenesis. Influenza virus infect respiratory tract cells and it gain its access to the human respiratory tract. It adhere to it and penetrate into the epithelial cells by endocytosis. For its replication, it takes 4 to 6 hours. Viral replication damages the infected host cell to cause their apoptosis. The newly emerging virus particles burst from the cell membrane and released within the assistance by the neuraminidase to infect the adjacent epithelial cells. Large quantity of cells infected in a short period of time and subjected to the apoptosis and shedding of the cells of infected cells causes the local inflammatory responses as well as symptoms. Signs and symptoms of influenza include which may range from asymptomatic to the death, sudden onset of fever, cough, mainly dry cough, headache, muscles and joint pain, sore throat, runny nose, chills, nasal congestion, and rarely encephalitis are seen. In severe disease patients, pneumonia, acute respiratory distress syndrome, and even death may occur. How do we diagnose this influenza? There are a number of tests available to detect the influenza virus in respiratory specimen. Most common is rapid influenza diagnostic test. It is an antigen detection test and reverse transcription polymerase chain reaction and rapid molecular assay. FDA declared that rapid molecular assay produce more accurate results compared to the other diagnostic test because it is more accurate and of high sensitivity and specificity. These tests are performed in the specialized laboratories in hospitals or state public health laboratories. Nasopharyngeal swab is taken from the patient and sent for the testings. Rapid molecular assay work by detecting the antigenic material or the nucleic acid of the virus in the upper respiratory tract, and we will get results within 15 to 20 minutes. If one is diagnosed with the influenza virus, no need to panic. Isolation of the patient is the first step because influenza is a highly contagious virus. Treatment include FDA-approved 4 antiviral drugs under the brand name Tamiflu, Zofluza, Relinza, Rapivap. And before going to the prevention, I want to talk about the transmission or the spread of the virus. It caused by the influenza virus, and virus is spread mainly from person to person when influenza infected person cough or sneeze. From droplets, it propels about 3 feet through air, and also by touching the objects or the surface. That influenza virus.
Your time is over.
May I conclude?
Yeah, sure.
I conclude that prevention is much better than cure. So we can prevent by vaccination. There are many vaccines for influenza virus, which are quadrivalent vaccines and trivalent vaccines. In nowadays we are so familiar with the viruses.
I want to interrupt here. See,
Yes,
prevention is better than cure. That's a old saying. But when preventing probability of success of prevention, if it is less, and probability of cure is more, when you go in probability scales and all, that may not be true. Okay. Why don't you think differently?
Yes,
in epidemiological calculation, you have to see the probability, likelihood, nature, and all those parameters. So, like COVID vaccine, whether they prevent or not, what is the percentage? Cure, what is the percentage? Why every student is giving the same conclusion that prevention is better than cure? That is a standard conclusion everyone is giving. What is the full form of FDA?
Food and Drug Administration.
Food and Drug Administration. Food, Drug and
Food and Drug Administration.
What is its main function? Paytm. Okay, nice presentation. It's very good, well presented. Yeah.
Thank you,
Next.
Yes, sir. So now let us move on to our next participant, who is B. Vaishnavi
Next or
Reddy.
last?
Next, sir.
How many are remaining?
3, sir. Including Vaishnavi, we are having 3, sir.
Acha, okay.
So
Okay,
we are
okay.
having, yes, B. Vaishnavi Reddy from B Pharmacy 6, sir.
It is 4th SEM. So a very good evening.
Vaishnavi, just a second. Good evening. I'm sorry. I would like to request all the participants to please switch on your video when you're presenting your poster presentation. Please, we informed this earlier also.
I request the other attendees to mute themselves, please.
Yes, Vaishnavi.
Ma'am, the name is not clear here. Can you please check it?
I would request the host to mute all the attendees.
The name should be acquired immunodeficiency syndrome. A full name will come, ma'am, according to the PPT that I have said. Okay.
Are you not able to recollect what is there inside?
No, sir, but the name
Then
is...
continue.
Okay, sir. A very good evening to everyone. My name is B. Vaishnavi Reddy from B Pharmacy 2nd year. As today's e-poster topic is about any infectious disease, I have chosen to present about AIDS, which is acquired immunodeficiency syndrome. It is caused by human immunodeficiency virus. HIV is the initial infection, and we can say that AIDS is a sequel to that of the HIV. So HIV belongs to the retrovirus, and it belongs to the genus lentivirus and the family Retroviridae. We all know that World AIDS Day is celebrated on December 1st every year, and here it is a red ribbon is the universal symbol for the AIDS or HIV. Here you can see the structure of HIV. It is an electron dense core, which is made up of 2 RNA strands and reverse transcriptase enzyme, and also core proteins such as P24 and P71. And it is surrounded with a lipid bilayer. That bilayer is started with GP120 and GP41. This is about the structure. It was thought that HIV was first originated from the chimpanzees in Central Africa, and the first in the USA in the year 1981. India has the 3rd largest HIV epidemic in the world with 2.1 million people infected as of 2017 reports. And there are 2 types of HIV, namely HIV-1 and HIV-2. HIV-1 is severe, and it spreads more fast from person to person, and people who are suffering from HIV are at greater risk for developing it into AIDS. But HIV-2 is of less severe, and the transmission rate is also slow. So when we are referring to HIV, we are HIV-1, we are referring to HIV only. Here you can see the statistical data. In the year 1998, there are like 3 lakh people, 3 lakh cases per year. But as the year passes by, in the year 2015, there are less than 1 lakh cases. We can see that the awareness among the people about AIDS is growing year after the year. And there are 2 major systems which are affected by HIV, that is immune system and central nervous system. In immune system also, T cells are more affected by than B cells. So in T cells also, it shows selective tropism for CD4 plus cells. So test which is diagnosing HIV, test used for diagnosing HIV is ELISA test, enzyme linked immunoassay. It is used to detect the antibodies in the blood. And there is no cure and there is no treatment. There is no cure and there is no vaccine for AIDS or HIV till now. But there is treatment provided. That is, the treatment is antiretroviral therapy. It is providing the antiretroviral drugs for the patients who are infected with HIV. And heart is highly active antiretroviral therapy. It means it is a combination of 2 to 3 antiretroviral drugs. So here I have mentioned some examples, that is andazanavir, ritonavir, darunavir. If we talk about heart, andazanavir and ritonavir are given in the combination, like 300 mg of andazanavir plus 100 mg of ritonavir is given in the combination to the patient who is infected with HIV. These are the signs and symptoms of the HIV. And let us know some basic facts about AIDS. So AIDS and HIV, which are spread from person to person if they have sexual activity with an infected person, and with blood transmissions also by using the needles which are used by infected persons and from mother to the children, mother to her fetus, by breast milk or by amniotic fluid, etc. But there are preventive measures to prevent this HIV, like
Vaishnavi, time is over.
This 30
Yeah,
seconds.
okay.
So there are using of condoms or being faithful for a single partner is preventive measures, and there are stigma in the in our society that using of toilets or using of utensils used by the person who is infected, it is all false. There is no such cases, like HIV will not spread through urine or tears or like fecal matter. And here, but last but not least, it is a new drug which is approved by FDA, Cabanuva. This drug is the first ever long-lasting drug which is used for the treatment of HIV. It is taken once a month intramuscularly to the buttocks. This is my time guide. Thank you. Stay home and stay safe. This is Vaishnavi signing off. Thank you.
Okay, Vaishnavi, how long it takes for a HIV positive person to get AIDS?
Ma'am?
How long it takes for a HIV positive person to get AIDS?
Ma'am, it may take anywhere from 9 months to 20 years, and 12 years will be the median time. But the symptoms of HIV will start about in between 2 to 6 weeks, ma'am.
What are the symptoms?
Symptoms like long-lasting fever, like unexpected weight loss, and groin soreness, gentle soreness, and loss of appetite. And also the main thing is depletion of CD4 plus cells count.
What is the principle involved in ELISA?
Ma'am, it is enzyme-linked immunoassay, ma'am. It is used to treat. It is used to detect the antibodies in our blood. HIV antibodies.
Okay, Vaishnavi.
Yes, sir.
Some suggestions is you see these colors you may have kept in this font is not visible. Actually, it should not be like that. Okay. Even some lines we are unable to caused by you have written first line we are unable to read because of the color. So when you are keeping colors for these text, so take some precautions, okay? Because you need to consider the color blindness people also. See, don't think that I have a color blindness.
No, sir. No, sir.
But there are people who cannot identify the colors. Okay, that is one thing.
Sir,
And
as a poster, I want to present it like more vibrant, colorful.
Your presentation is very good. Actually, you have a lot of confidence in your voice, and you have very good voice also. So its presentation is good, but even preparation also, slide preparation also should be. You should take some precautions, and there are no references in your poster.
Yes, sir.
Okay, so that is the another thing, and stay home, stay safe is not suitable for these AIDS. Actually, you should say that there is a safe sex, single sexual sex partner, and safe sex is the final message you should give to this topic. Actually,
as it is running time, sir, I want to just convey that message.
Yeah, true. That you can tell oral, but if you are keeping in the slide means poster means it indicates that related to your topic.
Yes, sir.
Okay.
Thank you, sir.
Okay.
Yeah, next presentation.
Yes. So let's move on to our next participant, who is U. Bhargavi from B Pharmacy, 4th Sem.
Good evening, one and all. I, U. Bhargavi of B Pharmacy 4th Sem, is here to present a poster on urinary tract infections. Ma'am, the slide. I can't see the slide. Okay. Okay, good evening, one and all. I'm here to present the poster on urinary tract infections. Urinary tract infections are also known as UTIs or cystitis, which are usually the infections of any part of the urinary system, that is the kidneys, ureters, urinary bladder, or urethra. It is also associated with the inflammation of the urinary tract. When the infection affects the upper urinary tract, that is known as upper UTIs, which include acute pyelonephritis, chronic pyelonephritis, interstitial pyelonephritis, renal abscesses, perineal abscesses. When it affects the lower urinary tract, then it is known as cystitis, prostatitis, and urethritis. These are classified into two types, that is complicated and uncomplicated. Well, it is complicated when it has underlying structural, medical, or neurological diseases. It is uncomplicated when it has no underlying renal or neurological diseases. The epidemiology is that it was first discovered in the Egypt in 1550 and is the most common virus up to date. About 150 million people per year are affected with this virus, with an annual incidence of 12.6% in women and 3% in men. It is mostly affected to women because the urethra is shorter when compared to men. The causative agent for this infection is Escherichia coli, which is the most common thing, and 80% of UTIs are caused by this. The rest 20% is caused by Klebsiella proteus, Streptococcus faecalis, and Staphylococcus saprophyticus. The risk factors include female anatomy, obesity, sexual intercourse, diabetes, menopause, catheterization, genitourinary malformation, immunosuppression, urinary tract obstruction. The signs and symptoms, the pathophysiology includes the contamination of the periurinary tract from the urethra, which further colonizes the urethra and the bladder. The inflammatory response, followed by the neutrophil infiltration, which forms the bacterial multiplication, causing the immune system evasion. Then the biofilm is formed on the bladder. Then the epithelial damage of the bladder tissue is done. The bacteria is further ascended to the kidneys. The bacteria is colonized in the kidneys, then resulting to kidney failure sometimes. And as it goes, it can even reach the blood vessels, causing bacterioma. The signs and symptoms include dysuria. Yeah, 5 minutes. Dysuria, frequent urine, urgency to urinate, nocturia, hematuria, and also loin pain, fever, vomiting, nausea, etc. The investigations are done using the urine dipstick method, urinary microscopy, FBC full blood count, EUC and blood cultures. The management and treatment are done by oral antibiotics. For lower UTI, oral antibiotics for 7 to 14 days. And for upper UTI, IV antibiotic treatment with oral antibiotics for 10 days. For both the UTIs, hydration is the must and paracetamol is used for pain. The commonly used antibiotics are trimethoprim, sulfamethoxazole, etc., amoxicillin, nitrofurantoin, and cephalaxin. The preventive measures are by taking proper hygiene, drinking plenty of liquids, especially water, drinking cranberry juice, and avoiding potentially irritating feminine products. It is proven that drinking cranberry juice reduces the effect due to as it inhibits the adherence of the P. fibriated E. coli to the urothelium and decreases the virulence of the bacterial cysts. That's it. Thank you.
So what is this menopause? What do you mean by menopause?
Menopause is the stoppage of the menstrual cycle.
So how it causes this UTI?
Because,
any idea?
No, sir.
Because so the menopause, during menopause, there will not be any the estrogen secretion will be decreases significant extent.
Okay.
Then what happens is the urethra becomes dry, so that should not be actually. So even you can you mentioned somewhere what is this FBC and EUC?
FBC is the full blood count, sir. If the WBCs are high, then it shows the person has urinary tract
FBC.
infection.
FBC.
Full blood
Okay.
count.
EUC
EUC is electrolytes, urea, and creatinine tests, sir.
means what?
Like the presence of electrolytes in the urine, the presence of electrolytes, urea, and creatinine in the urine shows the presence of urinary tract.
ఎంత ఉండాలి
99.
మరి ఉంది ఇంకేం
Yes, what are the risk factors for UTI? Risk factors. How a person
Risk
gets
factors are female anatomy, obesity, sexual intercourse, diabetes, menopause, catheterization, etc.
What are
Which food we have to avoid during this condition? What is the food effect on urinary tract infection?
I don't know, ma'am.
Okay, my next
we
presentation.
should also put some references. Okay.
Okay. Thank you.
Okay, let's move on to our last presentation for today for e-posters. It is done by Lisa Patel from B Pharmacy, 4th Sem.
Yes. Okay. Am I audible?
Yes, Lisa, you're audible.
Okay. So, good evening, respected principal, guest lecturers, faculty, beautiful seniors, active juniors, and my dear fellow friends. So, if you are like, if you are being tested positive for COVID, or if anyone around you, then just quarantine, take medications, and keep smiling. Okay, now the disease we're gonna talk, infectious diseases, diphtheria. Diphtheria is a very serious infection that is caused by a bacterium called as Corynebacterium diphtheria. It is the mode of transmission is just like respiratory droplets, coughing, singing, sneezing, and touching the infected open source. So now, if you just analyze what I said, we can understand that diphtheria is of two types: respiratory diphtheria and diphtheria skin infection, which is also called as cutaneous diphtheria. So, what are the pathogenesis of this disease? The pathogenesis is same for both of them: cutaneous skin infection and respiratory diphtheria. That is, see, Corynebacterium incubation period is 2 to 5 days. That means once the person who has sneezed and you have inhaled it, then that what is Corynebacterium will take 5 days of time to show the symptoms. What it will do in the meantime? So it will release active exotoxin that is called as diphtheria toxin. Okay, so this diphtheria toxin will have two components: A component and B component. The B component will attach to the cell membrane, and A will get into the cell, and it will take up all the activities of the cell. So we also have read about protein synthesis, like ribosome is the one which synthesizes the protein. So what it will do is cytotoxin A factor will inactivate the elongation factor, which is necessary for the protein synthesis. Therefore, it inactivates the protein synthesis, and this will cause cell death. In such way, very many number of cells will be affected, and many tissues will be dying. After what happens after that is it will form a thick mucous membrane over it, white color. Then it will turn to grayish color. Then it will turn to black color. Why? The severity of disease is increasing. So that when it will turn to dark black color, then it will be called as black diphtheria. Okay. So the same thing is for respiratory and cutaneous diphtheria. But what is the difference? As we can see, respiratory means only the organs which are involved in respiratory system are affected. So what is happening is, if you have inhaled it, there will be chances of infection in your nose, your tonsils, your voice box, and throat, neck, the lymph nodes present in the neck. So if you see the diagram below, next slide, the images. See, the first person is infected in his tonsils. That the diphtheria is infected in his tonsils. In the same way, the fourth picture, if you see, there is a person with a swollen neck. Okay, so what happened is his lymph nodes are affected. And for skin infection, what happens is that diphtheria will infect your skin. It will enter into it and it will form lesions and sores. So what is lesions and sores? I'll tell you. Sores is nothing but just a little bit of your skin is infected with inflammation and pain, whereas lesions is the one which will cause abnormal damage to your tissues. So the person, you see, he is infected in his legs and all. What happens, and then we'll see about the symptoms. Symptoms are sore throat and swollen gland, difficulty in breathing, wheezing, coughing, and all. The complications, I'll tell you, once the respiratory system is infected, what happens is you can't be able to talk, swallow, breathe, like that. Okay, and then what happens if you are infected to your skin? It will that toxins will enter into your skin. Then it will enter
Lisa,
in
your
your
time is over.
Okay, so it will enter in your blood and nerves, and it will cause so many complications. Then diagnosis is just like coronavirus. They'll take a swab and it swab the back, throat, and neck, and they'll test for bacteria. Otherwise, they'll take the sample from that skin and they'll grow in a medium. And then, for if it is having toxins, then it is diphtheria positive. Then the next slide I have given is about treatment and prevention by antibiotics and toxins, vaccination, the marketed drugs that are available, the latest drugs, clinical trial drugs, and the reference site. Thank you.
So do we have any?
Yeah, madam, you proceed, madam.
No, sir. You can proceed.
Yes, Lisa, your presentation is quite confident. In the first slide, what is the organism causing diphtheria?
Corynebacterium diphtheria, ma'am.
Yes.
It's a bacteria.
D should be small letter, okay? It is the basic, like you have to write it D.
Okay. Yes, ma'am. I got you, ma'am.
Okay. What is the treatment for diphtheria?
Ma'am, I've given there, it is by antibiotics, antitoxins also, because the main thing is toxin. So we have antitoxins, antibiotics, and the prevention is the vaccination. Antitoxin is, it is like we can give penicillin, ma'am, we can give erythromycin. And if a person, for example, say is having allergic to both penicillin and erythromycin, then we have also alternative therapies like rifampicin, clindamycin, erythromycin, and azithromycin. You can give it to that.
How many days can we recover?
Yeah, ma'am, it takes 14 days totally if it is by antibiotics and antitoxin.
It can be completely recovered.
Yes.
What is this antitoxin?
So this is something which is, see, for example, diphtheria will metabolize toxins to be something. If you want to kill that toxin, we have made antitoxins, sir. Antitoxins like anti-diphtheria serum.
The toxins cannot be killed. Toxins can be destroyed.
Destroyed.
Toxin is produced by a pathogen. Toxin is not a pathogen. Toxins.
Yeah, so that's what I said. That Corynebacterium, during its incubation period, it will metabolize and form toxins. To eradicate that, we'll use antitoxins.
Okay.
Okay, what do you want to tell about the clinical trials over there in the slide?
Okay, yeah. So what happens is these I have shown phase 1, phase 2, phase 3, and phase 4 clinical trials are going on. So what is the difference is there are some side effects in our drugs which we are using. What they are doing is they are trying to reduce the side effects. Also, they are trying that if we give diphtheria, it will also can cure some other diseases like polio in that way. They are just increasing the where we can also like cure the other diseases. The range they are increasing.
Yeah, it's nice. Okay, so what is the next? Richa, proceed to the next program.
You, sir.
Yes, sir. So we have come to an end for e-poster presentations for today. I would like to hand over to Richa.
Thank you. Thank you to all the participants also. Sir, shall we move on to the debate?
Yeah, if Farm
Okay,
students are ready, first year and second year students, so I will give the topic.
Okay, sir. Family first year, second year, whoever are willing to participate and whoever gave their names, can you please introduce yourself?
Sonia and KGF from first year.
Okay, sir.
And Akanksha, Gauri and Hasmita from second year.
Okay. Okay, sir.
So tell them to be ready. Now the topic is pharmaceuticals versus nutraceuticals.
Repeat once again.
Sir, Venu sir, let us make some alteration. Allopathic drugs versus homeopathic drugs.
Okay, sir. Okay.
Okay, sir. Allopathic drugs versus homeo medicine.
Okay, sir. Okay.
Sir, who is pro and who is against, sir?
PharmD first year people are favoring homeo medicine, and PharmD second year students are favoring allopathic medicine.
So we can start.
Yeah, start.
As homeopathic medicine useful, and this medicine is mainly by the people. However, there are many homeopathic medicine. Also, there are more courses which are homeopathic. People are going to eagerly to learn about the homeopathy, because here the whatever the medicines are there, they have been generalized and they have more effectiveness when compared to other medicines. So people are very trusted. First important, as a news article, so many news homeopathic medicine not have any side effects. So people trust is use the homeopathic medicine. So, people are mainly prior to this homeopathic, and the course is been approved by the government to do the homeopathic course, and the medicines are been very generalized and effectiveness, no side effects when compared to other, and the doctors have been more in this course, and there are more homeopathic course when compared to the allopathic course. So homeopathic
the other team should speak now.
Homeopathic medicines are been
Okay,
prior
sir.
to other.
Okay, sir.
Is better when compared to other.
Akanksha team.
Yes, ma'am. So good evening, everybody. My name is Akanksha. I'm from PharmD second year. So I'm speaking towards against homeopathy and towards allopathy. I consider as that allopathy medicines are more effective than homeopathy, and it can allopathic medicines can be giving a promising and more permanent result when compared to homeopathy. For example, if we come in case of cancer, that allopathic medicines are considered to be given to in treatment than homeopathy.
But treatments of cancer are being carried out by homeopathy also, na?
Yes, but more effectiveness is seen in allopathy.
Irritated bowel movements and some treatments which have been done by diagnostic homeopathic medicines are being done. So, like diagnosis, like Elisa, this diagnostic cured when we take homeopathic medicines also. So, no, we don't need any diagnosis. Homeopathy medicine is only one.
And first it was homeopathy only, na? In India as well as in other countries, first homeopathy was only there and is there.
Allopathy is considered to be giving more instant results than homeopathy. If a person is suffering from some chronic disease and he needs a treatment very fast treatment, so he'll prefer allopathy than homeopathy.
Yes, I would like to add that allopathy medicines are also giving relief from the symptoms, which gives a mental stability to the patient that he can be recovered from the disease state easily. It gives a
Even for a
promising
normal
role.
that is an allopathic medicine.
Yeah, now first years should conclude.
Yes.
Taking homeopathic medicines is not the problem is not because the maximum curable time for the homeopathic medicines is just if you take any drug about 1 hour the medicine that what disease you will get it will be cured completely. And bowel movements will be cured by homeopathic medicines only. This course only the government has been more approved when compared to other courses. So this is the only reason wherever we go homeopathic these drugs are only be used like in Andolan brand homeopathic drugs. Any homeopathic drug, homeopathic doctors only be getting more,
చేసేసాను
doctors. So this is the only reason where we'll get
6:30 వస్తాను చెప్పు
is only best.
And also allopathic drugs use the formula for homeopathy. Like, for example, if there is any paste, etc., they will try to use toothpaste, etc. They will try to use what are the qualities of like babool and miswak and all. They'll try to use this in that. So they'll do this for drugs also.
So it's not about curation. Curation is just only 1 hour. If you take any drug, you will be cured very soon. And no side effects. So what the patient needs better than homeopathic medicines are very better than compared to it.
And also homeopathic are used in allergics and
Okay, ma, it's done. It's done. It's done. Your 5 minutes time is over. Now, the next teams, third year from third year. Megharshini, Tejasvi, and
Sir.
Sanjana. Sir.
Third and fourth also I will give one topic.
But
With your
fourth years
permission.
have not given any names, sir. Fourth and fifth years have not given any names. If any
Achha.
fourth years
So
or fifth
direct
years are
final,
ready,
huh?
then we will have.
Otherwise, direct final.
Yeah, then final is between the winners of the previous one and third years. Then any fourth years are ready to participate in debate, or fifth years? Form D fourth years or fifth years?
Okay, sir. Already 6 o'clock. So they have not given means leave it. So we will have the last one. If the decision is being taken, there is time means I will talk something else.
No, just 1 second, sir. So Anuradha madam and Shravya madam to declare the winners of the Form D first and second year.
So 1 minute, sir.
Dr. Anuradha madam will do the
Yes,
honors.
1 minute.
So meanwhile, third year, so Megharshini, Tejasvi, and Sanjana should be ready.
Only one team, no, sir?
Yes, sir.
Yeah, only one team. Megharshini, Tejasvi,
So there's
Sanjana.
another student participating in
Yes, sir.
Family also.
Yes, sir. I'm
Sir,
also.
there's another student participating from family third year, sir. 4 students are participating, sir. Is that
Maximum is 3 only.
Okay. Okay, it's okay. Then this side also fourth one should be there. Venu sir, you take the decision.
Venu, sir. Hello. Venu, sir.
Madam, Anuradha madam.
Sir. Sir, only one team is there, sir. From third year, one team is there, sir. We'll ask them to talk pro and against based on their points. We'll decide, sir. We'll decide one team, sir.
So what we do?
First, second, and
Those four girls will become two teams.
Venu, sir.
Yeah, madam.
Hello.
Madam, what we do is madam, can you hear me?
Madam.
Sir, చెప్పండి, sir. Sir, only one team is there, sir. From third year, one team is there, sir. We'll ask them to talk pro and against based on their points. We'll decide, sir. We'll decide one.
Yeah, madam, can you hear me now?
Yes, sir.
Yeah, madam, what we do now, third year anyway, the fourth and fifth year students are not there.
Okay.
In third year, four girls are there. We will make two teams and let them speak.
Okay, sir.
From that, we will pick up one team and then they will compete with the previous winners.
Okay,
Previous
sir.
team.
Okay, sir.
Sir, you give topics, sir.
Excuse me, sir.
Yeah.
Excuse me, sir.
Yeah, Megarson, tell me.
Sir, we are three, sir. We can participate as three. Is
But
that
just
fine?
now said another student
Yes,
is there.
yes, sir. Now she has network issues, so is that she has
Okay.
left the meeting, sir. So
Okay.
So,
So
we'll
now
do, we'll do one
Madam,
thing, sir. We'll ask them to talk for 2 minutes pro and against, sir. Based on their points, we'll decide, sir.
okay, madam. Okay.
Okay, sir. Let them talk, sir. 3 members. Megarshini, continue, ma.
Ma'am, topic, ma'am.
Sir will give.
Yeah.
Okay.
So vegetarian food
Venu,
versus
sir.
non-vegetarian. Sir, yeah, you want to give, sir?
No. The final one I will give that talk.
Yeah, vegetarian food versus non-vegetarian food. You talk.
Sir, should we talk supporting it or opposing it, sir?
So individually, you give 1 point opposing by 1 point supporting.
Okay, sir. Good evening, everyone. I'm Meghashni of PharmD third year. I would like to introduce my teammates, Tejasvi and Sanjana. Please introduce yourself.
Okay, I'm Sanjana of PharmD third year.
I'm Tejasvi of PharmD third year.
I think non-vegetarian food is equally important as vegetarian because there are few proteins which we get from eggs and non-veg items and seafood is also very important to be included in our diet.
Okay, should I start?
Yeah, sure. Continue.
Okay. There is nothing. Okay, even I want to say that vegetarians and non-vegetarians both will have like proper balanced diet. Vegetarians will get the proper balanced diet with all the leafy vegetables and all their great proteins and all. And when it comes to non-veg, even the egg and seafood, they are also beneficial. And I feel that both are fine, like vegetarian and non-vegetarian.
Vegetarian food diet is also better as their chances of contracting the disease are very less. The nutritionists also recommend an egg per day, a single boiled egg per day, it depends. That is also very important in a diet.
Yes, I guess both are equally important. Like everyone has its pros and cons. But I guess non-vegetarian is more important in getting the proteins because all the vegetables don't give you enough proteins that you would want. Whereas non-veg food like egg or chicken can give you easy amount of proteins.
Okay, but vegetarian, non-vegetarian food involves sacrificing animals. Nobody is pointing out that.
Yes, sir, but it's also important in maintaining the ecosystem, no, sir.
But there are those who are not pure vegetarians also. They are very brilliant and very nicely excelling their professional career.
Yes, sir, but we are not saying that vegetarians are not.
Vegetarian
we
is
are
a very
supporting both,
beneficial, nutritious food. It
See,
lowers
in the world, there are pure vegetarians, but there are no pure non-vegetarians except lions and tigers. Do you know that?
Yes,
Yeah.
sir. Like vegetarian food
See,
is
you,
very
all of you are telling
nutritional
that it
and
is
beneficial.
equally important. All of you are telling that it is equally important. But if it is equally important, how the pure vegetarians are surviving?
So green leafy vegetables and the vegetarian foods are very nutritious. It like the vegetarian food is very nutritious and beneficial. Like it helps in lowering the saturated fat, cholesterol. It has like many dietary fiber items.
Okay.
It even saves the animals. Like we just can't. There are many people who see animals and just eat them.
You see,
Yeah. You want to add any point? That's all. Sanjana, that's all.
Yes, sir.
Right. You can speak a lot about this topic actually. You know, now vegetarian food also can cause food poisoning equally when compared to the non-vegetarian food. You said non-vegetarian food causes infectious diseases. Yeah, that is true. But vegetarian food also can cause, because it will have a lot of contaminants if it is not properly cleaned. So it also can cause a lot of food poisonings. No. Okay, so Anuradha madam, now it's the point of.
Fine. Yes, sir. Now, final is between first years and second years only, sir.
Okay.
First years and second years only, sir.
Okay, madam. Okay. Right.
Again, yes, sir.
Now, first years and second years, please be ready for the final competition, and director sir will give the topic.
Topic. Sir,
Sir,
will give the topic. Sir,
sir,
please,
request you to give the topic, sir.
Sir, I just got a idea that. Okay, so this is the final one, no? Okay.
Yes, sir. Final one between family second year and third.
So there are
first years.
Yeah, there are conditions that you should not take the name of a political leader. You should not take the name of any party, whether BJP, Congress, or anything. Okay, you should not take any name of the party or politician. If you take it, then you are disqualified. Immediately, the other person wins. Suppose you are the chief of the country, then will you impose lockdown to settle this particular ongoing pandemic, or without imposing lockdown, you are more bothered about economy? So it is more of economy versus controlling pandemic. Okay. So first years will talk saying that it is lockdown is the best strategy. Okay. And second years have to talk that lockdown is not best strategy. You have to take some measure, but lockdown is not at all a proper one. Economy problem. Okay. This is the topic.
Okay.
For family first year, once again, can you please repeat?
Family first year, lockdown. Lockdown is the best. Lockdown is the best. Okay, second years, not best.
So you have to cover impact on all industries, education, and everything. Okay.
So now initially, first years will speak for 1 minute, and then the second years will speak for 1 minute, and there will be 2 minutes discussion, and finally 1 minute for conclusion. So total 6 minutes duration. Now it is 6:10, and your time starts now.
Yes.
First year.
Good evening, myself Tejas. So lockdown I'm from family first year, so lockdown is essential for this pandemic because nowadays health is wealth for anyone. Like if health is good, we can do anything. We can earn money. We can do economic. Everything is very good. So if they keep lockdown only, it will be better. We can think.
Yeah, actually, whatever we do, some people are not listening and they are roaming unnecessarily. So it is important to impose lockdown so that the one who don't want to uh, uh, be at home will also be at home only. If it is lockdown, or else they will roam on roads only.
It is not only necessary for the purpose because in news I saw that if murder cases, if we used to kill, so if home if there is a lockdown, increase of that murder cases will. So as part, the India is concerned of most these cases like these issues like murder cases. Recently, I heard a news that in Haryana at early morning 8 o'clock, two people killed a farmer because of some issues. So if there is a lockdown, there will be no such issues like only like these issues like kidnapping, some rape issues. So this all when only morning and even to night, if there is lockdown, no such cases happen, and the economy of the globe will be decreased. Economy of the globe will be increased, and the people can able to learn the discipline that how to talk with parents. They will be easy to communicate. The communication skills will be easy for the parents between children and parents or there is a lockdown. If no lockdown, they will be roam around and some issues will be taken place like accidents. So that's why it affects economically and mentally, physically all. If so, better if there will be one lockdown throughout the year. So lockdown is more preferable.
Good evening, everybody. My name is Akanksha, and I'm from family second year. Today, I'm going to speak against the topic, like against lockdown, as we know that our Indian economy is decreasing because of the lockdown of many countries, and we can see that even if we are in lockdown, that people are being affected by COVID, who are even staying at home. So it is not about if a person should be in lockdown or not. It is following COVID regulations with caution. Like everyone should wear a mask. If you're at home, if someone is affected in your family, then what are you going to do? You're going to follow COVID norms and regulations, right? So it is not about the lockdown, but the regulations that we have to follow during the COVID. And we can see that people are going into depression sitting at home. So how can we say that just having a lockdown can decrease the cases of suicide or someone getting
there is some entertainment purpose also, no? TV is there, mobile is there.
Yeah, but like if a person has to go to work, how can a person earn for his family? How will he earn for his family? In some cases a person cannot do work from home.
At home.
In some cases, people are not able to do work from home. They have to go to their workplaces. Like, for example, in hospitals.
This is not the first wave of COVID. This is a second wave. So everyone is anyhow prepared that a lockdown can be imposed. So if it is imposed, there is no such problem like about
we can prevent by wearing masks, face shields, and also sanitizers at regular intervals. That can decrease.
See, we can see many cases. We have seen many cases of people getting COVID even by sitting at home. But we have seen that the person who is following
person roam outside, the cases will be more.
We can see that the person who is following COVID norms and regulations. Like we can even see some doctors who are not infected by COVID, even if they are serving in COVID wards. Why is this happening? Because they are they're following the COVID norms and regulations. It's not because of the lockdown.
But doctors are wearing the whole PP kit now. We are normal people. We are not having that whole PP kit. And anyhow, this some people are there who can't, they can't stop themselves from roaming around and like that. Some people are like that. So we need to impose lockdown to stop those people.
So we
They will
have
not
lockdown
follow.
in the
Yeah,
night
yeah, yeah.
for this.
Just
Lockdown
once again,
following the
please, please
virus,
stop.
it all
given by the
Now,
WHO.
second years needs
communication.
to
Spreading
conclude.
of the
The
virus.
protocol.
Second
Because
years
of
needs to
the
conclude.
it is very important to
Also,
bring the awareness among the people, not the lockdown.
and the cases like this murder, this and also decreases. No, when we are in lockdown, if we go
Yeah,
roam
please stop.
outside, the
Please.
really increases. Nowadays,
Sonia,
not
just a
happening
minute.
like that
Just a
only.
minute. Just a minute. Now,
Just I
second
think
year
this is why
students
this
needs
is
to conclude. Second year students needs to conclude.
Yes, sir. So I would speak against the lockdown because people are getting, affected mentally by sitting at home, and even their health is being affected. And it is not that we have to sit at home to, it is not only that we have to sit at home to control COVID. It is also that we have to follow the norms and regulations of, the pandemic, which is implemented by government. So it is, and our economy is also decreasing. So it is, in some cases, we have to be going to work. It is not always that a person can do a work from home.
Right.
So I would like to conclude with that. Thank you, sir.
First years.
It is better if we have lockdown because it doesn't matter if we have
lockdown
it
is
doesn't
better
matter
because
if we have life or
Any one of
because
you.
the first
Any one of
reason
you.
is, sir, I am concluding. The lockdown is better because there are many reasons. First reason is the cases like this murder, this and kidnapping. First of all, it will be decreased, and second one is communication. Communication is very important between family members. And when coming to the entertainment, as you said that when during the lockdown, the depression will be more. There are many entertainment like mobiles and laptops, TVs.
But we can't do it regularly.
And
right?
also,
No
and also,
countering.
And also,
Only
people
conclusion
are
time. Please
and
don't
also
count.
we are learning new things in lockdown. We learn to
We can
cook, we
learn
learn to
more things
cycle,
like cooking.
more
We
things.
can learn
Yeah.
more things like cooking in lockdown, and those who didn't have an ability to, they can learn cooking, and they can they can improve their skills in lockdown. This is the first reason. They can improve their communication skills and the talent like dancing. This all can be improved in lockdown. So lockdown
We
is
can see
better.
people roaming during lockdowns also now.
Yeah, but now government has they are told now that
Yeah, please stop discussion. Please stop discussion. Now it's over. Yeah. So we will very soon we will declare the winners for Farm D. And Anuradha madam, what to do with the B Farm, because only 2 teams were there, and in that I think we can.
Sir, we'll declare 1 and 2, sir. 1 and 2. Final years, the first, sir.
Okay.
Okay, next is the second year. Second year, sir.
Okay.
Okay. That is final, sir. And farm day, I'll tell you, sir. I'll give you a message, sir.
So in B Farm debate competition,
teams,
final
final
year,
year.
4th year students are the winners.
Sir,
Director Srinivas sir. Srinivas sir, what to do now? The next program. Can we proceed or will
I think
we stop here?
I think all programs are over. So it's like on Sunday we are having one career opportunities webinar at 10 o'clock, and the speaker is from Canada. So that is the reason we are conducting on Sunday, and I will text the messages in the group like watch out and all that, something important, all that I will communicate in the groups. Okay. And this particular Sunday webinar, everyone will definitely enjoy. And he is a person who will help you after the webinar also, wherever you have problems in, while going abroad, university selections, or even PharmD project selections, in project, any issues. So he'll be like a resource person for the college, So let us meet again for a webinar on Sunday. And I thank each and every faculty member who have actively involved in the student activity, and students have done this event, and students have done from 9:30 to I think 10 o'clock to 6:30. So I appreciate each and every student who has joined in this particular conference. Hats off to the patience of the Vanitha students. I have never seen such students. Maybe before 2008, again in Vanitha only I might have seen, but never ever any. I think some never before, ever after. Okay, bye.
Can I,
Sir, what about elocution winners?
Poster winners, sir?
I think the staff member, faculty members will announce. Right now I am in driving, so Alvida.
Okay, sir. Sir, see, for Form D e-posters, the first prize goes to S. Sushma. Congratulations to Sushma. And second prize goes to, are you able to hear my voice? Is it audible?
Yes, yes,
Yes,
yes.
ma'am.
Yes, ma'am, you are audible. Okay. Second prize goes to N. Tirtha, Form D, 4th year. First prize goes to S. Sushma, Form D, 4th year. Second prize goes to N. Tirtha, Form D, 4th year. B Pharmacy e-poster presentation. First prize goes to Lisa Patil, B Farm 4th Sem. Lisa Patil, B Farm 4th Sem. And second prize goes to Rachna, B Farm 6th Sem. Congratulations to all the winners.
So congratulations all the winners behalf of the judges.
Yeah, thank you, judges.
Thank you,
Actually,
ma'am.
it's not the door.
Can I come in once?
Yeah,
Can
madam.
I-
Yeah.
Yeah, please. Yeah, good evening to all. First, I congratulate each and every one, all staff members who have really worked very hard.
Thank you,
It
ma'am.
was a very good, successful program.
Thank you, ma'am.
But last but not the least, I have one work for Dr. Venu.
Yeah, madam.
I want one poster presentation. You give a running topic, ask them to refer from the journals. It is just a trial basis. Any topic, ask them to refer from the journals 5 years back, or 2 years back, or 3 years back. So they will have the latest information.
Yes, madam. Yes.
This was running in my mind. So I thought, let me start with you.
Yeah.
So you select one student, either Shushma or Tirtha or anybody for that matter.
Okay, madam. Okay.
And then let us see how it works.
Okay, madam. Okay.
Second thing, I want the class in charges. I know I don't want to burden them. See, I've seen the names repeating. Srujana, Sushma, Tirtha. No new names are coming. Akanksha, Gargi. So we'll encourage all the students to speak only in their class. Suppose you take 4th semester. Maybe you're having 5 subjects. So at least in front of 5 faculties, they will speak. So I want everyone should be able to talk.
Yes, ma'am.
So I don't know how it will work. At least we'll start with 1 year. Like BPharm 2nd semester, we are starting from 3rd May. But they have got the ending date up to July or August. So long time is there. So any topic is taught, we'll ask each student to give for 5 minutes or 10 minutes.
Okay, madam. Okay.
And I think because everyone should learn how to speak. It is not winning. Winning is not our criteria.
Yeah.
These are scores that it is fine. But someone should stand first and second every time that happens. But everyone should speak. They are all spectators. No one is speaking. This is what I have observed.
Okay.
Okay, and one more thing. Do you want to take classwork tomorrow? Teaching staff members, do you want to take classwork tomorrow? Yes or no?
Tired a lot. Kind of heart, if you give permission, we will take all day, madam.
Yeah. So,
Yes, madam.
Yes, ma'am. Yeah. So tomorrow there is no classwork.
Thank you.
Srinivas sir will be telling. Okay, maybe.
Thank you, ma'am. Thank you.
Thank you, ma'am. Thank you, ma'am.
Okay. So
Thank
there
you,
will be
ma'am.
no
Thank you,
classwork.
ma'am.
It was really
I have
nice.
unmuted. Madam,
You have unmuted me.
I am in Panjagutta, Chavrasta, but still unmuted to announce this new good thing. Tomorrow it's holiday. Day after tomorrow, everyone has to come for webinar.
Yes, sir.
One more I want to announce, sir. This idea, this brainchild of having tomorrow a weekly off is Srinivas sir only. The idea he put in my mind, so I thought let's also enjoy tomorrow. Okay. Anyway, congratulations
students,
to
enjoy
all.
tomorrow, and Sunday you will enjoy much better than tomorrow. Okay, that's promised. And Sunday, I want all B Farm and Farm D to gather for career opportunity session. Okay, bye.
Bye, sir. Okay,
Bye,
thank you.
sir. Thank you, madam.
Thank you, ma'am. Thank you, sir.
Yeah.
Thank you, ma'am.
Debate winners.
Yeah, who are the debate winners? Please announce. Anuradha and Venu, sir.
Yes, madam.
Yes, ma'am.
Yeah, we are still there.
Yes, ma'am. Debate Farm D first years, madam. Actually, second years and first years equally participated, but only in second year, only one student is active participation is there, ma'am. Others not. So, in whereas the first years, all the 3 students they participated. So that's why more edge towards first years, madam.
Good, congratulations.
Ravi also gave the same. That's why Farm D first years are the winners, madam.
Okay, very good, very good.
B-Farms is hide final years, madam. Final years. Final years first and second years, second, madam.
Okay, very good, very good. First time my mobile went without charging. I have to put charging. Otherwise, I don't charge for 2 days. Today is the first time. It has to be recharged in a single day within 24 hours. Anyway, it was very nice. But only concern is I want something, like that research work. I mean, research articles, if you can find out, Dr. Venu.
Yes, madam. Yes, madam.
We'll try. And the class in charges, please look into it, that you can encourage every student to speak within our classes. Don't putting it on the larger platform once all at a time. Slowly, we'll ask them to speak in front of all the staff members. Because when one section is...
Yes, ma'am, we are doing the same practice for Farm D students, madam. In
Yeah,
lab,
but next
lab
time,
hours
I
we are
don't
doing.
want the same names to be repeated for debate or elocution.
Yes, ma'am.
We are
Let others
conducting
speak.
definitely implement, ma'am.
Let others speak, okay? So they will also feel, see, all are spectators. That doesn't look nice for them.
Madam, if you observe since the afternoon, the students who have presented posters, and most of them were speaking like a professors. Actually, they are very confident and very fluent in delivering the presentations.
So,
and I am
Yeah,
very
I
happy.
agree. I agree
Students
with you.
have very good actually the potentials, but they are not confident about themselves. Actually, that
I
confidence
agree. I agree with you, Dr. Venu, but they were reading. I don't want that. Next time it should be total oral.
Yes,
Eye to eye they should have with us. Because
Okay,
when they come into the offline posters, they don't have any material with them.
Yes.
See, this is the posters were excellent. The way they have presented or their concepts, the presentation in one slide, everything was different from one slide to the other. It's not like copying.
Yes, ma'am.
Everyone had their own idea, whether it is downloaded or whatever, I'm not bothered, but it was different and it was very nice. The colors, everything. But only thing is what you said, the confidence level is also good, but always the same students are there.
Madam, special mention for the anchors who have done really excellent. I cannot at the moment remember all names, but all the anchors and led by Richard, everyone has done well. And my favorite is prayers song. Excellent prayer song she sings, Apurva. Okay, so thank you all the students who got involved in the organizing this particular one. So I thank them, appreciate their skills. Thank you.
So that police
Thank
is
you, sir.
writing a
Thank you very
challan,
much.
sir.
Madam, the students are asking about electrician competition winners, ma'am.
Sir, I have put a GPS tracking for your car. Police are giving a challan. All the best.
Excuse me, madam. Students.
Ma'am,
Yeah.
students are asking about electrician competition winners, ma'am.
Elocution, who conducted it?
I think Shanta ma'am conducted.
You tell them we can announce it tomorrow and post in the group.
Okay.
We have that Telegram group. No, most of all the students are there.
Okay. Okay.
Or is Shanta in the line?
I don't know, ma'am, but students.
No, she is not there. Shanta is not there.
Okay, ma'am.
Okay, you tell them we'll inform you.
Jyoti madam, only 2 prizes for each event?
Yeah, only 2 prizes.
Yeah, first and second. That is enough, madam.
And participation certificate for all.
Okay, madam.
See, next time we'll plan it in a better way. Okay, like what we have to give as prize, and see that we give it immediately.
Okay, madam.
So either a book or whatever it is, we can think of it and do it.
Madam, you want to give prize online, huh?
Yeah, online, sir. We can deliver at home. No, that Amazon and sir, police is behind you, sir.
Madam, I stopped there. I reached destination.
Oh, but still you're at home now. Thank you.
Okay.
You're not in the traffic. Anyway.
Yeah. So thank you, madam.
Thank you.
And we will not disappoint you. Whatever you said will happen in near future. They will not see anything and they will read.
No, sir. I want to train them when it comes to offline.
Yeah, sure. That is true. That is true. What you said is absolutely true.
Because again they'll fumble, then we will lose. I mean, they will lose. College is not the thing,
Yeah.
They will lose. Anyway, okay.
Yeah,
thank
even
you all.
first year students are participating very good. They didn't come to college anytime, but we are getting involved with first years. I'm very happy.
Yeah.
Okay.
Okay. Thank you.
Thank you, madam. Thank you, sir.
Thank you.
Thank you, madam. Thank you, sir.
Bye all.
Good night. Good evening to everyone.